Good morning, everyone. The clock here says 11:02, but my clock on my computer says 11:04, so it's one of the two. Good morning. It's a public hearing today for the Government Oversight Committee. I'm going to call the public hearing to order. I'm going to ask my co-chair if she has any opening comments.
Thank you, Madam Chair. No, just nice to see the buzzing in the room and looking forward to getting started.
We have a packed agenda today, so I'm going to ask my ranking member if you'd like to make any comments.
Thank you very much, Madam Chair. Just looking forward to hearing everybody and having a nice public hearing. So, thanks.
Thank you very much. With that, we are going to hear 7 bills today. Senate Bill 423, an act concerning oversight over higher education. Senate Bill 424, an act concerning oversight of plans pursuant to Section 504 of the Rehabilitation Act of 1973 and special education needs in our state. Senate Bill 425, an act requiring annual state agency performance plans. Senate Bill 426, an act concerning government oversight of energy regulation in the state. House Bill 5474, an act concerning oversight of medical care for persons who are incarcerated at the Department of Correction. House Bill 5475, an act concerning oversight of the permitting process of the Department of Energy and Environmental Protection. House Bill 5476, an act concerning oversight of efforts to prevent human trafficking. And House Bill 5477, an act concerning the well-being of employees of the Department of Correction and persons who are incarcerated in correctional institutions. So with that, the first person on our agenda today is Representative Renee Lamarck-Muir. I see her in the room.
Good morning.
Good morning.
Yes, good morning, Chairs Gadkar, Wilcox, and Dathan, Vice Chairs McCrory and Gucker, Ranking Members Sampson and Carney, and all the members of the Government Oversight Committee. Thank you for this opportunity to testify on 2 bills today. So I'm going to testify on House Bill 5474, the DOC Inmate Healthcare Bill, and 5477, the bill that codifies federal PREA law. I've submitted written testimonies for both of these bills. House Bill 5474 will help to address longstanding deficiencies in providing health care to persons who are incarcerated in our state prisons and jails. These issues are systemic and warrant prompt legislative action. It's interesting that in the 1970s and early 2000s, legislative reviews of the DOC found many of the same significant issues with inmate health care. That led in 1977 to the inmate health care being shifted from DOC to Yukon Health. They started the Correctional Management Healthcare Program to improve services and reduce costs. However, that program was plagued by many of the same problems right from the beginning, and there was a lack of independent oversight of the $100 million a year contract. Fragmented care and several high-profile lawsuits resulted in the system being shifted back to DOC in 2018, and DOC has basically replicated their prior program. So that's why we are here today, facing the same problems. So we should not continue with a problematic inmate healthcare system. We should move forward toward an effective and accountable model, and I believe your bill does just that. The Division of Criminal Justice Policy and Planning within OPM is collaborating with the Department of Social Services, DOC, and legislative leaders such as yourself to craft a comprehensive strategy to enhance direct service, provide independent administrative organization, and require continuous independent evaluation, and to maximize reimbursements under two key federal Medicaid policies. So I urge you to support this bill and continue working with the Criminal Justice Policy and Planning Division on their strategy. House Bill 5477 codifies federal PREA, but it strengthens it with additional safeguards tailored to our system. And I think that's the important key in that bill. I believe the hotline will allow for confidential reporting by victims who are incarcerated, and the duty to intervene provision will hold correctional officers accountable and improve the system. The independent reporting will allow Connecticut to conduct better oversight than currently is provided under PREA audits. I strongly support the bill's provision to improve institutional culture and training through full implementation of the AMEND program, which is being piloted in DOC in a partnership with the Institute for Municipal and Regional Policy at UConn. We know that policies do not necessarily translate to procedure or culture. We also know that prevention is a critical component of any strategy to change culture and improve systemic deficiencies. Finally, we often hear that many of the problematic issues in our state prisons and jails are because DOC is understaffed. However, we don't have any quantitative analysis to determine appropriate staffing ratios based on inmate population and number of facilities. We do know that through criminal justice and correctional reforms, our inmate population is at a 23-year low, down from 23,000 to about 11,000, and we have closed several facilities. Yet we have roughly the same number of correctional staff. That may be appropriate and necessary. We just don't know. But DOC still has increased overtime, high rates of absenteeism, and staff injury. I know this is a complex question, but it's why the staffing assessment strategy in your bill is so necessary. Thank you, and I'd be happy to answer any questions you may have.
Thank you very much, Representative, and thank you for your written testimony. I know you have a background with the PRI committee, so you've done a lot of work in this area, so we appreciate your thoughtful testimony this morning. You had mentioned that in regards to 5474, you had mentioned that right now there's about 11,000 persons that are incarcerated in the state, and that is down from about 20,000. Is that correct, you said?
Correct.
Okay.
And that 23,000 is down from much higher number earlier in the late 80s and early 90s.
Do you know that about the type of crimes that these folks have had and what they're in prison for, in their sort of severity and sentencing? Really, the question is, I understand that a lot of the institutions that were closed were more like halfway houses and things for lesser offending inmates. Is that true, or?
I think it's across the spectrum. Persons who are incarcerated right now, sentenced people, they run the full spectrum of crimes, right? We have people in there for very serious violent crimes like murder or serious assaults, and we have people in there for very low-level nonviolent offenses. They just happen to have a high number of offenses, so for some reason, so they'll eventually work their way up into being incarcerated for a period of time. And they also serve a wide range of sentences. There are people that are in there with life without parole or very long sentences, 50 years or more, to people that are in there for 90 days, 180 days. And then we also have our pretrial, people who are in there who are not yet convicted, but for whatever reason, they either couldn't afford bail, or they're in there because there's not a program to place them in, or they have committed an offense, a public safety, and the court has determined they're a public safety risk.
Okay, great. That's helpful to kind of understand the dynamic there. You spoke a little bit about the study, a strategic study that we've talked about in our bill. In your experience in working with the system here in Connecticut and your research across the country, what do you think this study could help the DOC with compared to an internal sort of structuring strategic study?
You're talking about the staffing assessment study?
Yes, sorry,
Yes,
the staffing assessment study.
So I think it's important for an independent organization to come in and look at DOC. The people who work in DOC are highly trained and highly skilled at what they do. They don't do quantitative staffing analysis studies. So if you bring in someone with those skills, you're going to get a better product in the end. The reason it's important is because we don't really know. You know, we've had a lot of fluctuation in our population and the number of our facilities, and this is overtime in DOC is a long-standing problem. I mean, back in the late 80s, early 90s, it was an issue, and it's continuing, you know, so it's an almost 40-year problem. And why is that? We just don't have the answer to that. So I think it's important to get in there and understand how the staff are being assigned, what sort of staff are necessary. There's jobs in DOC that are 9-to-5 jobs, and there's jobs in DOC that are 24/7, 365 days a year. And each facility is designed differently. So the design, the sort of the bricks and mortar of a facility is going to determine the number of staff needed. Some facilities are more open, more congregate. The incarcerated people can move around, and some are not. So I think it's really important to get in there and to look at why some of the longstanding issues have not to this date been addressed. The absenteeism, the injury, the low morale, the overtime. Why is that? And if it is understaffing, then at least we would know how many staff we need to hire. My issue is that if we just say, okay, it's understaffing, and we say hypothetically hire 100 more correction officers, and then next year our overtime goes up by another $25 million, then we haven't solved the problem. We've just added more people working more overtime.
That's great. So in terms of an outside organization that would do such a study, can you kind of elaborate on maybe what other systems have used both in the U.S. and maybe abroad?
Yeah, so they develop partnerships with institutes of higher education. So here in Connecticut, the University of Connecticut has the Institute of Municipal and Regional Policy, who's done a lot of work in the criminal justice system, specifically in DOC. They are the ones that are piloting the AMEND program. We also have a really key program here in our state government. We have the Division of Criminal Justice Policy and Planning in OPM. And that's their job. It's in the title, right? Their name says what they do. So I think together, a partnership between the Division of Criminal Justice Policy and Planning and the Institute for Municipal and Regional Policy, you have the institutional knowledge, you have the expertise, and you have the access to the data necessary in DOC to do this study.
That's helpful. Do you know if those sort of studies also kind of look at sort of mental health issues that maybe some of the staff are facing? We hear over and over correction officers are facing a lot of challenges, and there's not a lot of resources for them to get help. Would that study address this?
Yes, I mean, I think any good well-designed study would do that. They would look at, for example, take the issue of employee absenteeism, the high rate of people just calling out from work. And so why is that? And they'll drill down on the factors that contribute to that. They'll also look at the systems in place, training, employee assistance programs, employee wellness programs, to try to get those numbers down to a level that's more manageable, that contributes to the production of the department.
Okay, that's super helpful. Are you, you may not even know the answer to this, but how much would a study like this cost the agency?
I don't know the answer to that, but I know that OPM, the Division of Criminal Justice Policy, and OPM, they're there. They're staffed. They're ready to go. And so is the Institute of Municipal and Regional Policy. Yeah, and there's all, they could look for grants or they could get state funding, but I don't think it would be an exorbitant amount of money compared to potentially the savings to the state and the better operation of the department, which would lead to things like reduced claims and better management.
Yeah, we have a huge workers' compensation claims for the department, and I know, this might be one of the solutions to help address that issue. Also, I've heard anecdotally from COs who said, they really don't feel that they have a mechanism to kind of share maybe what's going on. In your exposure, and do you think the study would help give the department some ideas to ensure that COs get the ability to log complaints, make any notations without it hurting their records so very anonymously?
Yeah, I mean, employee assistance programs would do that. I mean, correction officers have tough jobs, right? Like, they're in a prison every day, and it's a dangerous job. And I've never worked as a correction officer, but I worked as a police officer for many years. And there is a stigma for reaching out for help, but when you have, and the departments I worked for had very good employees assistance programs, and there was confidentiality attached to that, and there were services, and so when you reduce the stigma and you make it easier for employees to access those programs, then they will.
Well, that's good to hear, because I think as part of this whole bill, the sort of feeling behind it is we need to ensure that our corrections officers have, adequate training for what their job requires, and also resources to be able to, help folks. You did.
I think
sorry.
if I could just say, I think by your provision to expand the amend program, that would get it just that too. So by changing the culture and improving the training, it's not only going to help staff, but it's going to help the people that are incarcerated there, the volunteers and the contractors that come into those facilities to provide services. So if you change that culture, right, it's just going to make it an easier place. It's still going to be a difficult job. It's always going to be a difficult job. But you can make it easier for people.
Thank you. And I was actually my next question was about the amend program, and I understand it's right now it's being piloted. Do you mind explaining to the committee what the amend program is, what it does, and how many folks are participating in programs like this?
So I believe that the director of the Institute for Municipal Regional Policy is testifying later, and he could probably go into more detail on that. But the program's being piloted in 2 facilities, York and Garner, and they're working with the DOC Training Academy. And they have, so the correctional officers in those facilities are going through this training. So it's more of a collegial model, right? So it provides advanced training for correction officers. It provides ways to de-escalate, teaches ways to be empathetic, communicate. So it sort of shifts the paradigm of being, to use old-fashioned words, right? The guard and the inmate, right? It's more of a correctional model, right? It's more of a rehabilitative model. And so when the staff buy into that, it just changes that culture, and then their working relationship with the people that they're supervising.
It's good to hear. So in terms of any sort of results from these pilot programs, do we have any ideas on recidivism rates for folks that have been released and out in the community?
Yeah, here in Connecticut, I would defer to Mr. Clark on that. I think that would be a good question to ask him. I don't know if the program has been operating long enough for people to actually be discharged and then be in the community for a length of time. But if you look at other states in the country that are using this model, and then if you look at Norway, they have significantly reduced their recidivism rates.
Yeah, that was actually, because you did touch upon the Norwegian prison system, and, I think there was a good documentary on NPR here in Connecticut with a group of lawmakers and other folks that went over to Norway to see how their incarceration system works, and really get an understanding about the cultural change. And according to the video, it says that 30 years ago, the Norwegian correction system was very much similar to what we have here in the U.S. And Connecticut has some of the highest levels of incarceration in the Northeast, and we've done some work to reduce it. But if you look at what's happening in Norway, they also talk about prevention programs and funding for those prevention programs. I know this is something we talk a lot about in appropriations, not cognizant to this bill, but that was also part of the Norwegian model. I'm going to let my colleagues jump in because I'm monopolizing the questions. So thank you so much, Representative. Senator?
Thank you so much, Representative Lamarck Bier, for being here and for your testimony, which is very much appreciated. Just a couple of questions. I want to make sure I understood you correctly when you said we're, in terms of the number of individuals that are incarcerated, so from 23,000, we're down to 11,000, which is, so we've halved that number. And yet the staffing at the Department of Corrections is the same?
Basically, yes.
What justifies that? I mean, that's 50% reduction with the same staff. And one of the things that we heard when we had the hearing on the medical delivery of medications was a staffing problem and a staffing shortage. I'm just trying to wrap my head around how those percentages, and then the kind of the statements now that there's still staffing shortages and they're still under-resourced, how that all aligns when the population has been halved.
Yeah, I mean, I'm, as someone who comes from a policy background, and now a legislator, as they say, the math ain't mathin', right? It doesn't make any sense. But there may be a valid answer, and that staffing number that we have now may be appropriate. We just don't know. Like, nobody's ever done this study in the Department of Corrections. I mean, as a staff to program review, I did look at this, but it was over 30 years ago. So a lot of things have changed, including the fact that we have way more facilities now than we had then, and we had population of close to 30,000 back then. So different kind of problems because the numbers were different, but there's been so many significant reforms over the years that we've managed to get that population down. But the other interesting thing is our recidivism rate is flat, right? So we've gotten the population down to 11,000. We've, by all reports, our crime rates are down. But why is our recidivism rate still flat? Like, why isn't there that drop? So these are all really interesting questions, and they need people to look at them. And once we have those answers, then perhaps the solutions will become clearer. But right now, if we just start throwing darts, it's in the dark.
Yeah, absolutely. No, I appreciate that. Are there any, inefficiencies kind of built into the system now that you can think of? Particularly, I'm thinking around, human capital and labor that, for example, body scanners. If we introduced, and technology, so we talked about electronic tracking of medications. I'm wondering if we are not, and again, this is something to study, but whether or not there are inefficiencies now when it comes to actual labor that's going in that can be reduced. The body scanners, not to mention the kind of indignities that come with, that process, and would be a much better process to have a body scanner, but also would be a much more efficient process in terms of the labor required, not to have to do, invasive body searches. So are there other things like that where you can think of where in your experience that you've seen there are kind of inefficiencies in terms of the labor that's being put into certain areas that could be perhaps improved through technology or consolidation or just better oversight again on an administrative structure that would help reduce those inefficiencies?
I'm going to say, having worked in paramilitary organizations, there's always inefficiencies. Right. just like any organization, I'm sure, not to single them out. But specifically in the DOC, based on my history, which, I'll say it's not current. I haven't been in there in the last several years. But, inmate idleness is and has been a huge problem. But yet we have a whole network of programs and education. We have USD, the School District 1 in there. We have colleges in there. But they're not, but yet the inmate population is idle. The department uses lockdown as a management tool. So those programs are not being used as intended, right? So I know, that's another thing I know the Division of Criminal Justice Policy and Planning is looking at, right? Is the education bringing higher ed in. And so why isn't that more efficient? Why aren't there more incarcerated people going into those programs and completing those programs, right? So one of the inefficiencies has been moving people around. That used to be a problem. You'd start a program in facility A, and then your security level would drop, and you'd go to facility B, and they don't have that program. So there was always that problem, but now, just based on my experience now, we have more beds than heads. So we have that ability to move people around and to use our brick and mortar better, and to figure out what's more important, having someone complete a program or move them to another facility, to shift them to another facility, right? So that's an area that we can look at. And I think that the staffing study, along with just look at improving some of the systems, and we're at a unique opportunity now. I mean, it's public knowledge that we're looking for new leadership for the Department of Correction, and it's time to bring in a whole team, not just one person, but a team, to really look at all these systems and to work with the people that in our state government that are already developing strategies to improve these systems, and to move that forward rather than to just starting to recreate the same wheel, or just to go back and say, you know what, that's how we've always done it, that's how we're going to do it, because we get what we get.
Absolutely. No, very much appreciate your testimony. And just wanted your insight too on what you think about the position of a correction medical deputy ombudsman. I mean, with that, yeah, just your thoughts on that.
So I understand the goal, right? I understand the objective that you're trying to get, but from my perspective, the ombudsman is really more an advocate, right? They really deal more on a case-by-case basis. An incarcerated person is having a problem, whatever, right? Getting visits or making phone calls or whatever it is. And that's their role. But to look at, to sort of do quantitative systemic evaluation, that's really not their role. You'd have to build that out. And I think that there's already structures in place that do that, right? And there's other bills in the legislature now that are proposing to create structures that would do that. So I don't really think, you know, having come from a program review and an internal investigation background, that that's going to get you what you're intending to do.
So restructuring staffing, for example, or the oversight administration, that's another option instead of creating a new position.
Yeah, I mean,
Yeah.
I would turn toward OPM, right? Office of Policy and Management, right? I would turn toward that division and not necessarily just keep piling it on there, but to get their expertise in the best way to get the information and the research that you're trying to get at, which I think I see where you're trying to go, and that's important information to get. I just really don't think you're going to get it by just creating another position that's not going to be staffed, not going to have the staff, the resources to do the sort of long-term continuous evaluation that you're going to need to evaluate these programs.
Right. Thank you very much.
Great, thank you, Senator. Okay, I actually have a couple more questions, if I may. Thank you so much. One of the things I was thinking about as you were talking about the medical ombudsman, do you think that this would be something that the study would be addressing as part of their sort of staffing? I know the the ombudsman's office wouldn't be sitting within DOC and would be sitting in a separate agency. But do you think this is something that they would comment on?
Well, I think that the strategy that's being developed in partnership between you all and then Criminal Justice Policy and Planning and DSS and DOC, that's building in a continuous independent evaluation model. So I would say that would be the place to go to look at what they're saying is the best place to put that function. But you need somebody, you need something, you need an entity outside of DOC. So whether it falls under DOS or DSS or OPM, or it gets contracted out, or you bring back program review and investigations, whatever you do, that's the place for it. But when healthcare switched over to UConn, the problem is that UConn was in charge of evaluating their spending of $100 million a year. Right, and they're gonna say that they spent it well, but in the end, it didn't turn out that way. So there's really that need for that sort of nonpartisan, right? Nonpartisan, independent evaluation is so important in state government.
Yeah, I hear you there. And do you understand the reasons why there are sort of delays in medication for incarcerated persons? Because I know
Yeah,
in the
it's-
past, they used to have like pharmacies within each facility, and that doesn't happen anymore.
No, they've contracted, is my understanding, they've contracted those out. Yeah, I mean, it's all of the above, right? It's absenteeism, it's stressed out staff that are there, it's the use of lockdowns as a management. You know, when the facility is locked down, nobody gets anything. And pretty much, that's it, right? And then you have to bring it back online, and everything's delayed. It's understaffing of the healthcare professionals in the facility. It could be what the auditors point out. I mean, things as simple as record keeping and administration are important. Like, there's a reason those functions exist, and it's to sort of keep the train going on time. And if there's a problem there, then everything gets delayed. And so it's a snowball effect, right? When it keeps happening, and when it becomes standard operating procedure, then nobody notices it anymore. And I think that's a big problem, right? It's just sort of, that's how things operate.
Yeah, and in my research, there were 15 claims just last year alone for delays in medication, and two of those claims totaled up to $6 million. And it is money that, taxpayers are paying for making sure that, we compensate people for things that are happening within the system as a result of all the things you kind of highlighted there.
We have a moral obligation. If we're going to put someone in prison, we have a moral obligation that they be treated to a certain standard, right? And that standard includes health care. And so all of that money, overtime, the claims, all of that money that's being spent on that kind of stuff, if that could be reinvested in actually improving the system, it was like,
Yeah. I see it in appropriations, and, the agency is not quite 900 million, but within overtime and all of the other things that we're talking about, the agency is about 1.4 billion that it's costing the state and taxpayers. So that's one of the reasons we're talking today on this bill. You touched upon body scanners. We did a bill last year, and it worked through this committee and then was added to a judiciary bill to implement a pilot program. But my understanding is that the COs have not had the training to do the work of the body scanners. And that's a big problem. We have equipment that's just sitting at DOC that's not being used, and they're continuing having to do these degrading manual searches. The other thing I was kind of wondering, and I know it's not part of the scope of the bill, but in terms of sentencing reform, where do you think Connecticut stands in sentencing guidelines compared to our neighbors in the Northeast, for example?
well, I'd be remiss in my judge friends would chastise me if I were not to say that we don't have sentencing guidelines in Connecticut. They don't like that term. So we have, our statutes set out sentencing ranges. And I mean, I think where we are, Connecticut is pretty punitive compared to the other states. And we have things like mandatory minimums that I personally, so I'm going to speak personally as a legislator, I think we need to look at our mandatory minimums. They're used a lot. We put them into statute a lot, and then realistically, they're not used that often, and they can make appropriate sentencing difficult. But in terms of Connecticut, in terms of our range of sentencing, Connecticut is pretty progressive. We have lots of alternatives and diversionary programs and different ways for judges to structure a sentence that's individualized to the defendant before them.
Got it. That's helpful. In terms of, just to kind of go back, one question that I remembered about the AMEND program, changing correction culture, are there different programming opportunities within that AMEND program that maybe the general population doesn't have, maybe access to higher education, GEDs, or other sort of technical training that will help people upon their release?
The AMEND program is training for staff, not training for the incarcerated population.
Okay.
But there are college, higher education opportunities in our correctional facilities, as well as GED programs, remedial education. It's just underutilized.
Do you have any understanding why it might be underutilized?
I'm going to go back and just tell you that there's management deficiencies, and the system just doesn't run in an effective, efficient way.
Okay, great. Any other questions from the committee? There are a lot of committees going on today and a lot of public hearings, so folks are in and out. So I appreciate your testimony today, and sorry the whole committee's not here, but
Yeah.
everybody's balancing a lot of stuff. So
Well, thank you for the opportunity to testify, and I appreciate the work you're doing in this area. It's very important.
great. Thank
Thank
you,
you.
Representative. Next, we have Ryan Burns from the SEEC. Good morning, sir.
Good morning.
Twice in a week. Thank you so much.
I
for
thought you
coming.
might miss me.
Yes, we do. Thank you so much.
Co-chairs Gadker, Wilcox, and Dathan, vice chairs McCrory and Gucker, ranking members Sampson and Carney, and distinguished members of the committee. My name is Ryan Burns, and I'm the executive director and general counsel of the State Elections Enforcement Commission. Thank you for the opportunity to offer testimony here concerning SB 425. As drafted, this bill raises significant concerns for our agency. As you know, the State Elections Enforcement Commission is an independent watchdog agency charged with ensuring the integrity of the state's election process. Unlike most state agencies, we are not overseen by a gubernatorial appointee, but rather by a commission appointed both by one gubernatorial appointee and an appointee of the leaders of both the House and Senate, both majority and minority. The bill as drafted would require the SEC to both coordinate with OPM on drafting a performance plan and subject SEC to oversight by OPM in the execution of that plan. While SEEK is not opposed to oversight generally, as a watchdog agency, we would object to oversight in that direct way by an appointee of an elected official. For those reasons, we oppose the bill and welcome any questions.
Thank you, and thank you for your testimony on this. Just a quick question. Last week we talked about your audit, and now we're talking about this bill that is looking at adding some oversight to the agency. So I guess the question is, who watches the watchdog, so to speak?
Well, for one, you. We submit no less than 7 reports annually to the legislature and the governor's office. We also submit to public audits by the Auditor of Public Accounts. And certainly, we are not opposed to being transparent in the work we do and offering insight and receiving feedback on the work we do. But that has to be done in a way where no one political party or political actor would have undue influence over the direction or budget, for example, that we have. I would note that undue influence by OPM specifically has been carved out of the statutes in other ways. For example, 9-7C requires that SEEK's budget be passed through directly from you without being modified by the governor's office or OPM. So I think the legislature has recognized that OPM, while has a role, and we have good partners with them, it's not any particular objection to the individuals in that office. It's simply a structural issue with having them having undue influence over a strategic plan.
That's really helpful. I know you have delivered to our committee some great updates on what's going on within SEEK and, for example, how the Citizens Election Program is working. In your sort of website, I know you also are pretty transparent with the amount of meetings that you have by your boards and then the review of the grant programs. Are you also transparent on your website with other sort of information that like you share with us in terms of sort of status, how things are coming along?
I guess I would need more specifics on what information you'd be curious, whether or not.
Well, for example, like the audit and the audit process of the citizens election program, I know those hearings are all public and transcripts and videos are available for that. But in terms of the update reports that you submit to like the General Assembly that we received late last year, are those things also on your website? So if a member of the public wanted to say, okay, how are we doing in making sure that the funds under the Citizens Election Program are being overseen?
I don't believe we do post those publicly. Certainly, it's something we could do if there was interest, and certainly we provide that information to anyone that would ask for them. They're also discussed pretty regularly at our meetings, so certainly not something we're hiding the ball on. I would say we haven't received a lot of inquiries about those reports, but if it's an area of public interest, it's just the balancing because there's a lot of information we need to get out to the public. Certainly, for example, we just published our CEP guide, which is how the CEP operates. So we try to be very intentional on what information we publish and its utility so people don't get lost in the weeds. But if that's something that the committee's interested in, we can certainly find a way.
Well, I think you do highlight it at your meetings, like you said, and I think that's useful so that the public can keep up to date on what's going on. And then you answered my next question, which I asked you last week about the 2026 CEP guidebook, and it sounds like that's been approved and it's on your website?
It is. It's approved on our website. It was also delivered to the committee along with the required documentation for our post-election reviews. So certainly happy to answer any questions about that.
Thank you very much. I think that's good from me. I'm going to ask members of the committee. Well, thank you, Mr. Burns, for your testimony today. It's really useful and appreciate your time.
Thank you.
Next, we have Amy Zip, and you're going to have to correct me if I mispronounced your name.
It is as if the P is silent, similar to Pfizer, Falsecraft. All right, good morning. Chairs Senator Gadkar-Wilcox and Representative Deathan, ranking members Senator Sampson and Carney, and members of the Government Oversight Committee. My name is Amy Ziff. I am a PhD-trained registered nurse, and I currently serve as the Healthcare Ombuds for the Office of the Correction Ombuds. I'll begin briefly with comments on House Bill 5477 before turning to 5474. Correction Ombuds Devon Ward has submitted written testimony that provides detailed discussion of both. The Office of the Correction Ombuds supports House Bill 5477, as well as the governor's proposal, Senate Bill 89. Both bills seek to codify elements of the Federal Prison Rape Elimination Act into Connecticut law and strengthen safeguards related to sexual abuse in correction facilities. House Bill 5477 includes additional accountability provisions, while Senate Bill 89 strengthens reporting and oversight mechanisms, including the relaying of sexual assault complaints to the Office of the Correction Ombuds. Our office supports both proposals and hopes to see the strongest elements of each ultimately merged into a single framework that improves transparency, reporting, and accountability within our correctional system. Turning to House Bill 5474, this legislation reflects a continued effort to improve transparency and accountability in the correction healthcare system. It is important, however, to recognize the timeline that brings us here today to discuss this. In response to Public Act 22-133 in 2022, the Department of Corrections produced a detailed report describing staffing needs, operational challenges within the correction healthcare system. However, The recommendations contained in that report were never fully implemented or tracked. Again, through Public Act 25-168, the legislature directed the department to produce a comprehensive healthcare delivery plan by October of 25. The submission that followed did not address the statutory requirements for such a plan and instead focused largely on a proposed Medicaid reentry waiver. While continuity of care after release is essential, the waiver remains dependent on federal approval and does not address the delivery of care inside our correctional facilities. For this reason, our office recommends and has submitted testimony online strengthening several provisions of this bill. Section 1C1 contemplates accreditation of the correctional healthcare system by a national organization, establishing a clear timeline to obtain accreditation from a specific agency, such as the National Commission on Correctional Healthcare, by 2027 would ensure that nationally recognized standards and independent oversight continue to exist over our correction system. Section 1C3 would allow those who are incarcerated to submit medical requests electronically. Currently, all sick call requests are submitted on paper forms that are placed in drop boxes within housing units. Allowing electronic requests through the tablets that most already possess would create time-stamped records and allow tracking of both the number of requests and the time that it takes between a request and a person actually being seen by medical. Improved tracking is especially important given the current backlog of specialty care referrals within the Department of Corrections. As of 2 weeks ago, 2,397 outpatient specialty referrals had been approved, but were still waiting for scheduling. This included referrals for innumerable specialty services, including cardiology, orthopedics, and others. Section 2 of the bill establishes the position of the Correction Medical Deputy Ombuds within our Department of Correction Ombuds, with responsibility for overseeing efforts to assist incarcerated individuals with applying for Medicaid prior to discharge. From an oversight perspective, the office would benefit from the addition of a physician who could assist with independent medical chart reviews and clinical analysis. However, discharge planning and Medicaid enrollment should remain operational functions of the Department of Correction rather than responsibilities of an oversight office. Finally, with respect to Section 1D, 16D, we recommend revising the reporting metrics so that they more directly measure compliance with the Department of Corrections nursing policies. This would include the number of time-sensitive medications administered outside of the expected 2-hour window and the amount of non-time-sensitive medications administered outside of the expected 4-hour window, in addition to identifying medications and reasons for those that were never administered at all. As written, this bill requires that this report be submitted after the December 31st, 2026. We recommend moving that reporting date up to coincide with the report that will be due on or by December 31st, 2026. The department already maintains a medication administration record system that should be able to produce this data readily. House Bill 5474 presents an important opportunity to strengthen oversight and improve the systems used to deliver healthcare inside our correctional facilities. The legislation has already received plans. What we need now is implementation, we need standards, and we need accountability. Thank you for your time, and I'm happy to answer any questions you may have.
Thank you so much, and thank you for your written testimony. Please thank the Ombudsman for us.
Will do.
I also want to highlight his report that he sent to the General Assembly, and it is on your website because I wanted to make sure that folks out there are able to access it as well. It's very useful. And one of the things that I took away and just really wanted to kind of highlight was when you have the Ombudsman's office, what percentage of the complaints that come in would be medical related, maybe as a result of either inabilities to get appointments or inabilities to get medication on a timely basis?
I don't think that I could give you an actual percentage. I wouldn't want to guess. Very high. I realized pretty quickly, I've been in this job, this would be day 3 of my 9th week, that it was a much bigger job than I anticipated. It is a very high percentage. We could get that number for you, but it's very high.
Excuse me, that was one of my takeaways from the report. Do you have any idea how many in the calendar year 2025, do you have any idea how many complaints you receive regarding
Yes.
medical issues?
I've spent quite a lot of time with the other people in our office, kind of reading through those, cataloging them, responding to them. It was something in the nature of 900 from the year 2025. And something that we're working on now is to find ways to better categorize a number, because that would be 900 individual things submitted to us. We get letters that, without exaggeration, are 25 pages long. And so the number of individual complaints per concern shared, much higher than 900. That would be about 900 individual concerns shared with our office, or submissions to our office.
Yeah. So of those complaints, how many would you say resulted in some sort of claim that would be going to the Claims Commission?
That is not a question I would be able to know the answer to at this moment, but we could try to figure that out. Concerning, very concerning things shared, though. Yeah.
Yeah. And I think one of the takeaways that I had from our hearing that we had with DOC, the Ombudsman's report, was this sort of national organization that would kind of accredit the medical. Do you know why the DOC hasn't looked to get that accreditation? I know when the services, the medical services were handled by UConn, that was part of what they were looking to try to do. And that changeover, I think, happened in 2017, before my time.
I could not speak for the
Okay.
Department of Corrections and why they haven't pursued
Okay.
that.
Do you know if other states in our country, how many would you say are also not accredited? Is it a common problem?
I could find that out for you.
Okay.
I don't want to guess.
That's useful. The other question I had was in terms of the paper forms for the medical, you kind of highlighted some of the issues there. If you were to look at the 900 so claims that you logged, are any of those claims as a result of maybe paper forms going astray and some
Yes.
sort of tracking? Okay.
Tracking related concerns related to medical requests and other types of paperwork that is submitted are very common.
So again, electronic tracking system seems like, I mean, this is what pretty much all hospitals have been doing in my lifetime. Anyway, I also take into account your comment about the Medicaid enrollment. When people exit and are released from the system, does your office work with any of those folks that maybe have release issues? Maybe they didn't get enough medication. If they're on like a heart medication, for example, and they get released, do they get released with medication, or do they have to go to the local pharmacy? And would you get those complaints to you?
As far as it currently stands, our statutory kind of boundaries are people who are currently incarcerated with the Department of Corrections. So I don't believe we have received complaints from people who perhaps used to be but are no longer. It is the administrative directives that outline someone who is released from Department of Correction custody needs to have 2 weeks of medication when they're released. And I know that that conversation has been part of the Medicaid waiver. I'm not an expert in the Medicaid waiver application, but that is to help kind of alongside those individuals as they are released into the community to have a better continuity of care and access to medications. 2 weeks is not much.
Got it. Just going to jump over to 5477.
Sure.
One of the things that you kind of highlighted in your testimony, and I think you did, it was good that you made clear that the governor does have a bill to codify PREA, but this bill you highlight goes a bit further. Can you kind of highlight why some of the provisions in this bill are important to implement beyond the governor's recommendation?
Specific to, did you have a specific
Well,
word,
in
or-
regards to the PREA compliance.
I think that is something that was submitted as part of the online testimony.
Yeah.
I don't know if I could speak to that. I'm not sure the answer to that question.
Okay. It is covered in the online testimony, so we can maybe follow up with the ombudsman if we have any
Absolutely.
additional. In terms of issues that come into the ombudsman's office, do you track them that are maybe non-PREA compliance issues that come in? And do you have an idea of how many may have come in last year?
When you say non-PREA
So if there was some
compliance, so-
sort of an inmate experience something that they know is not following the laws of PREA
Okay.
on a national basis, and what
We do track that. We have a case management software program that we use to kind of help us track concerns and the categories of concerns that are shared. So that is one of the distinct categories. Off the top of my head, I know I have read several, but I couldn't tell you an exact number, but I could find out.
That's interesting to know, and I think, one of the things that I heard from different advocates that have talked to families of survivors of some sort of sexual abuse is that they don't feel that there's a mechanism for them to be able to report confidentially, and then so things don't get always reported because all the way that the systems and how everything is monitored. And I was just wondering, do you hear from families that come to you and highlight these issues?
We have heard concerns of that nature. I think myself, having only walked into a prison for the first time in my life 8 weeks ago, some of the processes are a little alarming. If you've walked in and seen the phone, there's a phone for PREA that you can call. It's right in the middle of the common area. And so it's hardly confidential if you pick up that phone. It's in fact right in the middle of the common area where everyone can see. And so that struck me walking in and kind of seeing that for the first time.
Yeah, I hadn't appreciated that, so thank you for sharing that.
It has a big sign painted over it.
Oh, good.
Yeah.
Yeah, okay. I'm going to ask my good co-chair if she's got questions. I'm sure she does.
Thank you. Yeah, thank you. The good chair has already asked a number of the questions I was going to ask. But thank you for that, for your testimony, and particularly highlighting, right, some of the structural problems that we face when we think about how systems work in reality versus sort of the theory being implemented. So I just wanted to follow up on the tracking of medications administered, because one of the things that we learned after the audit process and then a hearing on the delivery of medications, which was a bit alarming, was the number of medications that were not delivered on time And that was based on a representative sampling that the auditors have done. And one of the questions I asked at that time was, well, who is assessing the impact of that? Because I can imagine that that impact would vary depending on whether or not that medication was vital to, right? I mean, that a daily dose at a certain time is sort of vital to some critical aspect of health versus something more like a vitamin, and maybe that may be administered in a different way. But what is the tracking system for that? Is there a system in place that prioritizes, for example, medications that if missed because they have to be delivered at a particular time, is there some prioritization, a kind of triage framework for vulnerable patients? Is there a way to understand the impacts when medications have been missed? So if you can just say a little bit more about how that delivery system is tracked, that would be helpful.
I have requested, our office has requested and reviewed multiple medical records, including medication administration for people who are incarcerated. And so they do have an electronic tracking system. You can see exactly what's ordered, exactly what time it was ordered, and then exactly what time it was administered or not. So that is all readily tracked, which is why we propose the deadline, right, for that report to be earlier, because they have the system, right, to track it. And so the way the nursing policies work within the Department of Corrections, they divide medications into different categories. The categories are either time sensitive or non-time sensitive. Just to give a simple example, if you need to take insulin 4 times a day before or with your meals and at bedtime, that's time sensitive, right? 4 times a day, there's not much variance you can give to that and have it still be accurate. So that would be a time sensitive medication. That time sensitive medication needs to be given, they give a 2-hour window, an hour before to an hour after the administration time. So that's time sensitive. Non-time sensitive medications are things that, for example, are given once a day. Like say you gave the example of a vitamin, it's given once a day. That has a broader time frame of 2 hours before to 2 hours after, so a 4-hour window. As far as how the department itself sees those medications, like the nurse, if I were the nurse in the department administering them, is there a way that they are flagged to differentiate? I don't know the answer to that, but their policy clearly outlines what they expect of those medications and when they need to be given as far as boundaries of timeframes, which is kind of why I proposed the timeframes I did in our online testimony, so that when we receive a report, it tracks with what's expected by policy, so that then there's some accountability, and I think we could do more with that data with the timeframes that align with our policies.
And is there some data that establishes how often those have been delivered in a timely manner, and in what percentage, for example, which is similar to what the auditors have done, because it was an alarming number of medications that were not delivered timely. And so insulin is a good example. I mean, so if that's missed twice a day, but then what is the long-term impact on a patient when that's missed, and how many times does that happen? Is there some accounting for that? And so that's very different than, maybe non-time sensitive medications, but it didn't seem like there was any distinction in terms of the oversight and accounting for when those were missed, when those are flagged, or a prioritization, for example, or over, time, because the answer that we heard, at least there in part, was a resource shortage. But a resource shortage, and I understand that, and believe me, I understand the resource issue is one piece of it, but that's one that's not going to save the state from liability or save the person from harm. And so this is where some kind of prioritization, a triage system, something that's in place to make sure that those time-sensitive medications are delivered. And then on the back end of that, where is the oversight and the analysis that they have been delivered, and if not, some tracking of what the impact was. I mean, if the person is impacted, like 5 months down the line, is there something that traces that back to the untimely delivery of medications, or is it just presumed that that condition, I'm just wondering, again here, the oversight mechanism, what is in place right now, especially for those critical medications?
I have found myself answering or asking some of those very same questions along the way. I simply don't know the answer to them. Whether there are internal processes to flag things that are more sensitive versus not, I don't know. And is someone watching that? I don't know. I think that's one of the reasons why these reporting requirements in this bill are really important, because it would be an external review of what's going on, because I have found myself asking some of those same questions, and I don't know the answer to them.
No, I appreciate it. And if there is some protocol that's being worked on now, or it would be nice to sort of see that there is some process maybe being discussed or in place, if you can maybe follow up in the office and see if that, and share that with us. I would like to know, particularly for those time-sensitive medications, that's really the category I think in terms of oversight and tracking that I'm most concerned about.
I think I have seen oversight change documentation. I requested a medical record for a gentleman who was incarcerated and reviewed medication administration. It was specific to the question we were looking at. When I request documentation, I'll request it for a certain time frame. So I requested it from, I want to say it was a year back to the date I requested it, right? You can't request records from the future. So the date I requested it, I looked at it, I saw documentation in the medical, we call it a medication administration record, a MAR, saw the documentation in there. It was lacking. A lot of not administered with not much detail. Things always take a bit more time than I hope to report out. So in trying to be more up to date with the data we had, I then requested the month after that, right? We're now a month forward. So I was like, let me see what's going on for the last month, right? I don't want to give a report that's got an end date from a month ago. So I request the new records from the last month, completely different documentation in the medication administration record when it came to details provided about what was happening. And so I just think it's one, albeit anecdotal, example of what happens when oversight is present. I requested the records. They know we're looking, right? They very freely offered them. Like our office has statutory, boundaries to request those things. That second set of documentation, much different.
Yes. Yeah, thank you. And for underscoring the importance, of course, of oversight, which is why we're here as a committee to begin with.
Correct.
So, yeah,
Yes.
thank you very much. Appreciate it.
You're welcome.
Thank you. We have one more question from Representative Vale.
Thank you. Good afternoon. You mentioned submitting sick call requests electronically and tablets. So what tablets would you be referring to?
Right now, Securus is the system through which the electronic communication is done through their tablets. Securus has the capacity to, and in other states, has a platform that can do medication or medical requests as well.
So who has the tablets?
The people who are incarcerated?
So is that a tough question?
Oh, no. I'm
okay.
sorry.
All right,
no,
okay.
I apologize.
Yeah. I'm asking you because, so every incarcerated person in the state of Connecticut is assigned a tablet?
I cannot answer whether that is every, but the bill specifically introduces electronic transmission for this in addition to the paper process. So if there were people who are incarcerated who did not have access to a tablet, the paper process will remain.
Okay. So some people have access to tablets and some don't?
To the best of my knowledge, there are times when someone may not have access to the tablet for perhaps disciplinary reasons, things of that nature. So they do not always have access.
Okay. And the traditional system, they put in a paper request. Who picks up that paper? Like, it's put in a box.
Correct.
Who picks that up? A counselor?
The nurse.
Medical, the nurse does.
The nurse, yes.
And how often do they pick that up? How often are they supposed to pick it up?
To the best of my knowledge, they're supposed to pick it up once a shift. It's, when we talk about system disparities, like the senator earlier, I think this is a great example of a system disparity because I've talked with people who are incarcerated who have frustrations related to the paper process. There are a lot of different kinds of people who are incarcerated, right? Reading levels, writing levels, comprehension levels, English literacy levels, things of that nature. And so a lot of frustrations with the paper process. Like, I filled out the form, no one got back to me. Lots of gaps in that process, hard to track, right? If I take a piece of paper, I write something on it, drop it in a box, who's to say what happened to it if it got lost? I've also talked to nurses because I was there at Cheshire maybe last week working on a concern with the nurse there who kind of showed me the box. They have to go around with a box. Oh, they have a big one of those paper boxes that you get from, Staples. They walk around. They have to have the key, open all the boxes, put the papers in there, and then they're left to sort through the papers to try to figure out how to both decipher, categorize, triage, and address the concerns and the requests that are shared. And so it's really pretty cumbersome on both ends of the process. And so
I guess I don't see the cumbersomeness to it, but that's fine. Are they required? I'm concerned about what the process is. Are they required to pick up the sick call requests in each block every shift?
I don't know the answer to that question.
Because that would be important to know. Because if they're not required to do it, there's problem number one. Okay? And if they are required to do it and they're not doing it, then that's a different problem. Okay. And so we don't know. Maybe someone could get back to me on the tablet issue. I'm sure I can reach out to the department to understand that as well.
Sure.
Thank you for bringing that to my attention.
You got it. Do you want me to work on the tablet question? What was
I just
it
want to know,
specifically?
like this, first I'm hearing of it, just like who has tablets and who doesn't. Are there certain facilities that have it?
The
Whatever-
majority have them.
And
Yeah.
each, I want to know exactly how that
They're like
works.
little, have you seen them? They're like little,
No,
like little-
I'll
yeah.
reach out to the department. I'm
Fair.
sure on
Yeah.
that issue, they can help me. So, I have a few questions about the ombudsman's office.
got it.
How many people are in the ombudsman's office?
Currently,
Yes.
Devon Ward, he of course is the ombuds. Myself, working on healthcare. Matt Mitchell, special investigator, came from corrections as an officer. Tiana, she's our admin, and then we have a open position for clerk typist, I think is the title, 5.
Okay.
And we have a new associate ombuds. The interviewing process is currently happening. So that will be 6. They're not there currently. I don't know I don't have any information on that.
And in 5474, you're going to establish a position of medical deputy ombuds, which would be an additional position within your office? Or is that, like, that's what you're doing now? Is this going to be more?
That's a completely new position that I read when I saw this bill. Our testimony online, along with what I said today, the way that position is described, it is not something that aligns with the oversight structure of the ombuds office.
Okay. So that's kind of what you're doing now, that specific. You're dealing with the medical.
That's talking about like Medicaid. assisting persons who are incarcerated in the process to acquire Medicaid on their transition out of corrections.
Okay. Which again, that doesn't.
That's, I've not done that before. That is not, and that's not an oversight.
Yeah, yes, I
Yeah.
get it. I know what you're
So-
saying. Maybe that belongs somewhere else if we're going to do that.
Correct. I would agree.
Okay, and so start to finish, someone wants to make a complaint. They file a grievance. Is that how they do it? A paper grievance? Do they also, like, is there a box like there is for sick call where someone files a grievance, or how do they reach out to your office directly? Do they have to do it that process, or can they do that electronically? How does that work?
Currently, our office as an oversight office is separate from the internal structures of DOC, although I do spend a considerable amount of time, and I've sat with wardens and deputy wardens learning the process, because part of the goal of our office is to work alongside the system, right? We are not there to substitute for the current process internally with DOC. So if someone comes to our office, they come to us often through someone they love. Someone on the outside comes to our office via email, a phone call, a letter in the mail, sharing concerns with our office on behalf of someone they love who is incarcerated. I've had innumerable conversations with moms. They're our biggest category, but I am a mom, so I feel that. But and then as far as correspondence from people who are incarcerated directly to our office, at this point, that comes usually through the mail, like postage. Like we get mails like from the postal service. They mail to our office because there is not currently an electronic process for them to get to us directly. We are in the process of the boxes. We will have a box in all the housing units. They have been ordered, they are being built, they will be installed so that people who are incarcerated can drop a request in our box just like they can with medical. That's us as the oversight agency. If a person who is incarcerated has a concern, a complaint, a grievance, there is the internal process with DOC as well, which I am learning about and learning to reinforce that and ask that of people as well. Talking to moms, like I said, I am a mom. I would do the same. So advocating for their child who happens to be incarcerated, they need this, they need that, they can't get medical, asking, like, did they fill out the paper form requesting a medical assessment, right? Did they fill out the nurse sick call form, right? Reinforcing the internal processes with DOC as well, because our office really wants to address or is here to address systemic issues. We're not here to substitute. We want people to follow the process in DOC, right? We want them to do the grievances, which I have learned recently. If I were a person who is incarcerated who had a concern related to a process, I go through an informal grievance first, where I go to my supervisor and I say, I had XYZ problem, I tried to resolve it, it didn't work. If going to my supervision doesn't work, I then do a paper grievance process where I talk about the informal process I attempted, how it didn't work, what I'm looking to resolve. And so they're kind of two separate pathways. We have found ourselves both helping people with their concern and also helping people follow the process in DOC so that can happen as well.
Okay.
Yeah.
So I actually understand the process somewhat, but.
Because you
what-
were in corrections.
I
yes.
was. And
yes,
so.
that's what I thought.
Yes. And a lot of it's the same, and certainly there are some changes, but is there any way to give someone assurance that if they had a problem and they felt like someone might intercept that and it might not get to you, is there a process, like if you put these boxes into the housing units or in facilities, wherever you choose to do that, and you have it locked, are you going to be the only ones who have the key, or are there people within each institution that you work with to do this? Or obviously, with 5 people in an office, we're not going to be able to go out to every institution every day and pick up all those things. So is there any idea how that process is going to look like? So that there should be some peace of mind for people that if they feel their grievances are being intercepted and not being heard directly from the ombudsman, that there's a process for that not to be. And they might not have a mother or father who's going to call on their behalf. So I'm just curious about that.
The plan, as I understand it, is that our office will have the key, and that each of us in the office have been given primary locations for facilities, and that it will be our responsibility to go to the facilities at least once a week and collect them directly with our key from the boxes.
And only people from your department will have that key?
Correct.
Okay, thank you.
Thank you, Representative Vale. Just to follow up on that,
Of course.
does the electronic reporting, does that provide, to Representative Vale's question, which I think is a good one, some assurance that no one else is able to see those requests that are put in or complaints that are put in? Would that make it more secure or less secure? Because you would then have a password, I presume, and a direct line.
When it comes to like the electronic request for medical appointments, like by the person who's incarcerated, or
Or instead of the paper submissions, having an electronic process for submitting complaints, even grievances.
we do not yet have an electronic process for someone who is incarcerated to submit something to our office directly. Very often, what I receive are screenshots of Securus messages, like someone had a Securus conversation online. That's the tablet with someone they love on the outside. They screenshot that, they send it to our office. Securus is monitored internally, and so that is part of the understanding with that system is those messages are read. So as it stands, that process opens up eyes to see, right? In order for the medical, and I had a nice conversation with the advocate this week actually about this, one of the things that would have to be in play for the incarcerated person to be able to initiate and request medical care through their tablet, it would have to be private. That would have to be part of those settings. That's something that would be essential for private health information for someone. That would have to be a different type of messaging than the current interaction with
Right.
your family at home.
Yeah, okay, because those messages all have oversight.
Correct.
And
The
yeah,
current,
okay.
the current messaging system when you are, communicating with family or whomever on the outside, that is all monitored.
It's all
Yes.
monitored. Okay, thank you, that's very helpful.
So it'd have to be different than that process.
Representative Vale.
Thank you for the second time. I just thought of something. And I think I worked a lot at Osborne, which is a 24-hour facility with 24-hour nursing care and stuff like that. But when I mentioned that maybe those sick calls should be picked up every shift, I was thinking of, institutions like that. There are institutions that just have, 9 to 5 medical staff as well. Is that correct?
There are institutions that are staffed differently than Osborne. I couldn't speak to the specifics.
They don't have the 24-hour coverage. And so I guess, obviously, if they picked up those grievances every day would probably be the best that they could do with that. But
And I can look into it.
we need to find out what the process is, and if either it is being followed and there's not a problem, there isn't a process in place and there should be, or there is a process and we're not following it. So I think we need to figure out to start what that is. So thank you.
You're welcome.
Great, thank you, Representative Vale. Are there any other questions from committee members? Thank you very much.
You're
And thank you for
welcome.
your testimony.
Thank you.
Okay, next we have Tina Jefferson. And just a reminder for those who are online, who are going to testify remotely, you have to accept the invitation, the promotion to be a panelist on Zoom in order to speak. So as you're as you're about to come up, just keep in mind you have to accept that promotion to panelists in order to be able to speak. Wonderful. And thank you.
Hi, good afternoon. Senator Gadkar Wilcox, Representative Dalton, Senator Sampson, Representative Carney, and distinguished members of the Government Oversight Committee. I am Tina Jefferson, Deputy Commissioner of the Department of Children and Families, and I am submitting testimony on House Bill 5476, an act concerning oversight of efforts to prevent human trafficking. We also submitted written testimony. Sections 3, 4, and 10 require DCF to develop a human trafficking training and require all employees of DCF and contracted providers to complete the training. This is duplicative of existing statutory mandates and practice, which have been in effect since 2014. Section 6 requires DCF and local law enforcement to conduct a security assessment of all placement locations, public or private, for children in out-of-home care. We believe our ongoing regulatory and licensing oversight satisfies this requirement. Section 7 requires the Office of the Child Advocate to prepare an in-depth report on a sampling of children in our contracted congregate care facilities. DCF provided the JJPOC a comprehensive report in July 2025 on the Specialized Trauma-Informed Treatment Assessment and Reunification, STAR, Home Enhancement Plan that DCF enacted in 2024. The report, which is provided annually, was attached to the testimony. DCF supports Section 8 of the bill that would establish Human Trafficking Prevention and Response Task Force. DCF is an active participant in the statewide steering committee of the Regionalized Human Trafficking Recovery Task Force and have collaborated with all other members to further improve the state's human trafficking response. Section 10 of the bill would require DCF to open a child protection case for all children who are victims of human trafficking. Under current law, the language is permissive rather than mandatory, which allows the department to exercise discretion on when it can and should provide child welfare services to the family and the child victim. In the case of child trafficking, the parents and guardians are much less frequently the perpetrator of the crime. And to ensure appropriate support and coordination, cases that are not opened with the department are managed through the multidisciplinary team, the MDT process. Thank you for the opportunity to testify, and my colleagues and I are available for any questions you may have.
Great, thank you so much. I do have a couple of questions, but I see Representative Vale recognize your question first.
Thank you, Madam Chair. Good afternoon.
Good afternoon.
You mentioned sections 3, 4, and 10 have human trafficking training. You say you already do that. Would this create more training, or would it just codify what you're already doing?
I believe it would codify what we're already doing, and I do have our Director of Human Trafficking here if you have anything to add.
Hi, everybody. My name is Mirela Beltram. I'm the Director of Human Trafficking and Responsive Services at DCF. We currently are mandated to provide training to law enforcement, hotels and lodging, educators, EMS and frontline responders, and we also provide training in staff to our DCF workers and well to our DCF providers. I think this bill would probably codify what we are already doing. I'm also in the process of updating our training. The training had not been updated in a couple of years, and so we are in the process of updating it and ensuring that it fits what trafficking looks like currently and that it is tailored to all of the different disciplines that we are mandated to provide training to.
So you don't have opposition to this. You're just saying that, is there opposition to it? I'd ask you, I don't want to.
No.
Okay. And I guess that would apply to section 6 as well. You said that you're already complying with that, and you already have that set up. And again, this would just codify that. Is that correct?
There is some, the provision is a bit broad, and so it captures not only congregate care settings, but all foster and kinship homes as well. And so we would want clarity, I guess, on that particular provision.
Okay. But do you think if that provision was in there, that you're already meeting that requirement?
Yes, we believe we are.
Okay. And again, you mentioned section 10, where there would be required to be a case for anyone who is a victim of trafficking, which would be a mandate, and now you guys make a determination. Is there any reason why we wouldn't want to open a case in every situation, whether it's whomever it is, that it's not, I mean, that's a pretty traumatic event, so why would we not want to mandate that?
So, if the alleged perpetrator of the trafficking is not a parent, a family should not be required to receive DCF child welfare services. It is unfair to the family. It's an additional, I believe, stigma to a family to have a child protection case open when they themselves have not committed any abuse or neglect, and it really is a family, the full family, that is in need of service provision, which can be provided outside of an open child protection case.
And you're able to make this determination based on the facts of the case. Do you look into it, you know, and not just make the assumption that the family had no involvement?
Absolutely. Right now, what we do and what we've been doing for several years is when the report comes into our care line, our child abuse and neglect care line, we screen those referrals. And if we determine that at that point that a child protection services case needs to be open based on the information we have, we do open those cases. And when we determine that it's not, usually because the perpetrator is a non-family member, non-household member, we refer those cases over to our MDT, our multidisciplinary teams that are made up of prosecutors, state's attorney's office, and several others, in order for them to work with the family. If at any point it's determined that it's a child protection issue, the family can be re-referred.
Okay, sounds reasonable. Thank you.
Thank you so much. I actually have similar line of questions and maybe follow up on a number of those. The first thing is, with the trainings, you said that these were duplicative. But one of the most alarming things I think that came out of the audit that recently came out about DCF was that there were a number of red flags that the trainings were not happening, in fact, and they were not effective. And so if you can say a little bit more about your reflections on that audit, which is in fact what initiated us to think about trafficking more comprehensively in the first place, because it was alarming that there were so many red flags, and I think there were repeated violations. And I'm glad to hear that there is updated training, so I'm very glad to hear that. But if you can kind of walk through your response to the audit about the red flags there around training and how you've responded to that perhaps, and what the new trainings are going to look like that will perhaps in the next audit correct those red flags that had come up.
Absolutely. I hope that this new training does correct those red flags. So the new training, I'm just going to start a little bit about what the new training looks like. I will say that I have been working alongside with law enforcement, with educators, with our CPS, our internal training academy. I've also worked alongside medical providers and hotel to ensure that the training matches their needs. The biggest difference with this training that it's going to be online. So it's going to be in an LMS format, which ensures compliance because people are able to take it online. They'll be able to get their CEUs as well as get their certificate for training. And I think it also fixes the question of, I can't remember what is specifically in the audit, but something that we also realize is the fact that because of our certified trainers, sometimes the training that was being provided, the people might have been either giving information that was not in the training itself, or maybe they were ad-libbing. And so there was a lot of confusion about what was in the training itself, because there were some times where the training was not being provided in a manner that was appropriate or that we needed it to be done. And so that kind of, the new training cuts that, right? So it's going to be online, it's one message, and also it's going to be a unified message from not only DCF, but also our partners that we're working with. I actually will be meeting with CAC to show them the training as well to ensure that it follows their needs. And so the new training, like I said, is very, very different. It focuses a lot on vulnerabilities. It focuses a lot on at-risk situations. It focuses on providing people the tools they need in order to know what to do if they suspect a situation of human trafficking and where to report. And those are specific to the different disciplines. So it's the first part of the training is what is human trafficking, that's generalized, and then the second part of a training is an activity that is built specifically for that discipline that helps them walk through a specific case of trafficking. So from the very beginning, from the grooming to then it being identified and what to do afterwards. It has a lot of checks, so people have comprehension checks throughout the training to ensure understanding, and we'll also be doing some data gathering with this training, so people will be not only asked beforehand they take the training what they know about the subject, but also once they finish taking the training what they know, and they will be asked to opt in to 3 months from after they've taken the training to see was the information that they learned and the information that they learned useful for their role after having taken it.
Oh, thank you. I appreciate that. And I think one of the issues that we have in terms of even all the good work that's being done in the state around trafficking is, we lack the coordination to kind of follow up on the trainings or standardization around the trainings, but then particularly a way to measure whether or not those trainings have been effective. So as you're putting and, implementing and initiating this new set of trainings, what will be the back end of that? In other words, how are you going to assess? I see that you mentioned that you're going to do some data gathering. How is it going to help you assess whether or not that's actually been effective? What are some of the metrics you'll be looking for to see whether or not only that everybody sort of receives this information, but it somehow produces some reduction or increased reporting around trafficking?
Absolutely. So the increased reporting that we're working directly with our care line to kind of track that. So I'm actually meeting with our care line to understand their processes and how we can implement that in understanding the data that comes from that as well, like increased reporting and where do those reports come from, right? And I think for the training itself, understanding if it's that functionality, like I said, I'm going to ask everyone who takes the training to opt into 3 months from after they take the training, this feedback form. And the feedback form is not going to be like, just did you understand trafficking? Have you identified it? But it's going to be more along the lines of, is the information that you learned in this training, were you able to actually use it in your day-to-day work, right? And that's going to help us to understand, is the information that we put out there relevant? Is the information that we gave them also useful for the tools, for the things that they need every single day? Because when you take a training, you leave that training going, I learned so much, but is the information you learned, is it practical? Can you actually use it in your day-to-day? So for example, with medical staff, were they able to better assess? Were they given better tools to understand how they can speak to patients to see if they're potential victims of trafficking? For law enforcement, same thing. Were they able to understand better how to identify trafficking in the field? And so using that information and that data that comes in to then, again, analyze it and figure out how we need to update the training as well. So the training for me is something that is continuously going to be updated based off the information and feedback that we receive from the people who are taking the training.
Thank you, appreciate that. And beyond that 3-month period, what is sort of the plan for follow-up in terms of the data gathering, but also to make sure the implementation is actually happening in the in various areas?
So I'll be working with all of our different disciplines who are mandated to provide the training to. I've been having conversations with them about what that looks like. It's going to be on our LMS, so it's going to be easy for us to also track who is taking the training and provide that feedback to the different disciplines, so that they can also keep their internal tracking as well and understanding who is compliant or who is non-compliant to taking the training. For me, those first 3 months once we get the data, it's understanding, and then my goal hopefully would be within the next 3 months using that feedback to update the training. But again, this is coming out soon. It's not finished yet. So there's a lot of learning that's going to be done as well to understand what are the needs, where are the gaps of understanding, where are the gaps in knowledge, and what are the gaps in what is needed practically for our different communities.
Oh, thank you. And do you think this will address the red flags that come up in the audit report, and hopefully in the future that will?
I hope so.
We'll not see that. Okay, great. No, that's good so thank you for that. No, I appreciate that, and it's important because that was very alarming. That was the red flag that concerned me the most, actually, of all of the audits that we looked at. And just a question again. Representative Vail already asked this, but I just wanted to dig in a little bit more on Section 10. When we're saying require instead of making something mandatory instead of permissive for services, why? I'm not fully understanding why that's a problem. So
not for services. So we completely agree that all trafficking victims should have service provision, right? It's about the access to that service provision. So they can access that service provision without having an open Department of Children and Families case. So if the perpetrator is outside of the home and not an entrusted caretaker of the young person, then the family can receive services through our multidisciplinary teams and our CAC. And they are not required to have an open case to access those services.
But, I mean, that's shifting the burden on the family, but can't you open a case and then transfer it as appropriate once you make that assessment?
I think there's other things that come with opening a Child Protective Services case. So, required visits to your home, and the parents themselves being treated as if they themselves maybe are perpetrators of something. And so I don't think for families, they would want the intervention of having a state entity coming into their home on a regular basis, because the help that they need, they can get through the service providers.
But wouldn't that follow-up happen anyway, just in a different capacity with the other task force?
I would say that
Because there's still going to need to be follow-up, right, on that?
No, absolutely,
Yeah.
absolutely. And honestly, most families want that follow-up. They want the support from the service providers, not from a child protection agency. And so I don't think it's always viewed as support. I know that much of our work, we can be very intrusive, of course, because our primary responsibility is child protection. And these are children that their parents are doing everything in their power to keep them safe. And they want support in doing that. They don't want to be treated as if they are a part of the problem.
So I guess I'm not understanding what those services entail then. Is it really more of an inquiry into liability, into potential wrongdoing? I thought it largely are services for the child, and I'm not sure why it would be a problem that it comes through child services instead of these other service providers.
I think many families would disagree that there is a huge difference with where the service comes from and how they get access to the service. We have many families that we work with regularly, whether or not their children have issues with human trafficking or whether or not there are issues with behavioral health, mental health, and we've made every effort to make sure that service provision sits outside of our department, and so that all families can have access to whatever supports they need on behalf of their children without the stigma, again, of having an open child protective services case, which I think has a very different connotation.
I think I understand what you're saying, but that case is open because the child is a victim. So I guess there's already, not that I want to further stigmatize the family, but the services are there because the child is a victim. So I'm just not sure, the child is going to need those services regardless.
Absolutely.
I'm just not sure why that stigma would be any worse. There's going to be a case and there's going to be follow-up. So why not make sure that we at least have some tracking and oversight that as a mandate, it's been provided to the child.
I believe I hear the confusion. I do. I believe it's the way we open child protective services cases. They have to meet the threshold of abuse or neglect by the caregiver, by the person responsible or entrusted to provide care to a child. And so it's either there's an allegation or a concern of abuse or neglect by the person entrusted to provide care.
Oh, I see, okay.
Yeah.
So this presumptively, so why has it been working in this way where Child Protective Services then would be, so there seems to be
Yeah.
another category here of presumptive wrongdoing by the parent, but.
Well, what we do now, it's either two tracks. It's one or the other, right? So the first track is if the person who is entrusted to provide care for a child is identified as a person causing harm, that case does get opened by our department. We do open those cases. The other track is if the perpetrator is someone that the child met online, someone that is a stranger to the parents in the household, and the parents are already working with, law enforcement and service providers to try to prevent the child from accessing this person that's causing harm, but they're outside of the family. Those are the cases that we refer to the MDT.
So I guess the only concern I have, and I understand now a little bit better, how do we know that those referrals will always happen? How do we know the child will get the services that they need? Are we able to, is there some oversight on that we're able to ensure that the child will receive those services? Or is there a way to reframe this language so that if we're not opening a case, there's at least a mandate that we have oversight that some services have been assigned to the child,
Right.
so that we know that that's been done? Because otherwise I'm not sure what the internal, I know you said you make the decision, and I'm confident that you use your good judgment, but as a litigator and a procedural person, I don't
right.
default to just knowing that somebody's making good judgment. I want to know what the protocol that's in place to require that those services will always be provided when there's a need. So we can't just rely on saying, okay,
Right.
we're using our judgment. Like, well, based on what protocol? So that those are the kinds of oversight questions.
Yeah, I absolutely hear your concern, and I'm going to turn it over to one of our behavioral health administrators who can provide additional details.
Great.
Good afternoon. My name is Lindsay Miller. I'm a health management administrator at DCF. So the question about how we ensure oversight, so DCF contracts with the multidisciplinary teams and the child advocacy centers and who oversee the multidisciplinary teams. And so we have internal practices and protocols in place that if the case does not get open with DCF because there's no abuse or neglect concerns for the parent or the entrusted caregiver, there is an automatic referral to that MDT. So our Caroline employees.
And is that, I'm sorry to interrupt you, is that tracked somehow?
Yes.
Okay.
So so I oversee Marella, who's the director of human trafficking, and so our division has a notification that comes directly to our division that says this is a case, and on all cases, because they all get referred to the MDTs, whether they're open or not, that this is a case flagged for concerns of human trafficking. We also ensure that the Caroline staff that's receiving those reports automatically also sends them to those MDTs. So there's sort of a first line of defense, the Caroline should be sending that to the MDTs. Second line of defense is we get CC'd on those emails to make sure that that loop and connection happens, and we track all of those cases.
And that there's a report that you produce at the end that I just want to know that there's oversight on every child that's potentially identified has in fact received the services they need.
Yes, so there's oversight in terms of us making sure that we're paying attention to the number of cases that are, or number of reports that are coming in for accepted versus non-accepted. And then we have close coordination with the MDTs and the coordinator of the MDTs to assist with making sure that those things are happening.
Right. Thank you so much. Appreciate your testimony and all that information. Are there any other questions from committee members? No? Online? No. Okay, I think we're good. Thank you very much for being here and for that
Thank you
testimony.
very much.
Okay, and next we have Beth Hamilton.
Good afternoon, Co-Chair Gadkar-Wilcox, Co-Chair Dathan, ranking members, vice chairs, and distinguished members of the Government Oversight Committee. Thank you for the opportunity to testify today. My name is Beth Hamilton, and I am the Executive Director of the Connecticut Alliance to End Sexual Violence. We're a survivor-led and survivor-centered coalition, and our mission is to prevent and eliminate sexual violence in our state through education, legislation, advocacy, trauma-informed care, and a statewide network of support for victims and survivors. The Alliance strongly supports HB 5477. Like SB 89, 5477 aims to codify the Federal Prison Rape Elimination Act into state law, requiring all state and local agencies that incarcerate or detain adults or juveniles to comply with those PREA standards. While PREA applies nationwide, it is not self-executing and relies heavily on state-level adoption, enforcement, and oversight to be effective. Without codification, compliance can be uneven and subject to shifting federal priorities, as evidenced by the recent removal of key standards related to risk screening, housing placement, searches, and other safety measures based on gender identity, protections that had been in place since 2012 to address the heightened risk of sexual abuse faced by incarcerated LGBTQ people. SB 89 addresses this vulnerability by making PREA standards as they existed on January 1st of 2024 binding under state law and not tied to the National Prison Rape Elimination Commission, which sunsetted in 2009. HB 5477 should do the same. Research consistently shows that sexual violence in custody is both common and has serious long-term health consequences. Survivors frequently experience post-traumatic stress disorder, anxiety, depression, and suicidal ideation, and these harms are often compounded by confinement, past trauma, and existing mental health conditions. A December 2025 report from Disability Rights Connecticut, who you hear from later today, documented high rates of sexual abuse at York Correctional Institution and the many barriers survivors faced in reporting and seeking services. Their findings echo what our advocates hear directly from incarcerated survivors who contact our hotline or seek on-site support. In 2018, the Alliance worked with the Department of Corrections to institutionalize access to our confidential statewide sexual assault crisis hotline by making the hotline available through DOC's internal phone system. Since that time, incarcerated survivors can dial *944# to connect to our statewide hotline for free for up to 10 minutes. We support access to the hotline without limits on time, which can impact incarcerated survivors' ability to receive information and support. In addition to hotline services, the Alliance began to provide on-site sexual assault crisis services to incarcerated survivors at correctional institutions throughout the state in 2018. Each of the Alliance's 9 member programs provide in-person crisis counseling and support services based on the geographical region that incarcerated survivor was housed in. While we were unable to provide on-site services since the outset of the COVID-19 pandemic in 2020, DOC recently provided VIP training to sexual assault crisis advocates from all of our membership to reestablish access to in-person services for survivors. Having coordinated statewide services enables the Alliance to identify and address trends or challenges with access and coordination of services directly with DOC, as well as provide ongoing training and technical assistance to advocates and ensure that they receive supervision. The collection, analysis, and availability of data about sexual violence in carceral settings is also critically important to addressing and preventing the prevalence of sexual violence in detention settings. HB 5477 requires annual reporting of sexual abuse incidents to the Office of Policy and Management, but limits OPM's review to available appropriations, which may hinder effective data collection and analysis without proper and dedicated resources. SB 89 strengthens transparency by requiring reporting to the legislature, the sharing of all complaints with the Office of the Correctional Ombuds, and allowing survivors also to report directly to the Ombud. The Alliance recommends that both OPM and the Office of the Correctional Ombuds receive all reported complaints of sexual violence, not just substantiated reports, to ensure oversight and accountability. Both HB 5477 and SB 89 aim to ensure that federal PREA standards are enforceable, transparent, and subject to meaningful state oversight, including survivors' timely access to confidential sexual assault crisis services, medical care, forensic exams, investigations, and mental health support. Combining critical components of both bills will create the strongest policy and affirm that sexual abuse in custody is not inevitable. We also submitted written testimony in support of 5476 with some additional considerations, but we thank you for your leadership and commitment to addressing and preventing sexual violence in our communities.
Thank you very much for being here and for your testimony, and underscoring the importance of, especially when we have federal protections that are being sunsetted or eroded, that even more important that we need to step up and make sure that we have incorporated into state law some of those requirements, which we're looking to do. So, thank you for we're looking at it also with the Office of Civil Rights as that's being impacted. There are other areas in education that we need to look at as well. So, thank you for highlighting that. I did want to ask about what we heard in testimony earlier about the the privacy with internal phone systems. It's great to have a line that's accessible and to be able to receive the resources. It doesn't seem like that process is established in a way that is creating a sense of privacy around those complaints. So what can we do there that may improve someone's willingness or to come forward to make those complaints, given what we just heard, that the phone is sitting in the middle of a common area? That doesn't seem like that's going to incentivize anybody really to be interested in stepping up and taking the risk that they're answering that phone or they're making a phone call.
So I would agree with, what you heard earlier in terms of access to phones in general, right? That even if those are considered confidential, meaning that somebody is not recording or listening to them later, they often are in common areas, so anybody who is in those areas could hear them. The access to our hotline is slightly different than a PREA hotline, where that does a specific designated phone, as you heard earlier from the Office of the Ombudsman. Somebody could access the hotline and would not necessarily, you could be accessing it and you would not necessarily know that it was through that PREA line that you're accessing it, so therefore you would not identify that somebody is reporting sexual violence. I think that is an ongoing concern. I don't know how exactly to completely address that. I think building in more areas for folks to be able to report, so going directly to the state's ombudsman, for example, to be able to report, who are often in the institutions themselves. They can schedule meetings and times with incarcerated survivors also. Those are some of the other vehicles that you could use to ensure that there is more confidentiality or more layers of privacy that are afforded to incarcerated survivors when reporting. But I do think that is a larger challenge overall, that there is nothing that is truly confidential when the state sort of oversees all of your movements and all of your activities entirely.
And have you heard that from individuals who were formerly incarcerated, who were also victims, that they, that we actually know the number is much higher, for example, because more people would have come forward if they felt like there was a more secure process in doing so?
We hear a number of things from both incarcerated survivors and from family members of incarcerated survivors. I would kind of echo some of the things that you heard earlier in terms of the fact that I think that there are many more folks who if they saw more happening and saw more of the kind of PREA guidance that should be happening already being implemented, that there would be both more likely reports happening because there would be more belief that the system was going to respond in a different way. I think if you had more culture change, right, around sexual violence, sexual harassment, all those things in general, you would have more survivors who are likely to disclose those kinds of abuses to DOC in the hopes that DOC would address them and hold folks accountable. So I think all of those things combine to make it so survivors could feel more like they would have, there would be some action that was taken when they, do report. I think you're going to hear from some other folks, both survivors and from Disability Rights Connecticut, and what they're going to highlight also is that reports are not always taken, reports are not always investigated, and there's not always that follow through. So the more that we're able to kind of adhere to what these standards are, not just in theory but in practice, the more likely you are to have survivors who feel like the system will take them seriously, will do proper investigations, will hold folks accountable, and then will implement things like video surveillance or other things that are just low, maybe not low cost, but certainly high impact in terms of keeping folks safe within those settings.
Absolutely. No, thank you for that. And just given the two bills that are moving forward, so SB 89 and 5477, how would you, do you have any suggestions of the most important provisions to make sure, as we're going forward, what absolutely needs to be in the final bill?
So I would say one of the things I mentioned is making sure that it's PREA that's codified, those standards when the Trump administration in December took out those protections for LGBTQI incarcerated survivors. So that's one piece that's important. There's a lot of really great stuff in 5477 that is not in SB 89. So limits on cross-gender searches, increase on video surveillance, required investigations to be completed in 30 days, expanding training on trauma-informed responses and sexual violence, and ensuring access to community-based sexual assault crisis advocates are all really critical in 5477. I think that the application of having OPM oversee some of the reporting and the gathering and analysis of that data is important, but it is not required here. It's with available appropriations or available resources. So I think that's a critical component. Also adding in, which SB 89 does, the Office of the Ombuds, both so that they get all reports, not just substantiated reports, but so that they can also receive reports directly, which this bill does not currently do. Those are kind of the core components that would come together to make the strongest bill.
Thank you. That's very helpful. Appreciate it. Let me see if there are other questions. Yep, Representative Carney.
Thank you very much for your testimony and for everything you do. I just had one question regarding York. York is in the town over from my district. And someone, I wish I could remember who, but told me that York, the prevalence of sexual abuse and sexual violence is a lot higher than other prisons. So I was just wondering if that's accurate and how much, if it is, how much worse is it there as opposed to some of the other prisons in Connecticut?
Sure, and thank you for that question. I might say that it's prevalent everywhere. I think that when you think about something like sexual violence, you will see higher rates of sexual violence experienced by women and girls in our society, and therefore York being the only female correctional institution in the state, you are likely to see higher rates of sexual violence. You're likely also to see higher rates of prior victimization, mental health, things like that are there. When we talked with Connecticut Disability Rights, the thing that they highlighted was not simply that there was the highest prevalence in York, but that they did not have the resources to do those kinds of investigations and research, throughout all of the institutions. I think if you were to look at male institutions, youth institutions, you would find similarly very high rates of sexual violence. And so I think that it is something that we have, I'm very thankful for the report that they did, but it's only scratching the surface, I think, of what we would find if you were to actually get a true sense of the prevalence across all institutions.
All right, I appreciate that. And again, thank you for your testimony today.
Thank you.
Thank you, Representative Carney. And just to follow up on that, is there work being done? So I presume some of the cultural norms that are gendered around reporting sexual violence in particular may also explain why numbers are higher outside of actual incidents. Perhaps the reporting is also lower in male institutions because of cultures of not reporting or not being willing to sort of publicly acknowledge the harm itself. Are there programs currently in place that are talking about those cultural stigmas to be able to, change the gap in those who may have experienced the harm but are just not willing to come forward and report it?
To my understanding, no. I mean, in any of the things that we've seen, I don't see a lot of those particular programs. I see them more at York than any place. But I think all institutions could really benefit from looking at trauma and how past trauma impacts, all incarcerated people, not just folks who have experienced sexual violence while incarcerated. I think that one of the challenges is we have really low thresholds based on current federal pre-administration. And so there aren't those programs that have been prioritized or resourced to be built in to change some of those cultural norms and to make it so that all survivors feel like they have a place not just to talk about harm that they might experience while incarcerated, but all those prior harms which also impact their incarceration and their mental health while incarcerated.
Thank you very much. And let me see if there are other questions. No, thank you very much for being here and for your testimony. Okay, and next we have Doug Frazier joining us on remotely.
Good morning, everyone. I was signed up, however, to speak with the raise bill regarding 504, so I think I might be called on a little bit early, or do you want me to switch over to that one?
I'm sorry, sir. Could you repeat that?
I had signed up to speak on raise bill number 424. I wasn't sure if we were switching over to that one, if we're...
No, yeah, we just go by person
Okay.
in the order. So you just let us know which bill you're talking about and go from there. Thank you
Wonderful.
so much.
Sorry about that. Well, good morning, everyone. Sorry, and thank you for providing me time to speak on behalf of Raise Bill 424 and my support of that. My name is Doug Frazier. I'm a school counselor at AI Prince Technical High School in Hartford. We're part of the Connecticut Technical Education and Career System, or CTEX for short. Over my 17 years working in Connecticut public schools, the last 10 as a school counselor and the 7 prior to that as a math teacher, I've witnessed the fractured and legally vulnerable state of Section 504 management in each district and in each role that I've worked in. I'm testifying in support of Raise Bill number 424 because we need, in my opinion, the state oversight and standardization that this legislation provides. When it comes to 504 plans, many districts in Connecticut are currently operating without a compass. Because of a lack of top-down support, clear directives, and uniform training, 504 plans are run differently from building to building, even within districts. Without a state standardization and framework of mandatory meeting scripts, case managers are often left to figure it out on their own. This is compounded by the fact that most elementary schools in Connecticut do not employ school counselors. So consequently, most 504 plans developed in those early years are written by administrators or other non-counseling staff. It deepens the concern regarding the lack of formal training and scripts, as these staff members often have even less specialized background in the area than counselors do. The plans then travel with students for years until they eventually reach middle school, which is often the first time a school counselor is actually working with the plans. In CTEX, in particular, at Prince, Our students come to us from 15 different towns, over 20 middle schools. The lack of 504 consistency is then exponentially worsened when ninth graders are arriving into a new school system who doesn't know them, and we're receiving 504 plans of all different sorts and quality at once. As a result of the entire system, plans are frequently written with a vague, unenforceable accommodations such as allowing things as needed often, which immediately create compliance and liability issues for a district and makes it very difficult for our teachers to implement them fairly. Additionally, and across every district I've worked in and friends and family, the state level oversight is needed because currently there is a a role confusion that directly harms the integrity of the 504 process. It's become common practice for administrators or special ed staff to informally offer 504 plans to families as a consolation prize of sorts when a student is exiting special education or if they're denied an IEP. Often these plans are offered prior to or outside of formal 504 meetings and without any consultation with the designated 504 team. Not only does this overstep procedural boundaries and predetermined eligibility, but it also corners 504 teams into agreement. It unfairly puts staff in
Your 3 minutes is up. Please summarize.
Oh, sorry. Well, just saying that this bill will help support many of these issues and the state oversight and the group that is being proposed to help put together our procedures and safeguards across the state rather than district to district and bill in the building, I think is very much needed in all of Connecticut schools, not just in CTEX.
Thank you so much, Doug, for your testimony. As a school counselor, I just wanted to know, how much time do you spend on like administrating the necessary sort of paperwork as a result of 504 plans, and what sort of tools do you use in your district?
Yeah, we use the CT SEDS program as the formal process when that rolled out maybe about 4 years ago. We worked through all the glitches of it, as did all the special ed staff as well. I would say a typical 504 meeting will last anywhere from 30 to 60 minutes, really depending on the student and their needs and the family's needs. Then you added an additional hour or so of just retyping the plan. And then there's the ongoing work of just notifying teachers, trying to make sure everybody is keeping up with the accommodations. And then we always just have adjustments. And we work on an annual meeting basis, but we typically will meet maybe twice a year at least with families just because things change, diagnoses change, and needs change. So we try our best to be as open as possible. So it's hard to tell because on an average basis, one student is going to require a lot more attention than another. But on a daily basis, I'm going to say I probably dedicate at least an hour to my 504 students. I have a caseload of 177 students for the whole school, and of that, I have probably about 25 504s.
Wow, 175, that's a tough caseload. Just thinking about that, have you seen, do you think this is a post-pandemic effect? Or has the caseload increased before that period?
I haven't seen much of a change in it. Prior to being in CTEX, I was in other public schools in Tolland and North Haven and Farmington as a counselor, and the numbers were relatively the same, I would say percentage wise, I guess, in comparison to the size of my caseload to the number of students with 504 plans.
Okay, so we haven't seen too much growth, because I've had people ask me anecdotally, have we seen an overdiagnosis of 504 plans? And I'd love to hear what you think about that.
I know statewide there definitely has been. My personal caseloads, I think I just have either been fortunate or unfortunate that my percentages usually stay about the same. But there has definitely been a rise in 504 numbers over the past few years. Part of it is, I think, a lack of understanding of what the accommodation plans are meant to do. And that, to note back to the elementary school comment, where it's we see plans coming up from elementary school that are passed through, and once a plan is in place, it is typically very difficult for a district to exit a plan. And so if they're being handed out where there could be more tier 1, tier 2 interventions prior to receiving a 504 plan, that would be really beneficial. But that kind of goes into the training and kind of the oversight to try to make sure everyone is doing things under the same guidance.
Got it. In terms of like data in the state regarding 504, are you aware of any data collection mechanisms that are in place that we have to get an understanding of what the population of 504s is in the state?
From a whole state perspective, I'm not sure. I know districts internally keep their data with the CTEX. Since we are receiving students from so many different towns, we utilize EdSite, which is state-based, but we also only have access to students within our school. So I know there is data out there. It's just not all housed in a way that could be easily accessible and used.
So I think that's part of the problem. If we don't know the population size of what what accommodations are out there and how we can address those in a way that is fiscally easier for our districts, because 504s do fall on an unfunded mandate for districts, and it would be great to know if we can facilitate that at all. So thank you so much. I'm going to ask if any other members of the committee have questions. Nope, seeing none. Thank you so much, Doug, for your testimony today.
Thank you all. I appreciate your support.
Thank you. Next, we have Jessica Odlum. Sorry.
Good morning. Representative Dathan, Representative Vale, and Representative Carney, and the rest of the Government Oversight Committee, thank you for the opportunity to speak today. I did submit written testimony and will paraphrase my support for Senate Bill 424. My name is Jess Odlum. After 25 years in the profession, I left school counseling in 2024. I made that decision even though it meant walking away from tenure with only 4 years left to early retirement. And one of my primary reasons was the exponential increase in 504 plans and their misalignment with my role. I'm a big fan of using metaphors to explain. Hopefully this is an okay metaphor, but let's imagine a hospital nurse assigned to care for the patients on a busy hospital floor. Her role involves checking on all of her patients, explaining doctor instructions, easing anxiety, answering family questions, and coordinating care with multiple providers. Some patients are in acute distress, pressing their call buttons for immediate help. But the nurse is told she must step away for a few hours, at least once a week, to write civil rights compliance documentation protecting 15 to 20% of her patients from disability discrimination by the hospital, with no legal training. Her documentation must incorporate feedback from the patient, their family, and every doctor involved in their care. She must also be careful not to write instructions that would require the hospital to spend any money. She enters the documentation into the hospital's state reporting system and ensures everyone interacting with that patient receives it and follows its instructions. If she mishandles any part of the process, she risks damaging relationships with those patients or doctors, not supporting a patient's disability properly, being considered insubordinate, or even being named in a lawsuit. Fear not, though, she received 1 hour of professional development training in the process last year. If the nurse raises any concerns that this responsibility may not align with her role, she is labeled not a team player at best. At worst, she's being told she's discriminatory, despite simply trying to ensure that all patients receive the care that they need. When she asks the hospital administration whether they also noticed the increase in compliance needs, she's told, "We don't track that data. Why don't you call the other hospitals and see how they streamline their process?" Meanwhile, all patients on her floor wait, and the ones in distress are still pressing their call buttons. And no, it sounds a little bit ridiculous, but this is what's happening to our school counselors. They are all trained to support all students with their personal, social, academic, college, and career development. In addition, they're also expected to coordinate federal civil rights compliance under Section 504 for a growing percentage of students with disabilities. And not to oversimplify this, but I do have faith that this can be fixed. In education, when legislation supports and student needs are identified and deemed important, we hire specialized roles. For example, many districts now employ one or more board-certified behavior analysts to support students with autism because the need for evidence-based behavioral programming became too great to ignore. Students with disabilities deserve civil rights protections, and all students deserve access to school counselors who can support them. Senate Bill 424 is a thoughtful step towards understanding whether our current system allows both of these things to happen effectively. Thank you for your time and consideration.
Thank you so much, Jessica, for that. That's really helpful. So you, I don't want to say retired because you're too young for that.
No, I did not retire.
In terms of when did you leave that role?
In 2024.
2024, okay. I mean, we have such a need for school counselors in the state. I find it so tragic that, you know, this is happening. I think your analogy about patient and how that would work in a hospital was a very good analogy, so thank you for simplifying that for the committee. I did want to ask, you know, you talked a bit about the administrative tasks. Have you found that the administration of managing these cases had grown before in your career there?
Yes. I noticed a significant increase after 2020. Traditionally, 504 plans, when I first started in education 25 years ago, they were more for the traditional medical conditions, like somebody who was hearing impaired or visually impaired. And prior to 2020, but since 2020, definitely, there's been an increase in requests for 504 plans for students with depression or anxiety, behavioral issues, or even attendance concerns. And it's interesting because it's a federal oversight. It's not a counseling program, but yes, there's been an increase. And I do have to say, I had, when I left, I had 245 students on my caseload, which is not a big number across. I mean, some counselors in the state have over 400 students on their caseload, and 18 of them were 504 students, and I would spend about 1 day a week specifically working on 504 tasks related to those 18 students. And so 1 day out of 5 was spent with dealing with 18 students on my 245 person caseload.
Okay, so that's, so in thinking about that, is that administrative task per your district asking? Because it doesn't sound like there's any sort of state guidance. I'm just trying to understand the sort of tasks that you would do. Would that be parent meetings or observations or what is it?
So you have to collect data on the students depending on the 504 plan, administer meetings, this is another thing I'm confused by. We've been entering our information into the state system for 504 plans, so I'm not quite sure why there isn't data available. But part of the process was entering data into systems, reaching out to families, coordinating, reaching out to teachers, making sure that the plans were being implemented in the classrooms. When they're not being implemented in the classrooms, it would put us in a position of having to reach out to the teacher and make sure that they were being implemented. A lot of micro interactions with the students on that particular 504 plan as well.
So just to clarify, you had said, you know, in the past, historically, 504s were sort of minor accommodations for hearing impaired or other things.
Yep.
And it sounds like now the acuity is sort of increasing. What is the determination when a student goes from a 504 to an IEP? And in some of these, I mean, I'm just wondering what the difference might be. Is it a district decision or?
Yes, I mean, we could, it doesn't usually go in that direction. Usually a student has an IEP first and then it's suggested upon exit, the student then moves to a 504 plan, which is not an appropriate way for a student to move on to a 504 plan. So the way I understand it, but again, I've only received various 1-hour professional development training from a lawyer on this in the past 25 years, but my understanding is that special education is to support students who need specialized instructions for their disability that's impacting them in the classroom, and can modify their education, whereas a 504 plan is an accommodation to support whatever disability they have so that they're not being discriminated against in the school.
Got it. Thank you so much. Is there any questions from the committee? Seeing none. Thank you so much for your testimony
I really
today.
appreciate it.
Sure.
Thank you.
Next, we have Catherine Meyer.
Good afternoon. This is the best number I've ever gotten, so this is a big day for me. Good afternoon, Representative Dathan, Representative Vale, and esteemed members of the committee. My name is Catherine Meyer. I'm an attorney at the Center for Children's Advocacy, and I direct our medical legal partnership at the Yale Child Studies Center. CCA is a children's legal rights organization. We protect and promote the legal rights of Connecticut's most vulnerable children across multiple different systems in our state, including DCF and child welfare, juvenile justice systems, immigration, education, all different kinds of systems. And our executive director will be speaking right after me, so she can add to that. So our clients are children with the highest level of needs. These include kids with intellectual and developmental disabilities, kids with communication impairments, kids who are medically complex, kids with mental health challenges that manifest in school in behaviors and challenges like our last speaker spoke of. And with dismantling of OCR and the unstable federal landscape for disability protections, it's really imperative that our state steps up to fill the void, to strengthen the infrastructure so we have meaningful legal protections that we can enforce at the state level. And we thank this committee very much for even raising this bill. It's really complex, and we're really interested in being part of further conversations because you're trying to do a lot of things, and it's incredibly challenging, as you well know. Just to give an example about a student that we might have previously gone to OCR for and now cannot. So again, the last speaker talking about a 504 plan, a really simple example would be a student with a mobility impairment, so a student with a wheelchair, right? So if the student had a 504 plan that included accommodations for this physical impairment to make sure they can access general education like any other student could, and the elevator was broken for weeks and weeks and months at a time. We have a current case that this is the scenario. We might be able to go to the Department of Justice for an ADA complaint, but we definitely would go to OCR and we would ask them to investigate. We'd ask them to implement, develop corrective action and, monitor and have some oversight over that corrective action. And that was really powerful because that could provide systemic legal changes in that district that could hopefully prevent this from happening again and kind of look at the real structure that enabled that kind of thing to happen. And we don't have that anymore. So one of the things that we want to ask more about or discuss further in this bill is trying to understand how we want to have the oversight and governance structure of this office of the educational ombudsperson. So this office is being tasked with a lot of different things. And so we just want to make sure that that's really specific authority that we're giving to this office, that we have obviously the staffing it requires to undergo all these activities, that we have timelines in place, and that we have transparency around their activities. Oh, okay. So in closing, thank you for raising this. Again, it's trying to do a lot of things, and we're really grateful that a committee has raised this year. We'd love to be part of further conversations, and thank you for your time.
Great, thank you so much. I was actually just trying to find your testimony. I think I've just looked in the wrong spot, but I believe it is there. In terms of your experience and your caseload, is your caseload increased over, let's say, the last decade?
Yeah, so I've been at CCA for almost 17 years. We have no shortage of need. I would say the needs have increased in terms of the intensity and the severity of the issues that children are facing. So I right now work mainly with Child Studies Center patients and clients, but our office has intake lines in both Hartford and Bridgeport. And in terms of educational needs, because post-COVID, the staffing shortage has been just disastrous for our clients. They are, they're impacted in a disproportionate way in terms of special education staffing, particularly supervision of children and support of children who have different kinds of disabilities, from the kids in a self-contained class who might not be able to communicate their needs or their experiences at school, to kids who do need additional behavioral support and there's just not staff to take care of them, and they might just send the kid home early, or have to exclude the child in different ways.
Okay, I don't see your testimony, but
We have not submitted testimony
Oh,
yet.
okay, I
I'm
was
sorry.
like looking for
Sarah
it.
and I will be submitting right after this.
Got it. I
Yes.
got it. That if you can make sure that you do.
Of
'cause
course.
I would like to kind of check out some of the things that you talked about in your testimony.
Sure, we agree a lot with our partners, including SEEK and DRC, so we have some similar suggestions.
Awesome. Thank you so much, and looking forward to the discussion to continue. Any further questions? Seeing none. Thank you so
Thank
much,
you.
and maybe you should buy your lottery ticket if you got such a good number today.
Well, I was lucky number 7, and then I got
Okay.
bumped to 8, so
Okay.
Thank you.
Well done. Next, we have Sarah Egan. Nice to see you, Sarah.
Nice to see you as well. Hello to the committee. My name is Sarah Egan. I am the Executive Director of the Center for Children's Advocacy, which is a statewide legal rights organization dedicated to individual and systemic advocacy on behalf of children. I wanted to say a couple comments about 5474, the Correctional Health Care Bill, just to make sure the committee is aware of how many young people are in the Department of Correction custody and the history of very serious concerns that have been documented by state and federal investigators about the delivery of all kinds of things, but including mental health care to young people. The Department of Correction is currently has a DOJ contracted monitor that oversees compliance with a federal settlement with the state of Connecticut that was completed in 2024. So just in brief, and there's more detail in my testimony, I think it'll be important to make sure that the report and the efforts that this committee is undertaking with that bill contemplate the unique needs and accountability for delivering appropriate health care to children in the Department of Correction custody, and that those expectations align with the settlement that the state of Connecticut has agreed to improve health care delivery. I'm happy to answer any questions about what that is or how long that's in place or what's going on with it. But I also wanted to say a few words about the trafficking bill, 5476. So CCA represents dozens of children involved with DCF, and if you're a girl, 11, 12, 13 years old and up, and you are placed in the system, you are at extreme risk of trafficking. I mean, right now on our caseload, we have children who meet the exact profile of the children that you're trying to protect here. So we are in strong support of your efforts here, and much work is badly needed. I wanted to emphasize that I appreciate the committee's leaning in on transparency and accountability for conditions in state-licensed shelters called Star Homes, which is where a lot of these girls and boys rotate through. This is an inappropriate level of care for virtually anyone placed in it, and we know that children run persistently from these placements, have trouble in the community, are victimized. I would suggest that the reporting out maybe more easily comes respectfully from the Department of Children and Families, and there's very specific deliverables we put in our testimony that we think DCF could easily report out on a semi-annual basis, including AWOLs, 136 reports, abuse and neglect reports, median length of stay. It's supposed to be a temporary setting. It often is not. Clinical staff vacancies, any corrective actions they've issued on someone's license, any remedial agency actions they've taken to improve outcomes for children, and whether they are doing routinely the assessments for runaway children when they return to these settings. So that's it. Perfect timing.
Thank you so much. You're a pro. So thank you for highlighting some of the things that we actually discussed last, I think it was August, when we had a hearing on the performance report of DCF and some of these issues that came out. And that was really the sort of kind of why we decided to work harder on this in the off session and coming to a bill. My good co-chair and I have been working on this for many months since that discussion, and also in light of everything that's happening federally with things that are coming out. I think one of the most disturbing things that came out of that hearing was a comment by one, I think somebody in DCF, I think it was the then commissioner at the time. She said that there was a young person who was actually proud of being trafficked. And that was actually heart-wrenching. And it sounds like there is some really deep trauma issues that are happening that are making these children even more vulnerable. In your experience in working with these homes, are they really trained well in terms of trauma-based informed therapy, responses?
So, yeah, thank you for that question, Representative Dathan, and appreciate all the work that you've been doing. We followed that hearing and that report from the auditors very closely, right? And there's a lot of work to be done to improve our system of care generally, right, to support these girls and boys. If your question refers to the STAR homes themselves, I think it's fair to say that that level of care, and those homes are licensed as youth shelters, remains a substantial work in progress for a variety of reasons. Not that DCF has not made efforts to improve the model. I think they have, and they've reported out on that. But it's very challenging to fix that in a vacuum of the rest of the system, and it continues to be troubled by, and why I said in my earlier testimony that, in my view, and yes, it is my opinion, my professional opinion, that it is rare that that is an appropriate setting for any of the children that are placed there, because it's not a short-term assessment and respite center, which is what it was once designed to do. It's a place to go for children who have nowhere else to go. It's often children who are long known to the department or the systems. It's children with extensive child abuse and neglect histories, often extensive involvement with the state, and extensive histories of psychiatric treatment. Not insignificant percentage of kids in those homes have intellectual or other developmental disabilities. DCF's recent report that Deputy Commissioner Tina Jefferson referenced to the JJPOC, I think, put that percentage, and I'm going on memory, at 16%. Now, that's snapshot in time data, but wow, that seems, I don't think anybody would think that that's an appropriate setting for these children. And the training pieces, I think, good faith efforts are being made, right? I've participated in lots of groups to look at training curriculum, standardizing training, improving programming, but it's a constant challenge. It's an uphill battle, in part because you have so much rotation of staff. It's hard to retain direct care staff to do the work. I haven't looked at the data very recently, but I'm sure lots of clinical vacancies throughout that level of care. And the kinds of problems that have been publicly reported, both by the auditor in the hearings, but also in other forums over the last couple of years, the 911 reports, the runaways, all of that, I think it would be a major question as to how much improvement there's been with those kinds of statistics. So I think there's effort, but I think what we need more of is, where are we in terms of the impact of those efforts, and are things improving, and how do we know, right? And just as a final sort of response to that, what we see on our cases at CCA, and we represent a fraction of kids involved with TCF. We have multiple children that we have represented who are just on this dangerous treadmill of not being able to find a foster home, being in a STAR home. Everybody runs away, right? Run away from the STAR home. Something bad happens, go to the hospital, come back. And yes, one of our clients, a young child, was trafficked, while she was out. This is a young teen, right, who's now back in the hospital. So, there's a lot of work to do, but I think this bill that you've put forward, which creates all these different requirements and transparency and accountability, is an important step.
That's good to hear. We know this problem can't be solved in a single legislative session, and it is vital for us to think strategically and long-term on how we can address this. and think about how we can work across agencies. Because, you know, we're just right now talking about DCF, but there are other agencies that are seeing these sort of issues, and it's really important, particularly in just everything that you said. So appreciate your testimony. Looking forward to seeing it. I do have a Representative Vale.
Thank you, Madam Chair. Good afternoon.
Hi, good morning. Good afternoon.
I'm going to ask you a few questions.
Sure,
'cause
please.
What's a star home?
So no, I'm going to forget the acronym because it changed. But the STAR homes used to be STAR, and that stood for Short-Term Assessment and Respite Center. And it's a model of care that's probably been around 20 years, maybe 15, and they were designed to be sort of a fail-safe in the system, like a stopgap, right? Child comes into care, you know, an older child, right, 13 up, comes into care, and maybe there isn't an immediate foster home available, we're not sure what the appropriate setting is. It was contracted to be, and I think still is, a no more than 60-day length of stay. It is an entirely state-funded facility, there's no Medicaid reimbursement for it. And it has never been considered to be a treatment setting, right? It is licensed as a youth shelter. Because of the concerns, there were several public reports about concerns a few years ago in the press about a particular STAR home with lots of police involvement and sexual abuse and all kinds of things and lawsuits. The legislature held hearings about maybe 2 sessions ago, maybe 3, about the STAR homes, and DCF did put together a comprehensive plan to try to fix that level of care by reducing the census, increasing some programming, and creating some other treatment beds in the system to try to move kids with more complex needs out.
All right.
Sorry.
No, it's fine because I need to process this. So it's a temporary hold.
Correct.
For children from what age to what age?
So probably, I mean, without referencing sort of the contract, let's figure 13 to 17 to 18. Yeah.
Thank you. And how many are in the state of Connecticut?
I think we have 7 STAR homes right now.
So they're funded by the state, but
Correct.
who operates them?
DCF. Well, DCF licenses it, and they're operated by private providers, contracted providers.
Is there oversight to them?
So
The STAR
DCF is
homes?
the funder and the regulator.
So when we had our audit report with DCF, would that fall under that or no? So our auditors wouldn't go to the STAR homes. They would just analyze their data?
They analyze the data. The Office of the Child Advocate can go into, I don't know if the auditors can go into the homes. I think they may be limited to the data, but I'm not 100% sure. That's a good question. But the Office of the Child Advocate it has access to any DCF, any state licensed or state-funded facility, and probably Disability Rights Connecticut may as well.
And you mentioned, so is there an overwhelming amount of people that are being trafficked that are from the STAR homes specifically? Is it greater? Is there a percentage? Do we have statistics like that?
So I'm glancing at a couple of my colleagues over there who are experts. I think the subject matter experts on sexual abuse of girls in the system, it's a pervasive problem. Yes, I think that when we talk about the population of kids that are at risk of or experience trafficking, there's many, as Deputy Commissioner Tina Jefferson talked about, who are not involved with DCF. But long-standing sort of research and data tells us that kids who are in state facilities are at unique risk of being trafficked.
Okay. Can you define being trafficked?
Being sexually groomed, exploited, often but not exclusively for pecuniary reasons, but exploited by an adult for sexual abuse and exploitation reasons.
Okay, and in a specific environment, are they being brought somewhere else? Are they being groomed?
Yeah, I think so. It's a range of of different scenarios. It can be, I mean, sometimes kids, run and are picked up by adults that they've been groomed by or contacted by. Sometimes there's a financial arrangement. Of course, these children are so young, right? Sometimes 13 years old. Sometimes it's people they knew, sometimes it's people they met online, and who can offer them something, right, that they want. Sometimes they're transported to places that they are then sexually abused and exploited. They may have had children sometimes have an entirely different expectation of what's going to happen in this adult-child relationship than what does happen. So it's a variety of different scenarios that take place.
And if they're at these star homes, I'm going to get back specific to the star homes.
Yeah.
Are they staying at the star home, leaving, being abused, and then coming back to the star home, or are they just gone from the star home?
Both scenarios, right? So they may come back on their own. They may be brought back. They may pick up children on their own and the community on runaway status are at risk of being picked up for sort of juvenile, often very low level juvenile charges. So they may wind up in detention because they're sort of off on their own, and they may be brought back to the star home because that was their last placement. They may wind up in an emergency department. It's not uncommon to see children in an emergency department or in inpatient hospital bed, then discharged back to a star home. So it's sort of a revolving door.
And so obviously if we know this data that people are being, or young children are being trafficked, who's reporting it? Like, what action's being taken by police or any law enforcement agency? It's disturbing to hear that we know this much is happening and people aren't being held accountable, or are they?
So I think there are a lot of efforts in place, Representative, to deal with information that comes through. And there's a suspicion that a child has been, there's multiple layers of intervention that may be available and happen. So one is, and one of the things I mentioned in my earlier testimony, is when a child comes back, right, or surfaces, or is found, they should be screened automatically just for having been on runaway status, right? They should be screened automatically for whether or not they have experienced sexual abuse or some other form of trafficking, right? Then there should be referrals of any child to these multidisciplinary teams that other folks may have already talked about, will talk about, and can talk about today in more granular detail, where there is a team of professionals, including law enforcement, that look at these cases, make sure that victims are referred to appropriate services in the community, that law enforcement takes action. I know one of our chief law enforcement folks from the state's attorney's office is also here today and will be testifying and can talk about that as well. So there's definitely things in place to ensure that there is coordination across state and local agencies to assess what happens to children, bring in law enforcement, conduct criminal investigations, and refer victims to appropriate services. I think in a lot of what your bill is trying to get at is that working as well as it should? If not, what is the blueprint for? There's a lot of work being done by several people in the gallery today, creating a blueprint for the state in strengthening that cross-agency collaboration and enhancing service delivery to these children, because you're right, there is substantial room for improvement at every level, from the infrastructure of the settings to the, which is part of this bill as well, talks about that, to the coordination between the agencies, to the appropriate funding for the services that these children need. There's just not very much to connect them to. So I think that's what a lot of this bill is trying to get at. I focused on that accountability for children, a percentage of these children that are living in state custody and for whom the state is their guardian or even their statutory parent, meaning their parents' rights have been terminated. And we have unique obligations to those children because they are dependent on no other adults other than the state of Connecticut. And so that's why I focused my testimony on the need for continued improvement in terms of safety and service delivery for children in state-licensed settings and who are trafficked from those settings.
So if they come back a runaway, and they're going to go through screening. Who's screening them? If they go back to a star home, is someone there going to screen them?
Yes.
And can we trust 100%, not to throw them out under the bus, that they're going to do their due diligence, even if it makes them look like they didn't protect the child in the first place? Are we going to get it? Like, I can't even fathom how a human adult could do this to a child. The fact that it's this widespread really kind of pisses me off. And if we're not doing enough to stop, I mean, it's crazy. You hear about it nationwide, but it's happening right here in our community. We need to do more, whatever that is. But if I'm concerned that I just don't see how this can be happening, and that we need to tighten this thing up, both with getting children the right care and service they need, but also with finding and punishing those who are doing this to the children. I think it's a broad scope, but I appreciate your testimony. I might reach out to you with more questions, as I've already probably gone a little more than I should have. So thank you.
Thank you.
Thank you, Representative. You had very good questions. Just to let the representative know that human trafficking is defined in our statute for a variety of things. It's also in 22 USC 7102, and it talks about different types of severe trafficking, which includes not just sex trafficking, which we were just referring to, but also the recruitment, harboring, transportation, provision, or obtaining a person for labor or services through the use of force, fraud, or coercion for the purposes of subjection to involuntary servitude, peonage, debt, bondage, or slavery. So it's very encompassing to a variety of things. I think we also have to think of immigrant communities that are at risk. They come into the country, some legally, some not. We're going to leave that one aside, but their passports are taken, and then they're required to work in some sort of service to pay off their debt of being brought to the U.S. So this is beyond the scope of this committee, but what we're talking about here is how we can make sure that children that are under the care of DCF are also taken care of. And also, just to follow up, the auditors didn't visit the homes per se, but talked to the one or two of the directors about how they handle runaways, and that was covered in the report as well. So thank you so much. And again, this is a multi-year initiative, and it's glad to hear that we have partners who are supporting this and advocating for the victims.
If I could just say one final comment, Representative Dathan, to your raising the comment that stuck with you from the hearing on the report about the child who may have
glamorized it.
Right. I was struck by that because, I mean, when you work with kids, right, you hear all kinds of things from them. And I think it is not uncommon for kids to posture in that way. I've had kids tell me all kinds of things, right? And then they look at my face to see like how I'm going to react to that, right? But I think the common theme for a lot of our teenagers, both boys and girls, and I've worked with incarcerated children, all of these types of placements, is that pervasive feeling of worthlessness that many of them have. And it may come out in different ways, right? Aggression, acting out, bravado, internalizing depression, but they have received this message over time that they don't have value and that they can't trust adults and that somehow it's because of them. And I do think that's pervasive. And one of the hardest things that we have to work on with these kids is showing them that they have value. So,
which is why we need trauma-informed therapies. So thank you so much for your testimony today. Okay. Next, moving on to number 10, William De La Camera.
Thank you, Chair Dathan, Vice Chair Gucker, Ranking Member Carney and Distinguished Member Vale. I'm here today for SB 425. Thank you for the opportunity to submit testimony in support of SB 425, which would require state agencies to develop and report annual performance plans. At its core, this bill is about something very simple: transparency and accountability in government. The people of Connecticut deserve a clear way to understand what state agencies are doing, what their goals are, and whether those goals are actually being achieved. Creating a structured performance plan is not an unreasonable ask. In fact, most private businesses and organizations already operate this way. They set goals, track progress, and measure outcomes so we know whether they are succeeding or need to adjust. Government should be no different. In light of some of the recent headlines involving state agencies, and even more situations that never make it into the news, it is reasonable for the public and for legislators to want a clearer view of how agencies are performing. Transparency helps build public trust and ensures that problems are identified and addressed sooner rather than later. Performance plans could also help government work more efficiently and effectively. When goals and benchmarks are clearly established, and it becomes easier to identify bottlenecks, improve processes, and deliver services faster for the people who truly rely on them. If anything, measures like this should be viewed as basic good governance. If a legislator or agency were to oppose transparency or performance reporting, it would be fair for the public to ask why accountability would be a concern. SB 425 provides a framework for agencies to define their objectives, measure progress, and report results. That benefits legislators, the public, and agencies themselves. For those very reasons, I respectfully urge the committee to support SB 425. Thank you for your consideration.
Thank you, sir, for your very thoughtful testimony. Clearly, you put a lot of work and thought into it, and it's very much appreciated by the committee. I did want to highlight one of the, responses to and testimony by DSS, and all of their programs participate in a number of federal and state reporting, planning, and performance monitoring requirements across these programs, which is a huge part of our budget. So I just wanted folks to know that there is some of these things in place, and I think your testimony was kind of more broad of thinking of all the different agencies maybe that don't have these sort of subject to requirements. Just wanted to highlight that. So thank you. Any comments from the committee? Oh, yes, Representative Carney.
Thank you very much, Madam Chair, and thank you very much, Mr. Della Camera, for testifying. And thank you for everything you've done for farmers, both in the state and federally. You really have been a true leader with it, and I'm sure so many people are grateful for your leadership in doing that. My only question is there an agency that you have had a particular issue with that you don't think is being transparent?
I don't think there's one particularly, but it seems that a lot of these times we end up back here is because something's not working right. One of the ones I've recently heard is that the permitting process for things in DEP takes time. And, I was here to speak on another one about the overview or the new reporting things for DEP, which I think are fine, but I think a lot of those things would probably not end up ever here in front of you guys, and you guys could have more time to enjoy these beautiful days we have if we didn't have to keep hashing out something about everything every year. It seems like every year we try to add a new piece to the puzzle or take a piece out of the puzzle, and it seems like, I think life would be better for all of us if that puzzle just came together a lot easier. Maybe I'm looking at a broad picture. Like I always said, I want to be part of the solution, not part of the problem, but I don't know if it just getting discouraged and seeing a lot of this go back and forth every committee here. Am I seeing something that other people aren't seeing? I don't know. I don't get it anymore.
Yeah. No, I appreciate that, and I'm glad you mentioned deep, because I've had constituents that have run into issues, similar with permitting, and it is very difficult to navigate, why they're making the decisions they're making, or to get full transparency on that. So I appreciate you mentioning that, and I know, this committee, was formed last year to hopefully look at a lot of what you're talking about. And I appreciate you bringing this to our attention and focusing on this, because I don't think enough people do. And so
there was recently an auditor's report put out for the Department of Ag about the governor's committee for agriculture that hasn't been sat. And it seems like, I would be irritated if I was in your position working towards all these goals and they weren't being met. And it sounds like, even sitting here today, there's a lot of checks and balances and a lot of reports that are getting just not even looked at, not even conveyed to other people, and they should be. And where do we start? If it's not this bill, it's got to be some bill, right?
Yeah, no, I appreciate that, and that's one of the things that I'm happy about with this committee, is we are looking at those audit reports, and we're having hearings, when those audit reports come out. And I don't know how many people were looking at these reports before this committee started. I'm sure some legislators were, probably not a lot. So hopefully, as this committee goes on, we'll be able to uncover a lot of the issues, and as we're doing today with some of the reports we've seen, hopefully put legislation forward to fix some of those issues. So I appreciate your testimony.
Thank you.
Thank you. Representative Vale.
Thank you. Since you brought up, it is frustrating being here. We are a legislative body of the people, and sometimes I think people in Hartford forget that. So I don't think any state agency, every one of them works for us. Not me, but me as a citizen, not me as a state rep. And so I do think it's important. I do share your frustration, and I am glad that this committee has been formed, and I'm happy to be a part of it. Hopefully we do some of that work, but I just co-signed this legislation because I think it's that important. So I appreciate you coming up here and advocating. But yes, it is frustrating, but hopefully we're gonna do our best to try to make everything more transparent. Thank you.
Thank you.
Thank you. That's the goal of the committee. So I do appreciate it. I did want to highlight for you the testimony from the Office of State Ethics, and they talked a little bit about how this might be structured a little bit better, because they were saying that with the current drafting, there were some issues, and then the auditor said there's also some issues that would hurt their independence. So I think this is an ongoing discussion, and we're going to keep having it. And one of the reasons that some of these discussions take place over many years is because we are a part-time legislature, and we don't get to quite get over the finish line because some of these things are not fully developed by the end of the session. So appreciate folks like you that come out and year after year and maybe say the same things. And I echo Representative Carney and his remarks about our farmers in our state. So thank you so much, sir.
Thank you.
Next, we have Tom Kosker from DRCT.
Hello, Tom Kosker, Disability Rights Connecticut. Good afternoon, members of the committee. Thank you for having me here. Today I'd like to talk about SB 424, the oversight of 504, et cetera. It's kind of a long title. I think you're going to hear a lot today from other people testifying, and you'll see in written testimony, which mine is not in yet, but I will get it in, Rep. Dathan, with some more details. But you're going to hear a lot of the details of how people feel this might need to be laid out as far as oversight of 504 plans for students with disabilities. Again, as an advocate with Disability Rights Connecticut, we get calls from students, from families, from advocates all the time related to issues both in special education, students with individual education plans, IEPs. There's a process for that that's overseen by IDEA, Individuals with Disabilities Education Act. There's a process, a due process that parents have a right to use through the state of Connecticut. There's discrimination issues we deal with every day that are dealt with by CHRO and others. But this area of 504, we're really happy that you guys took this on, because it's an area that parents and families and students don't necessarily have a place to go. So I think the educational ombudsperson is a great spot for this. Again, sort of separate from CSDE, separate from CHRO. Expertise in education is important. Obviously, these roles have to be filled. This has to be staffed. I think the staffing of it is critical. You'll see that in some testimony, including mine, that it's more than a person's duty, right? I mean, this is a staff that's going to take to do these things. But the funding for that is important, obviously. The staffing for that's important. And the expertise is important. I think sometimes we rely on one system to oversee and compliance or complaint system for something that people don't have expertise and knowledge on. And the educational world is certainly has some specialty within it. I think one specific thing, and again, I'll highlight some of this in my written testimony, is the ability for this ombudsperson to issue corrective actions, for example, and I speak of this from my experiences on the special education side when an investigation is pursued and things, or findings are made and substantiated, and then corrective actions need to be put in place. So I think it's important for that role, that person, that staff, that position to have the ability to issue corrective actions, and follow up on that is another important piece that we often see. Corrective actions are issued, but there's no follow up on did they actually happen. So those are just a couple details. I won't go into too much more, and I will just give an example, because I know someone here gave an example earlier, I think it was Catherine Meyer, of a student with a disability who, there's many students on 504 plans who do not qualify for special education services because they might need accommodations in their education. And I had recently a phone call with a parent, that's my time, I'll finish up, who had epilepsy, right? They had no other real educational needs, no learning disabilities, no other issues, but they needed some accommodations around this child's epilepsy for medication, administering medication, for just watching the student and safety concerns for the student and things like that. And we did some really good things a couple years ago on seizure-safe schools, actually, for epilepsy in Connecticut. So we've done some great things, but that's just an example of a student that might need accommodations. And if those accommodations aren't met, or that student doesn't get what they need, the family needs a place to turn. So I appreciate you guys bringing this up, and I'm here for questions.
Thank you so much, Tom. I actually was going to bring up the seizure work that we did a couple years ago, because it's really been beneficial for many families. If you're a parent and you see your child have these sort of things and suffer, you want them to feel normal. And if we can create a normal working school environment so that we can limit these episodes, I think it's great. So one thing that I was going to ask, and I asked somebody else earlier, do you feel like the caseload in that you're seeing of violations over time has increased because there's sort of no place to go?
I don't know, and I don't have the stats on it, although I know some testimony will be coming out later, and some written testimony from SEEK actually has some of the data in it, as far as how many complaints that the OCR takes around 504 complaints, et cetera. And I don't think it's changed a lot, to my knowledge, over the years. I think the issue is, like, without that place to go now, what do we do with those few hundred complaints, right? It's 200 to 300 complaints a year that are issued to the federal government. Somebody's got to see those. So I don't necessarily think that's an issue of an increase of them. I just think it's need a place to go and a place to, and as well as just the oversight of 504 plans. I know someone else brought that up as well, and I know that's a piece in here, and this is not a completely fully developed bill yet, but there's some pieces in there around oversight of the 504 plans that the staff and the school, you heard from a counselor, needing that kind of guidance and help and support for them, which is an important piece as well.
Yeah, exactly. It's also, like a few other things on our agenda, our multi-year initiative, and I think this is one thing. I know last year we did create the educational ombudsman as part of our work that we did in our 25 session. Sadly, that role was removed in the governor's budget, and our efforts here is to make sure that's reinstated. I think it also offers opportunity for parents who may not have the means to go hire a lawyer and fight this in a court environment, a way to be able to rectify the issues. And especially if parents don't necessarily know their rights, because we know that this is all covered under IDEA, but if they are not familiar with how that works, they could fall through the cracks, and then who loses is the student. So thank you so much for your advocacy today and your testimony. Appreciate and looking forward to seeing your written testimony when it comes. Seeing no questions, you're free to head up to Human Services.
Thank you very much.
Thank you. Next, we have Virginia Messina. She is remote. Virginia, are you there? Virginia? Okay, we'll come back to you. Rachel Mirsky.
Yes, I'm here. Good afternoon, Representative Dathan and all members of the committee. I'm an attorney here at Disability Rights Connecticut. I work with Tom. I am testifying today about HB 5477 specifically. Some of you may know that I'm the author of a public report that was recently released back in December regarding DOC's failure to protect female prisoners from sexual abuse who have mental illness at York Correctional Institution. I know someone asked a question about why we chose that prison, and I'm happy to address that later. We do support HB 5477, and I'd like to briefly mention some of the highlights as to those issues that greatly impact the people that we serve. Implementation of video surveillance. Video surveillance is an effective and necessary tool in safeguarding prisoners from sexual abuse. It is sometimes the difference between the DOC accountability to protect prisoners and DOC doing nothing. DRCT's report identified over 70 blind spots at the women's prison where there is either no or inadequate video surveillance. The drafted language in this bill will help rectify this very glaring problem that continues to place female prisoners at risk. Agreements with outside providers. Currently, the DOC does not have enough staff to address the mental health needs of prisoners, including victims of sexual abuse. Agreements with outside providers help fill this need. This support should include a non-recorded confidential reporting hotline and ongoing mental health treatment. These services must be provided without cost or time limitation and without DOC interference. The staff duty to intervene. DOC staff should have a duty to intervene when he or she objectively knows that sexual abuse has occurred, and failure to do so could lead to disciplinary action. This language is a necessary deterrent to ensure that the DOC practices and work culture do not cause willful blindness towards knowledge of sexual abuse. Staff disciplinary sanctions for delays in investigating. DRCT publicly reported on the systemic failure of the DOC to timely and fully investigate allegations of sexual abuse. Disciplinary sanctions will likely fix this issue. Investigations outside of the the reports outside of the DOC. DRCT also recommended that the DOC must report about its investigations to an independent entity. No one was looking at these details as much as DRCT before this language was being proposed. There's also language in this bill about the expansion of sex assault in the 2nd and 4th degrees. Currently, our state law requires that if a person is going to be charged with sex assault, that they have to supervise the prisoner, but this proposed change is really important that you only have to be a DOC employee. I just want to point out broadly that the DOC creates an environment ripe for sexual abuse, while it fails to protect the individuals in its care. We have a really important duty to do something better, and that this bill really highlights a lot of necessities that are necessary to support and protect the victims, that it continues to happen, but that a lot of the safeguards proposed in this bill will help fix that issue. Happy to answer any questions. Thank you.
Thank you, Rachel, for your testimony today. Just a couple questions. First of all, is your report that you've referred to, is that publicly available?
It's available on our website. I've sent it to many legislative members, but I can send more copies if necessary. Yes.
Yeah, if you could maybe send a copy to our clerk, Greg Wolf, and he can share it with the committee so folks can get a better understanding. And I appreciate the work that you did in that report. It was very helpful to me in our development of this bill. Can you give me a little bit more further details about the blind spots? I think you said about 70 in the report. Can you give some more details on that?
Of course, yeah, it is over 70. This is based on a report that the DOC actually did. It's really a combination of that report and also our own investigation, which acknowledged that the DOC knew about several blind spots since at least 2016. I say at least because it's very likely they knew about some prior to that. The report that I just referenced is from 2023. The DOC hired their own contractor, and that person did a large summary of all of the issues, which equates to over the 70 plus camera issues. Those camera issues include the installation of cameras, replacement of old ones that are not working properly, or maybe they're outside the range of where they need to cover. It also includes recommendations for maybe lowering of cameras that are currently in place, but again, the angles are a problem. We see those happen often in locations in prisons where they're commonly having allegations of sexual abuse. We see that in common areas in the housing units. We reported on this in one of the very large laundry areas. Some of you may be aware on this committee that there was a victim who's an individual. She's publicly known. Her name was LaShonda Gregory. She is part of our report. She's obviously represented by counsel at this time, but I know that issue came up, and she's a victim as well. That was related to a laundry room issue that came out. And also, the other thing I want to point out is that this contractor also talked about what those improvements might cost. I recognize a lot of times when we talk about improvements, cost is an issue, but that was already calculated by this contractor and is known to the DOC. They've known about it. It's 2026, and even with all the information they need, we're still sitting here wondering what the DOC is doing.
Great, that's really helpful to know. Something else you mentioned was the audits and the federal PREA audits. Can you kind of elaborate? These are not done by the auditors of public accounts, and just wondering who is doing them.
PREA audits, they're done every 3 years. It's a requirement by the federal government, not the state of Connecticut, obviously. This is done by whomever the federal government chooses. Historically, they choose the federal government as a contractor. It does vary state to state, although one thing we discovered is that there seems to be a particular individual that a lot of states use over and over. One of the biggest glaring issues is that the DOC, even though they do publicly publish that information on their website, they're in compliance every single year. And the reporting that we did is showing that there are issues that this auditor is not picking up. If you recall from the report, we worked on this for over 4 years. And I would suggest that if we're finding these things, what is the auditor doing? It might be a question of what that person is looking at. But it does impact the funds that the DOC does receive from the federal government, and there's a huge discrepancy. So in that sense, I would say it's a really important consideration. Although it is briefly referenced in the bill today, 477. There's a comment in there about auditing. I would strongly encourage Connecticut to consider doing its own independent state auditing. And what I mean by that, just to clarify, is not to just have someone look at the federal audit for discrepancies or concern, but to start over from the beginning and do their own audit separately from what the federal government does.
Got it. So with that audit, currently our PREA audits are done on a facility by facility basis. Would you recommend that if we did a separate audit, we could do the whole DOC as a unit? Or do you recommend that these individual facility by facility audits are better?
It would probably benefit the individuals that are reporting the allegations to have things being done on a facility basis. I recognize there's a financial burden there, and that could be one of the counter arguments. However, I believe Beth Hamilton in her testimony was asked a question about why we're discussing York here and not the other facilities, which I think touches on your question. I do think you have to treat everyone differently because we see more reporting in the women's prison. It does not mean that the men don't have allegations of sexual abuse or harassment, or that they don't suffer. That's not what I'm saying. It's just that I think it's hard for us to, if we look at this very broadly and say all of DOC is one audit, we're gonna miss some of those small pieces. And some of those small pieces have to do with, well, just because the reporting might be different between facilities, and then you might say, well, what's substantiated and what's not substantiated? We also need to consider the culture here. There's a work culture with the staff, and then there's the separate culture of shame associated with either reporting sexual abuse, not being heard, or what happens if the DOC decides that something you've reported doesn't fall under PREA and therefore we are not going to investigate it, which I think was suggested in previous testimony by Ms. Hamilton as well. So those are other concerns to consider, that if you don't consider those other issues, and you do a big audit, the big audit is going to miss some of those important details that we need.
That makes sense. One last question for you. I think it was in York, I think it was the ombudsman had mentioned that there's a PREA hotline, but it's in the middle of a common area, so it's not really accessed by many on a confidential basis, and it inhibits people wanting to reach out and make a complaint. Did you note that at all in your large report that you did?
It's not something we specifically covered. Just as a reminder to the committee, Disability Rights Connecticut has to follow federal law, so everything we do is confidential until we make it public. We made decisions about what to report on based on our findings. I will say that we don't disagree with anything that was said about the hotline. We know that there's a requirement in the federal law that individuals have the right to report things to the Connecticut State Police. I understand there's a comment in the bill about other entities investigating. In terms of privacy, about whether someone reports it to the DOC, reports it through the hotline, reports it to the state police, we have concerns that there's privacy concerns across the board. And we also have concerns not just about the privacy or confidentiality, but also about who is receiving that information and who is taking it seriously. I can broadly say, and we see this happen all the time with state agencies, if you have a state agency investigating itself and no one else is looking. So if someone wanted to report an allegation to a DOC employee, or picks up a phone and is really reporting to the DOC, which is what happened until recently, that's concerning, because they have this judgment to decide what I want to document, what I want to proceed and look into, and what I want to disregard. So, and that speaks to the privacy also, which someone's not going to want to report something if a staff member can hear them or an inmate can hear them. And the last thing I'll say about it, and I apologize for the long-winded answer, but the one thing I think others have not mentioned is that if you go into a prison, often, depending on where you are, what housing unit, things echo. So we're talking about privacy, people listening to you. Maybe staff may want to engage in retaliatory behavior if they hear something, but we're also forgetting the physical optics of the space, which is things echo, and that adds to the privacy concern as well.
That's a very good point. These are very old facilities. Most of them are older than everyone in the room. So thank you so much. Do we have any other questions? Seeing none. Thank you, Rachel, for your testimony today.
Thank you.
We are going to do a quick jump around because we have a accommodation for somebody here. Alex Brown, number 27. Thank you, Alex.
Good afternoon, co-chairs, vice chairs, ranking members, and members of the Government Oversight Committee. Thank you for the opportunity to testify on HB 5477. My name is Alex Brown. I'm an MSW student at UConn and a policy and advocacy intern at the Connecticut Coalition to End Homelessness. But today I am here to testify as someone who has spent years incarcerated at York Correctional Institution. While I was incarcerated, I was sexually assaulted by a correctional officer over the course of several years. And my case is included in the Disability Rights Connecticut report that Rachel just mentioned before me. Incident 6, Jane Doe number 4. I share that because I am only one of many that this has happened to. And I also know how difficult it is to report when you are on the inside. When abuse happens for years, it is because the system has created a culture of silence where people who are incarcerated are afraid of retaliation and know that things will get worse for them when they speak up. While I appreciate the intent of this bill to address sexual abuse in our prisons and fully support the IMRP and OPM's involvement, there are several parts of this bill that need to be strengthened to actually protect people inside. I want to speak directly to the language in HB 5477. In Section 11, the bill's language uses the term "a person who is incarcerated," but in the rest of the bill, specifically Section 1, 7, and 8, the word inmate is still used. If we want our laws to reflect basic dignity and humanity, the language should be consistent. Section 6 of the bill creates a confidential hotline, but confidentiality does not mean anything if the calls are recorded, and all calls in prisons are recorded and monitored. If DOC can listen to those calls, people will not use the hotline. For the hotline to actually work, the bill must clearly state that those calls cannot be monitored, recorded, or accessed by DOC in any way. Section 6 also discusses support services. In order to have adequate support services for incarcerated people, staff must be trained and specialize on this population, and they must be able to work independently without any oversight from the DOC. Section 11 creates a duty for officers to intervene, but when abuse is reported, the response is to place the incarcerated individual into solitary confinement for protection, while the officer is out under investigation. That is a punishment. This bill should clearly prohibit punishing the person who is confined, including segregation or loss of privileges, simply because abuse was reported. Section 4 increases mandatory minimum sentences for staff. Mandatory minimums do not prevent abuse. A longer sentence does not protect the women who are inside being violated right now. I also want to be clear. This is not about one correctional officer. The system needs to be held accountable for what they are doing to people. When abuse goes on for years, it is a failure of the state, not just one individual. Abuse in prisons is tied to culture, power, and systems where people inside have very little ability to protect themselves. People who are incarcerated cannot leave. The state controls their safety, and that means the responsibility to prevent abuse must fall on the state and the systems itself. If we want real change, the focus has to be on prevention and accountability inside the system itself, and addressing the power dynamics that allow this abuse to happen. Thank you for your time.
Alex, thank you so much for your testimony and having the bravery to come out and tell your story. I'm sure it was extremely difficult, but this is why we have public hearings, so we can make things better. I appreciate you highlighting the word use. That was a drafting issue, so we will,
Thank you.
This is why we have public hearings, to make sure we settle those things. Are you going to submit your written testimony?
I will.
Okay, because that'll be helpful. I like to kind of make sure that we catch all of these things that you highlighted, and I can't write as fast as you were speaking.
Sure.
You talk about your situation. Are you familiar with I guess it was the ombudsman earlier talked about this PRIA phone in the middle of the whole thing. How often are people actually reporting issues if they're in such a public area?
So people don't typically report sexual abuse inside, specifically because those of us who are inside, we get sent to segregation pending investigation while the officer is, still roaming around. So the punishment falls on us. We lose our visits. We're in 23 hours a day lockdown under investigation so nobody's talking about it. And there's no safe way to report. I mean, there's tier phones, right? Which is, yes, in the middle of the whole tier of 20 women, at a minimum. And there are tablets now, but not everybody has a tablet. It usually takes 30 to 60 days for somebody to get a tablet, and there's a variety of reasons how you could lose your tablet. But all of those devices are recorded and monitored by DOC. So I can't imagine that this hotline is going to be effective unless there is like a real way to not have any oversight.
Yeah, I think, thinking through that is going to be kind of the challenge, because we do need to make sure that, the reason behind recording with these and monitoring is for different reasons than we're talking about here.
Right.
So I'm looking forward to kind of talking to people and learning about how we could potentially do this. I did talk to somebody earlier and said this is a multi-year initiative. This is not going to be fixed this year, but it's people like you that come and tell us your story that make sure that we do get the change that is needed. So appreciate that. Representative Gucker.
Thank you, and thank you for your testimony. I just wanted to say thank you, because often we don't hear the other side, and a lot of times those who have had the experiences can speak better to it, and it is disturbing to hear that, we run into this in other communities, but the lack of reporting because of fear of retribution and because of the problems that go along, and people having to make the decision of, is it worth going down this road to report this or just deal with it? Mm-hmm. And dealing with it is not something that I am comfortable with. So I just wanted to say thank you for bringing this forward. I do look forward to reading your testimony. And I would encourage others that you may or may not know to bravely reach out to this committee and submit their testimonies as well, because the more that we can document what's happening in a non-threatening way, I think we can get to an answer, hopefully an answer sooner. But thank you for your testimony.
Thank you.
Thank you. And I do hope the Office of Ombudsman is listening and
Yes.
focusing on this. So thank you so
Thank you
much,
so
and
much
hope
for
you have a good rest of your day. I see Virginia Messina back online. I know you're probably dealing with your multi-caseload at Norwich High School, so if you could just start your testimony when you have a minute. Thank you so much.
Yes, thank you. I couldn't get my microphone unmuted before. Esteemed Chairwoman and members of the committee, thank you for the opportunity today to testify on Senate Bill 424 in regards to 504 specifically. My name is Virginia Messina. I am the Director of Counseling and Admissions at Norwich Technical High School. I'm also a former board member for the Connecticut School Counselors Association. I want to thank you for taking this bill up. It is really important. I have been a school counselor for 22 years, and in that time, I have seen the number of 504s rise exponentially, no matter what district I have been in. And I know you had asked earlier about, since the pandemic, absolutely, there has been a rise in 504 since the pandemic, but this was happening prior to the pandemic as well. We are tasked with managing 504 plans. And just to give you an example, because while I was waiting to testify, I was working on setting up 504 meetings for students today. I have kind of tracked how much time it has taken me just to do one this year, and it takes 45 minutes just to set the meeting up. And that means contacting parents, finding a common time that they can attend, finding time for staff to attend that need to be there, putting out the official invitation and doing that through the system CT SEDS, making sure that we put out a call for teacher reports so we can get an accurate picture of how the student is doing and if their accommodations are working, and then, putting that together for the meeting. That's just that 45 minutes. Then the meeting is upwards of probably an hour for most meetings, to fully discuss them. And that is if it's just an annual review. It might be longer if it's a reevaluation meeting, in addition to that. Then you have to take all the minutes of the meeting, take care of that, and then you have to follow up with teachers on what changes have been made, and you have to make sure that you meet with the students so that they are aware of what their accommodations are so that they can properly access them during the school day. That is the part that is most appropriate for school counselors, meeting with students and talking to them about their plans and advocating for them. We are a member of the 504 team, but we should not be managing all of these things that go along with a 504 plan. CT SEDS has now created a difficult situation where we are required to have meetings yearly on 504s where, that was kind of up to districts before to decide how often plans needed to be met on. And now if we don't do it every year, specifically around the time it has to be done, then you're out of compliance, which is another issue. This is a regular education program. This is not special education. We are not under special education. We do not receive special education funding for 504s, nor do we have specialized staff to take care of the administration of 504 plans like special education does. And I know special education is already having issues with not having enough staffing. So this has become a real issue, and it takes away from the true role of the school counselor, which is to provide services for all students on their caseload, because we're spending an exponential amount of time on 504 plan management. So I appreciate that this bill covers things like data collection, which the data is there. They just need to collect it, put it together, and report on it. Providing oversight for 504s, providing guidance on 504s and how we should proceed and move forward for districts, and evaluating school counselor and social worker caseloads and how those are impacted when you have the 504 pieces. So I appreciate your time today and listening. I'm happy to answer any questions you may have about this or the process. And thank you again for taking this important issue up.
Thank you so much for your testimony, and your written testimony was great. You covered a lot of the questions that I've been asking. And also just a shout out to all the school counselors out there. You all do amazing work. And I was so happy to see so many people testify in support of this bill. One quick question I had for you. I understand, we have to have, there's requirements under the Family Educational Rights and Privacy Act. How do you suggest that districts can ensure that any reporting that's done would be in accordance with that?
So I believe there are several systems where we are having to report the number of 504s that there are without disclosing that specific data. Now, in CT SEDS, where a lot of that data lies, student names are attached to that. But I believe that districts, and if they don't, they could report when they have to do their PSIS data data dump, I guess you could call it, every October, where they're required to report on a number of things within the district to the state, that the number of 504s could be included. So it wouldn't violate the FERPA rights of students and families, because names wouldn't necessarily be attached to that. So that might actually be a better way to get that data and collect that data, so there's an accurate picture and representation of how many 504s there are in school. I think the other piece would be that is not collected now is how many 504 case management students counselors have on their caseload, and that can vary certainly from district to district. My colleague Doug had, testified earlier that he had about 25. That's probably about what we have in our building here. It's about 25 to 27 students on a caseload, but that used to be lower. So that number is definitely higher than it used to be. But if you have a really large district, like, I don't know, maybe I'm thinking some of these school districts like Danbury, while they may have more counselors in the department, they also have a lot more students. So that number, I spoke to a counselor earlier today who wanted to ask about submitting testimony, and she told me she has about 52 students on her caseload for 504 that she has to manage each year. So it can differ from district to district. I think the ability to collect that data is there. We just have to be thoughtful about it and make sure that we are doing it in a way, as you said, that do not violate the FERPA rights of the students and families.
Great. Thank you so much. Very useful testimony. Appreciate you hanging around and testifying today. Seeing no other questions, thank you, Virginia.
Thank you.
Next, we're going to hear from Seth Korn, who is, I believe, here. There he is.
Korn, and I serve as the Director of School Counseling at Newington Public Schools, and I am the co-chair for the Board of Directors of the Connecticut School Counselor Association, which represents about 400 counselors in the state. I'm here today to testify in strong support of Senate Bill 424. This bill is a vital step forward toward codifying protections for Section 504 plans into state law, especially as we face ongoing disruptions to federal guidance and increasing legal challenges. The core of our support rests on a simple reality. The needs of our students are increasing, and the volume of 504 plans has surged since 2020. Under Public Act 19-63, school counselors are mandated to follow an 80-20 service model, spending 80% of their time in direct services with students. However, because there is currently no state oversight or dedicated coordinator for 504 plans, an administrative creep has occurred. Counselors are increasingly tasked with managing and coordinating these plans, pushing their indirect services far beyond the 20% limit. When a counselor is buried in paperwork or acting as the sole decision maker for a 504 plan, it creates a conflict of interest, and more importantly, it takes away vital face time from students who need social and emotional support. Furthermore, Connecticut currently has a significant blind spot. While we track data and provide oversight for students with IEPs through the State Department of Ed, we do not do the same for 504 plans. We are asking the state to close the gap by using the existing PSIS system to track 504 enrollment by school and grade level. This request requires no new software, only a mandate to report what districts are already gathering. Establishing a stakeholder group to analyze 504 usage since the pandemic and develop best practice guidelines for staffing. And protecting the counselor role. Statutorily clarifying that counselors, social workers, school psychologists, and other 504 case managers should not be the primary administrative coordinator or sole decision makers for these plans. This ensures they can remain neutral advocates for all students. Ultimately, Senate Bill 424 is about capacity. We want to ensure that students who need 504 plans receive them, while also ensuring that our workforce, including counselors, social workers, and school psychologists, is staffed at levels that can actually meet those needs. By tracking this data and codifying these protections, you allow school counselors, social workers, and school psychologists to return to their primary mission, providing direct mental health and academic support to every student in that building. Thank you for your time and your commitment to our students.
Thank you very much, and thank you for your written testimony as well. Information you provided was super helpful because I think how you highlighted what you get under the IEP and what sort of data that we have under those and what we're getting for 504s. It was a good visual for the committee. There was a question regarding FERPA and using that sort of language. Is that something that you do as part of your data recording internally?
Yes, and the data that we're asking for is something so similar to IEP data that's being collected, ML student data that's being collected on EdSite. That is the information that we're looking for, is something very similar, which does not violate FERPA law. So we're asking for something very similar to for 504 students.
Got it. Okay, just wanted to clarify that. Any questions from the committee? Seeing none. Thank you so much, Seth, for your testimony today.
Thank you. Appreciate your time.
Great. Next, we have Sharmise Walcott. Oh, excuse me. And we are also including, I think it was...
Crystal Rich, if we can?
Yes, number 28, Crystal Rich. Apologies for that.
Thank you so much, Chairs Representative Dathan, Senator Gadkar-Wilcox, Ranking Members Senator Sampson and Rep. Carney, and distinguished members of the Governmental Oversight Committee. My name is Sharmise Walcott. I am the State's Attorney for the Judicial District of Hartford, and I'm also the co-chair of the Regionalized Human Trafficking Recovery Task Force, acronym RHTRT. And present with me is my co-chair, Crystal Rich. She'll introduce herself in a minute. We are going to split time in the interest of time, I'm just going to speak fast. I have not submitted written testimony on behalf of the Division of Criminal Justice, but we will, and it'll supplement the comments here today. With that being said, the Division of Criminal Justice is in support of HB 5476, and in part because the Division of Criminal Justice is uniquely positioned to identify and respond to all forms of human trafficking, as Connecticut criminalizes, as you know, both sex and labor trafficking of adults and children. In 2021, the Hartford State's Attorney's Office launched a pilot task force in partnership with the Connecticut Children's Alliance, securing federal funding to develop a collaborative model that brings together law enforcement and victim service providers to address, again, all forms of human trafficking, sex and labor, adult and children. Since then, DCJ and the Connecticut Children's Alliance have worked to meet victims' needs while creating collaborative forums that strengthen the state's overall response to trafficking. These efforts have produced meaningful results, including the Journey Mapping Project, which was cited to in written testimony, and it highlighted how victims move through the system. It identified critical gaps and outlined Connecticut's most pressing needs. Following that project, a statewide group convened to address the 7 key hurdles identified in the report. The result was a blueprint, which provides a strategic path forward. Section 8, specifically of HB 5476, will allow us to begin implementing that blueprint with statewide partners and additional stakeholders across Connecticut, and we are in support of that bill.
Good afternoon, everyone. Senator Gadkar-Wilcox, Representative Dathan, and distinguished members of the committee. My name is Crystal Rich, and I'm the Executive Director of the Connecticut Children's Alliance, which is our state's coalition for child advocacy centers and multidisciplinary teams responsible for providing a response to child abuse in the state. The CACs and MDTs were mentioned earlier today. We are also, in addition, as my colleague mentioned, I'm also the co-lead for the Regionalized Human Trafficking Recovery Task Force, I'm here in support today of this bill. And you have my written testimony that I referenced, but I just want to highlight a couple of sections. I want to echo my colleague's sentiments about Section 8 and our support for that section. Specifically, just want to highlight that, a lot of the testimony that we've heard today regarding this bill talked about the need for a systems response. And that's really what we're trying to do. The work of this committee is looking at what is Connecticut's response to child trafficking and adult trafficking, and how can we collectively, with everybody at the table, strengthen that. So I appreciate the committee's focus on that. I also just want to quickly comment on Section 10, which I know you heard from folks today as well. That Section 10 changes the statute from allowing the Department of Children and Families to open a child protection case to requiring that they do so in all cases involving suspected trafficking of a minor, even when the entrusted caregiver is not an alleged offender. We would caution against this. Currently, those cases, all cases that go through the Department of Children and Families where there's suspected trafficking actually are referred to our multidisciplinary teams and child advocacy centers for services and wraparound response. I think the real issue here is that those resources, especially specialized trafficking-specific services, are not well resourced in our state. So our resources that are providing those community-based services are very strained at the moment. I'm happy to, either one of us are happy to take any questions, but thank you for having us here.
Wonderful. And thank you, Crystal, for your written testimony as well. It's really helpful to see. One thing you highlighted in Section 10 is the CAC and the MDT system has not received additional resource specifically dedicated to trafficking cases since being required to do so in statute in 2014. So a quick question, do you know how much that funding was?
The funding for the multidisciplinary teams, I believe it's across the 17 teams in the state total. I think it's under $1 million, but I can get you those exact facts because it's dwindled over the years. In fact, there hasn't been a significant increase.
Okay, thank you. Yeah, that bit was a little concerning, and I think there was a focus on minors here, but we also have to think of other populations that are at risk because this just doesn't affect teen girls, right. And sadly it affects a great group of people here. So I appreciate that. I think that's it from me. Senator Gadkar-Wilcox, did you have? Okay. Oh, sorry. Representative Vale.
Thank you. I just want to piggyback off what you just said. So adult trafficking, are we talking about 18 to 21 or all adults?
All adults. We see a lot of cases through our regionalized human trafficking task force where we're seeing, youth certainly, we're seeing victims start age 11, 12, 13. Sometimes we see victims all the way from that age through adulthood. We see a lot of 15, 14, all the way through 21, 22, 23, 24. But we also have victims much older, 50, 60. I mean, we see victims across the entire lifespan.
These type of people, I think, tend to focus on vulnerable people. Mm-hmm. Would that be true for adults as well?
Absolutely. We see traffickers that certainly prey on vulnerabilities.
Okay. Thank you.
Just to clarify, it's like folks with disabilities or maybe?
So what we see, it's more about vulnerability than age, right? So we see individuals across the age spectrum, and where the increase comes in it's more vulnerable populations that are likely to be trafficked. So it's less about the age of the individual, more about what are the vulnerabilities that they have.
Yeah, so that's what I was trying to hit. Is it, people with disabilities? Is it people, and we were talking a lot about DOC and people exiting and the incarceration system, a vulnerable population.
They are.
And I can imagine, that comes into play with some of the work that you do.
And we've seen those cases, and we provide services to victims in those cases, and we also pursue investigations and prosecution in those cases.
Excellent. Thank you for all your work you do. Senator Gadkar-Wilcox.
Thank you, Madam Chair. And Chris, I don't know, you looked like you were about to give a response. If you want to go ahead, and then I can ask.
Appreciate that. No, I just also wanted to highlight the importance of recognizing that a lot of the victims we do see too, certainly have had other forms of trauma and abuse that have occurred. We see a lot of victims who've experienced other forms of child abuse, and so I think it just echoes the fact that strengthening the system as a whole is extremely important. Trafficking is something that I believe we can prevent.
Thank you. I wanted to just ask about the funding you just mentioned for the multidisciplinary teams. So the funding has essentially stayed flat or has been decreased recently.
So there's a couple of funding streams that come to our child advocacy centers, none of which are specifically for trafficking cases. I think that's the biggest highlight in the testimony is that in 2014, when the legislation changed mandating that there be a multidisciplinary response for child trafficking cases, which we full-heartedly believe is the thing to do, there was no increase in state funding to address those additional cases. Not only is there the additional cases that are coming forward, but those cases tend to be very time intensive. We're often seeing children that are crossing jurisdictions, requiring a lot of specialized services. And again, we see the multiple repeated abuse over and over again. So that's kind of the issue there with regards to the funding. The other piece too is that there was never, when we started learning more about child trafficking and trafficking in general, there was never a lot of state funding put into specialized services for children or adults of this population.
And what about the number of cases of victims of trafficking since that time? Has that increased? Has there been a plateau? Has it decreased in terms of the number of cases you're seeing? And presumably after you have trainings that are effective, I presume the number would go up if they're actually effective in alerting.
Absolutely. And I think a couple of things on that. One, when we started seeing these cases, and this is specifically through the multidisciplinary teams, the first year I think we saw like maybe 8 cases. Fast forward all the way to a couple, last year, I believe we're still doing our final numbers, but we had like 160 some odd cases. The year prior, we had almost 200 cases. So the numbers have certainly increased. I think the other piece to recognize and why we have in our blueprint, one of the things we want to look at is standardized data collection, is that I do believe we are missing cases that are being categorized under other forms of violence because people are not yet fully recognizing what trafficking is. Or victims may be afraid or not even understand that they're a victim of trafficking. So I think our data doesn't necessarily even fully capture the number of people that are experiencing this.
No, absolutely. And I was trying to understand earlier from DCF, when they opened cases or when they thought it was appropriate to send cases to the multidisciplinary team. And I understand that a little bit more now, because I wasn't sure why they were hesitating to open another case related to whether or not the parent or guardian is perhaps is allegedly a perpetrator versus somebody outside of the family. Is that how DCF sort of, is it because of the sort of lack of funding and support for the multidisciplinary team that sort of DCF has been opening cases that may not have been appropriate for child services to begin with?
So I think back when that was happening, so that's not currently happening at DCF. I think there was several years ago when we were learning about how to respond to child trafficking, the thought was, let's open up these cases through DCF to at least provide some sort of response. And at the time, certainly DCF was leading a lot of the charge in terms of training the state and acknowledging what was going on with child trafficking. I think fast forward, we realized that we were disproportionately putting families into a child welfare system that were not actually doing anything wrong. They were not harming
Right, that's
their
what
children.
they said.
Right, and so then that's when a bunch of us kind of came together and tried to figure out, what's the best way with the information we have currently, how do we address these cases? And that's when it was decided that all of them would still go towards the multidisciplinary teams and child advocacy centers rather than, a DCF opening a case. So DCF will still receive the call. The report that they sent to law enforcement, whether they accept a case or not, also comes to our multidisciplinary teams. And then we have that wraparound response. So law enforcement, service providers, interviewers, our CAC staff, specialized service providers will come together and kind of decide or try to decide what the best course is for that child and family. But again, echoing that the issue is that, as we've learned more, and to your point, Senator, there's been more training, people are more aware of what trafficking is, so now we're seeing a system that's inundated with these cases, and overtaxed really, and doesn't have the resources to keep up with it.
So given that resource issue, what my biggest concern is, are there children falling through the cracks then, or victims of trafficking? Because given the complexity of the situation and the time-intensive sort of resources involved, I'm not sure how, with the funding available, you're actually able to address the need. So what has been falling through the cracks that we should really be focusing in on in terms of advocacy for more resources there?
Absolutely, and we're happy to provide any data too that would be helpful to this committee. I think one of the things is certainly, right, we know that if there's not enough resources, kids are going to fall through the cracks, and unfortunately we may not know that that's happening in every case, but we know that it is. We know in some of our, like Love 146, who will be testifying later, I'm sure will tell you, they are our main kind of specialized trafficking provider in the state for minors, and they oftentimes, almost always, have a wait list of kids waiting for those services. And so when a child's ready to disclose and they're ready to receive services, I mean, I should say any victim, right? When they're ready to tell their story and ready to receive help, we really owe it to them to provide those services immediately. I think what we see sometimes happen is that these specialized services are not available, and then we see kids run again. We see them go back into the life. We see the same thing for adults.
And do you have data on that, of how long the wait lists are? If there were individuals who were waiting and then just dropped off because it was too long before they got services, and you don't have to have an but if you can provide that, that would
Absolutely.
be helpful to know. Absolutely. And then one of the biggest problems that we talked about this before, but is that coordination around following up on the trainings to see what is effective. So what thoughts do you have about that? Because it's one thing to make sure the training is standardized and accessible, and that's maybe part one. But the next step is then to figure out whether or not that produces effective results. So what would be indicators of that? I presume one of them would be, for example, that the number of reported incidents increases because people would be trained to understand and recognize the signs of trafficking. And we know just based on data from other states and globally that the numbers definitely are lower than the actual reality. So, if you can just share any thoughts that you have around what would it look like to say training is not just that we have standardized training and provided it, but what would it mean for that training to be effective?
Absolutely, and I'm sure my colleague here has some thoughts on that as well. I think, to your point, we would see more reporting, and I think it would look differently maybe across the system, right? So we would see on the service side, you would see more services being provided, victims getting into those services quicker. You would see people making those referrals, sooner, recognizing that trafficking is actually occurring versus categorizing it as something else. I think when we're talking, and I don't want to speak for our law enforcement partners, but we're talking about, investigations. Investigations, we would recognize, right, that it's trafficking a lot quicker, be able to pull folks together. So I think you would see increased, warrants, prosecutions.
Well, definitely increase investigation numbers, right? And so one thing we know from this task force is that human trafficking investigations are long and they're difficult. And we've tended to, as a system, look to law enforcement to provide that first line of support, and really it's our victim service partners that should be providing the first line of support, because victims need to be supported and whole before they participate with the law enforcement process. But having law enforcement recognize that the complaint that came in is in essence trafficking, and then doing the follow-up from there is an outcome that we'll see from the training. One of the big pieces of the training, and not to stand on a soapbox, but is collaboration. We cannot ask law enforcement to be trained by non-law enforcement. They have to be in the room. They have to be at the table and part of the conversation. Law enforcement does the investigations. If we have someone who doesn't do investigations, teaching them how to do investigations, we're going to have poor outcomes in the investigation. And so that kind of goes back to why Section 8 is just so important, because we're talking about collaboration, we're talking about setting a table where all the partners are there together, and the development process, not just the screening and reviewing, the development. And then before I move on from there, and when we talk about Section 1, that support for the collaborative process, having a position is also important and helpful.
Thank you so much. Thank you for your testimony.
Thank you.
Thank you so much, and look forward to seeing your testimony, Shani.
Thank you.
Great.
Thank you.
Next, we have number 16, Emmeline Franklin.
Hi. Good afternoon, Senator Gadkar-Wilcox, Representative Dathan, and members of the Government Oversight Committee. My name is Emmy Franklin. I'm a Public Policy and Advocacy Associate with the Connecticut Community Nonprofit Alliance. The Alliance is the statewide association of community nonprofits. The Alliance appreciates the legislature's continued focus on strengthening protections for vulnerable youth and improving oversight of systems serving children involved with the Department of Children and Families. We offer the following comments in support of the intent of Sections 4 and 7 of HB 5476 along with a few considerations for implementation. I have not submitted written testimony yet, but I will, so I'm just going to summarize some of the points. First, the Alliance supports the goal of expanding human trafficking awareness and training among staff working with vulnerable youth. While providers broadly support the intent of mandated training, several implementation considerations are important. If the state requires training, the curriculum must remain engaging, relevant, and evidence-based so that it meaningfully improves awareness and outcomes for youth. Providers should also have flexibility in how training is delivered. Allowing organizations to use DCF to approve curricula or develop in-house training that meets established standards, such as through a train-the-trainer model, would help organizations build internal expertise and deliver training in ways that work for different staff roles and schedules. It's also important to clarify which staff would be covered with the requirement. Rather than applying it to all employees, it may be more appropriate to focus on client-facing staff or others who regularly interact with youth. Regarding Section 7, the Alliance recognizes the legislator's interest in strengthening accountability regarding the STAR programs operated through DCF. Providers have raised concerns about issues such as length of stay in residential settings and whether these placements are being used as originally intended. In addition, there are a few important questions about how oversight should be structured. The Connecticut Office of the Child Advocate already monitors child welfare programs, and some providers question whether expanding that office responsibilities is the most effective approach. Finally, it's worth noting that DCF already provides an annual report to the Juvenile Justice Policy and Oversight Committee, and the last comprehensive report was published in July 2025 on the Specialized Trauma-Informed Treatment Assessment Reunification, or STAR homes. In closing, the Alliance agrees that strengthening transparency around utilization, length of stay, and capacity can help ensure youth receive services in the least restrictive and most appropriate settings. Thank you for the opportunity to testify, and I'm happy to answer any questions.
Thank you so much. Did you submit written testimony?
Not yet, but it'll be there by the end of the day.
Yeah, sorry, don't mean to call people out for not doing their homework.
No, I appreciate it.
Just joking. Okay, that would be helpful to get that all together. And thank you for the work that you're doing. Any questions from the committee? No. Seeing none, thank you so much.
Have a good one.
Next, we have Quinn.
Hello, can you guys hear me?
Oh, perfect. Yes, Quinn.
Awesome, thank you. Hello, co-chairs, ranking members, and esteemed members of the Government Oversight Committee. My name is Quinn Meehan, and I am a policy and community organizing MSW intern at Universal Healthcare Foundation. I am a MSW almost graduated student at University of Connecticut, a former special education teacher, and I am a former recipient of a 504 plan. And I am here in support of SB 424. I wanted to speak a bit to the actual impact that this sort of accountability would have. When schools and the government are not overseeing these sorts of plans and their effectiveness, that accountability and responsibility falls onto parents and students. I know that as a 504, someone with a 504, my mom advocated as hard as she could for me, and she had more resources than most to do so. However, when she faced trouble and the school continually tried to get rid of my accommodations, she sought help from an advocate, realized it was too expensive, and was lucky enough that that advocate offered to do the work pro bono and followed me through high school for free. However, most people don't have that opportunity. And even then, I still struggled in school. However, if I hadn't had the accommodations I did, I easily would have failed my classes. I already wasn't doing that great, but with extensions, my SAT scores were so much better than they would have been. And I am now a master's student getting my second master's, my first being in special education. I also, in my time teaching in Title I schools in New York City and in Connecticut, saw students who had 504s with seventh graders with first grade reading levels, whose teachers and principals said that they just were lazy and not trying hard enough. The students that weren't even my responsibility as a paraprofessional but clearly needed my help. And so they had me, and they had me looking out for them as a special education, certified paraprofessional, but that was a fluke, only because I, happened to fall into that position. But I saw that student try so hard in his work with me and still not get the services he needed on his 504. And so, students without those resources or with teachers who, and I'll mention that the student was a Black male, students who are viewed as lazy for any variety of reasons by their teachers or schools are getting left behind. I'll also add that I've seen special education teachers and teachers, not give students their accommodations because they view the parent as faking conditions and things like that. And so it shouldn't be on students or families to have to track this sort of data, to have to notice when things should happen. I only notice them because I have a background in this and have a whole degree and years of experience. And even teachers don't catch these things necessarily. So it's important that parents have someone they can go to, especially when federal accountability is disappearing. And it's important that the schools and the state is ensuring that these plans are actually effective in serving our students. And so I urge the government oversight, sorry, I just stepped out of class, the government oversight committee to pass this legislation. Thank you.
Thank you so much, Quinn, for your testimony this afternoon. Really helpful to hear it from a student's perspective on how this made a difference for you and also through your lens with your work that you're doing to get your MSW. Any questions from the committee? None. Thank you so much and appreciate it. Are you going to submit written testimony at all?
Yes, I'll submit that tonight. Thank you.
Thank you so much. I know,
Of
add to your
course.
workload, right?
All good.
Thanks. All right. Next, we have Sarah Renzulli, and I believe she's online. I think I just saw her a second ago.
Yes, I'm here.
Yes, there you are. Thank you.
Well, I want to thank the Government Oversight Committee for letting me speak today. I'm Sarah Renzulli. I'm a clinical faculty member at UConn. I'm a professor of school counseling. And I really appreciate the opportunity to speak with you in support of SB 424. I'm so pleased that so many school counselors and students have come to speak to you about this because it's a really, really important issue in our field right now, and it is affecting so many things. I'm going to bring a slightly different perspective as someone who's been involved in researching Section 504 for multiple years. Similar to the last speaker, I also am an individual who had a 504 plan in my academics and an IEP plan. So I see this from multiple perspectives, and I know how personal this is to the families and students who are looking to get academic services. So as many of my colleagues have testified today, Connecticut's in a situation where the number of 504s are skyrocketing. And this is causing a huge challenge specifically for school counselors who are tasked with being the case managers. It's estimated from a 2022 data set from the Office of Civil Rights that Connecticut has more than double the national average of students on a 504 plan. And again, this was from 2022. This number since then has likely continued to increase. I want to point out a few things for the committee. And the first is that this is not the national norm. It's not the national norm to put every single student who has ADHD and or anxiety on a 504 plan, but this has become the norm in Connecticut. We're in a situation where many parents and students go to their pediatrician, they receive a diagnosis, which is likely appropriate, and then that automatically leads to a 504 plan. The challenge is schools don't know how to respond. So school counselors have received no guidance on how to handle this situation. Thus, our 504 numbers are continuing to skyrocket. In many states across the nation, students don't go on a 504 plan unless there's evidence and data that suggests that their diagnoses, such as ADHD and 504, are impairing or adversely impacting their academics. Then they receive the academic supports. I want to discuss a few additional challenges that we're experiencing in Connecticut and why SB 424 is really important, is such an amazing and important place to start. The first challenge is related to educational equity. And by this, I'm referring to when we put every student on a 504 who has ADHD or anxiety, are the ones that genuinely need it for academic reasons actually getting the support. So again, with the number of 504 plans that we are putting through right now, school counselors are not able to fulfill complex academic requests. They don't have the bandwidth or the time. So if more data was brought to the table, and if the students who really needed a 504 plan for academic reasons versus just needing one because they have a diagnosis, we're getting them, the plans could be more individualized, more meaningful, and overall more effective. Releasing the data set that's collected in the PSIS system would be immensely helpful for researchers and educators and state level committees through CISCA, et cetera, to discuss who was getting on a 504 plan, how long have they been on a 504 plan, and also looking at how is this plan effective for them. These are really important conversations that, because we are not have access to state level data, we are not having. A second challenge that has been brought up, and so I won't spend too long talking about it.
3 minutes are up. Please summarize.
Well, I really just, again, wanted to say that Connecticut is really out of accordance with with kind of the national norms. In many other states, number one, school counselors don't case manage, which is what ASCA suggests, and I put a link to that in my written testimony. And also, we really need to be looking at data to determine educational best practices. And I'd be happy to take any questions. Thank you.
Thank you so much. Senator Gadkar-Wilcox.
Thank you very much for your testimony. So do you have the information on for the comparative states in terms of what the legislation requires around 504 plans that that's different than Connecticut? Because that's interesting and sort of surprising that Connecticut is such an outlier in that way.
So I can tell you that the only state that has legislation specific to school counselors and 504 plans is West Virginia. And I didn't include that in my written testimony. I can follow up with an email about that. In terms of the numbers, that is released by the Office of Civil Rights, and that was published in an article, which I can also forward to you. But there is a national study going on right now out of Vanderbilt, and I'm peripherally involved in the study team. And in research conversations, they have noted that it is really a Northeast phenomena where everybody with ADHD or anxiety automatically goes on a 504. They also noted that it is not the norm nationwide that school counselors are case managers. That's also more of a Northeast phenomena.
Oh, that's really interesting. And so is there a state that you would say we should look to as with a particular model that puts parameters around the 504s being linked to, for example, you said the actual academic support needs of the child, as opposed to just
you have hit on what I really wish existed. This is a challenge. There really aren't best practices, but because of that, this is why, and I'm using very careful language, but why 504 has gone unnoticed, unresearched, et cetera, for a long time. It's not regulated. It's not monitored heavily. Resources aren't put behind it, as you know. So it's been ignored for a very long time. We are continuing to try to find, honestly, sometimes it's more just counties or individual school districts who are doing it well, but there is not a state that actually has a great statewide process.
And are there any models? Are there no models that you look to at all that would be helpful for us to look at?
We do have some models. I actually, at the upcoming school counselor CISCA conference, we're actually going to, some colleagues across the state and at other universities across the state, and I actually are going to be presenting a model that we think could really help Connecticut. But there is not a model that is really effective elsewhere. What I can say is I think that this is a combination of education, but also public health, because I think that there's a perception by many parents that, number one, that 504 is actually special education. and that they want these services for their children, and that they think that this will, I think that there's a misunderstanding of what the services could represent or what they could give. So I think that having some best practices established by this work group in this bill could that then is disseminated by the State Department of Ed with language that they can send out to parents about what 504 is and a process would really help with understanding what this is and what it can do, but also the limits of it. Because if a child genuinely needs more and they may not be getting enough from 504, then they should really go on to be evaluated for an IEP in special education.
Great. No, thank you. That's very helpful.
Sure. That's actually been my question, is thinking, you know, are we properly classifying students with the right accommodations and the right plan? And I thought those comments were super interesting. You mentioned a study at Vanderbilt. Do you know when that's going to be released?
If it's okay, I will follow up with some emails with the different resources that I've mentioned. Some information, some of the studies have come out. A very genuine challenge with 504 in research right now is that it is, and it's similar to what we're seeing in the discussions today. Who owns this? So it's not under school counselors, it's not under school psychologists, it's not under administrators. So nobody knows where to publish this. No discipline wants ownership. So there's been some struggle in getting this material published, but I will send you what's been available. And again, what I can say from a research perspective and from what I've seen nationwide is that putting this committee together and having an interdisciplinary group of conversations would be a really, really important first step, and doing a lot more than many other states have attempted. But we're in a situation for the size of our state, our numbers are quite high.
Yeah, that's interesting to hear. I appreciate that. Your testimony was very good, and thank you for submitting your written testimony. Any other questions? Seeing none, thank you. Have a good rest of your day.
You too.
Barbara Fair. Oh, there she is. You know the drill.
Good afternoon, distinguished members of the Government and Oversight Committee, and thank you for the opportunity to weigh in on Raised Bill 5474, legislation to again require DOC to provide an updated plan to improve medical care to incarcerated people. My name is Barbara Fair, and I'm the director of Stop Solitary CT. Results-based accountability is a term I heard used when former Senator Tony Harp was in office. I have not heard that term since, through all the time that I've been involved in policy work in Connecticut. What I witnessed is beautifully crafted legislation and annual reporting that did not move the needle toward transformative changes within DOC. Of the over $800 million allocated to the department, over $175 million has gone toward medical care. And I asked myself, where is the results-based accountability for that huge investment? How does one account for $175 million allocated toward medical care when we know there's chronic shortage of medical professionals and people complain about waiting months and sometimes years for medical care, and countless have died due to medical neglect, malpractice, misdiagnosis, delayed treatment, and being over-medicated? Since I began paying attention to deaths in custody 4 years ago, I have noticed deaths occur on a monthly basis, sometimes 2 and 3 in a month. Aside from deaths, countless people contracted cardiovascular disease, diabetes, cancers, and serious mental illness climbed. Several years ago, Senator Anwar supported a campaign seeking medical oversight. Advocates worked together to put together a plan for oversight and proposed legislation to codify it in our efforts. At the same time, Stop Solitary was leading a campaign for oversight to improve living conditions. We maintained medical issues were so huge it could not be effectively covered under the PROTECT Act. At the end of the session, though, legislators chose to place it under the umbrella of the PROTECT Act, which I felt could not adequately provide medical oversight and was sure to fail because it's such a daunting task. Constant lockdowns and chronic staff shortage made medical care even worse. Incarceration creates and exacerbates mental illness, and having no one on duty evenings, weekends, and holidays make a bad situation worse. The Correctional Ombudsman Office cannot handle all these issues. Managing regular site visits, inspections, collecting complaints, investigations, analyzing data, holding monthly community meetings and town halls within the facilities, along with halfway houses and parole, is a huge task in itself. The proposal to hire a medical deputy to aid people applying for Medicare is the work assigned to DOC counselors and social workers, so I didn't understand that piece. Incidents like Friday, when once again Osborne CI experienced a water break. Men were left without water to shower or flush toilets. 8 porta potties were provided for over 1,000 men, which was grossly inadequate, forcing them to urinate and defecate in bags in their cells. Imagine being in a small cage built for one, and you're sharing that space with another man. So both men cannot walk around the cell at the same time. Imagine having to inhale each other's urine or feces. Osborne needs to be shut down due to numerous environmental issues, including men having to shower together due to a small number of showers. This antiquated facility can no longer serve as housing, and so the resolve must be to shut it down and relocate the population to one of the unused facilities. Osborne is what your president would call a shithole, and I don't curse. I'm reminded of the late Jesse Jackson's signature quote, "Keep hope alive." There was a time when I was very hopeful that we could transform jails and prisons into spaces of rehabilitation and humanity. When jails and prisons are simply human warehouses for the poor and the sick, and human compassion is seen as a weakness, when I see laws passed yet not enforced, the flame of hope becomes a flicker. Thank you for allowing me the time to hear, for you to hear from the public.
Thank you so much, Barbara, for your testimony and your continued advocacy. I know last year we spoke a lot about the body scanners, and wanted to know if your organization has heard any updates on that from some of the advocates.
I know they have it in York, and I actually toured Manson Houston about a month ago, and they showed me the body scanners. And just a little thing like that, I was watching the guys play basketball, and knowing that they didn't have to be strip searched after they played basketball, that was just so rewarding right there.
Yeah, I've heard they're not quite operational yet, and so that's really the issue. And hopefully, at least this bill will make sure that training happens as soon as possible. That was kind of the effort.
Yeah, because they do need to get to the other facilities. And I'm surprised you said they're not operational. He failed to mention that part.
Somebody told me that. I don't know if that's quite true, but I've
Okay.
heard that training's an issue. Maybe it's not they're fully operational all the time. So I think that could be some of the questions around that. Great. Any questions from the committee? Thank you. Oh, hold on. We have one right here. Senator Gadkar-Wilcox.
All right. Thank you, Barbara, for being here and your testimony and all that you do. We heard earlier that the number of individuals incarcerated has dropped from like 23,000 to 11,000, which means there's more space available. And so has this been raised by your group, given the concerns that you have about particular facilities? Has any discussion been had with the Department of Corrections about how to best utilize the actual brick and mortar facilities, given the shift in demographics?
I haven't, but among advocates, we've talked about it, and for years, people have talked about Osborne needs to be shut down, but no one has actually taken the steps to do it. But I think after hearing about what happened Friday, and it wasn't the first time, it's happened several times now in the last few months. And so I think that's probably something we do need to have a conversation with. How do we transfer those people out of there and shut Osborne down? It's very antiquated, and like I said, the cells are like so tiny because it's one of the first prisons built, and yet they put 2 people in them that can't even walk around at the same time.
When it seems like there's space available. Thank you.
Thank you. And I just wanted to end, though, I really wish you would consider making medical oversight completely different. It's too huge an issue for it to get adequate attention under the Ombuds office because they're taking care of the conditions.
Yeah, I think that was some of the overarching testimony that we heard today. And there is a similar bill in judiciary, and I also know that the auditors of public accounts are doing an audit report right now, performance audit on inmate medical. So there's a lot of different kind of angles headed towards this. So thank you so much, and appreciate your testimony today.
Okay, thank you.
Thank
Have a
you.
good evening.
You have a good evening, afternoon. Number 20, John Flanders, I see you online, ready to go.
Thank you, Chairman Dethin. Chairman Gedkar Wilcox, Ranking Member Sampson and Carney, members of the committee. My name is John Flanders, and I'm the president of Special Education Equity for Kids of Connecticut. SEEK is an organization of parents, attorneys, and advocates committed to improving special education for children with disabilities. And as a consequence, we are absolutely thrilled that you have introduced Senate Bill 424. We support it, and we have, and you'll find in our comprehensive written testimony, a number of suggestions moving forward. I wanted to open with a little bit of information on why we believe this is necessary. I don't think it's any surprise to anybody to learn that the U.S. Department of Education has decimated the Office for Civil Rights, which is responsible for enforcing 504 rights on a national basis. In 2024, OCR saw roughly 23,000 complaints, 35% of which concerned students with disabilities. Since January 25, only 1% of the cases that they've considered have considered disabilities. In the period between March and September of 2025, about 9,200 complaints came in. Only 635 were investigated. Approximately 7,000 were resolved, and of those, 90% were dismissed, meaning they didn't fit the qualifications for investigation by the OCR. Obviously, the children with disabilities need a new champion, and we're thrilled that the state of Connecticut is considering stepping in. I want to talk about a couple of suggestions that we have. First, Section 7 places oversight of students eligible for protection under CSDE. We think that's great, but CSDE does a pretty fair job of collecting information and does a less impressive job of taking that information to improve things for the kids with disabilities, and we certainly encourage any ruling on that to encourage them to do so. Section 3 calls for a working group on Section 504, but we notice that as it stands, the bill does not include any representatives for families and students. We respectfully ask that you consider including a representative from SEEK to the working group. And knowing that one voice is probably not adequate, we think that you should consider organizations like Center for Children's Advocacy, Connecticut Legal Aid, AFCAMP, other organizations for membership on that work group. Third, Section 10 calls for reducing barriers for schools to access Medicaid funds for the cost of appropriate accommodations. This is not working well in special education and needs a considerable amount of effort to make it work more fully. I hear my time is up, so I will stop talking. And again, thank you for bringing up the need to address the needs of children with disabilities. And I'm happy to answer questions.
Thank you so much. One of the things you talked a little bit about was the Medicaid issues. I know it already exists, and I'm kind of trying to understand, how we could potentially do this. I do a lot with Medicaid with my MAPOC and my human services roles. And so, thinking about that, trying to work alongside the agency might be good. But do you have any suggestions on how we could potentially do that in the state?
Yes, we've been working with Senator Lesser and the Human Opportunities Committee on this. What we found when we looked at it was there are two significant problems. One, the paperwork to file for a complaint or a claim for Medicaid is extraordinarily onerous. Schools are many schools are hiring someone to do it. Because they simply don't have the time and manpower to complete it. The other thing is that when you do file a complaint, Department of Public Health takes half. So when you're going through a huge amount of work and getting half of what you're applying for, the cost benefit ratio is not great. And obviously, and there are tons of schools who are simply not doing it. So the two steps are, one, let's talk to DPH about how much they're getting for how much they're doing, and number two, a way to streamline the paperwork for schools to be able to do this, because this isn't their normal job.
Got it. That's interesting. Yeah, the department didn't specifically comment on this bill, so it might be something we need to follow up with Senator Lesser, and we can talk to him about that.
When we talked to them last year, they noted the fiscal note that moving them out of the process would incur.
Yes, yeah. I hear you. Good. Any other questions among committee members? Seeing none. Thank you so much, John, and I've taken note of the comments you made in your testimony as well.
Great. You'll hear from others from our organization with more comments on this. But thank you very much for your time.
Thank you. Next, we have number 21, Taylor Tantaquidion. And I'm so sorry, Taylor. I'm sure this is the story of your life, pronouncing your name for every single person.
Yes, it's Tantaquidion. You were close. Good afternoon, Senator Gadkar Wilcox, Rep. Dathan, Rep. Gunker, and Rep. Carney. I am here testifying in support for HB 5476. My name is Taylor Tantaquidion, and I'm a Yukon MSW policy candidate. Human trafficking occurs in every state, including Connecticut, and this bill allows for services and education necessary to combat this problem at a state level instead of just regional. As many of you have already heard today, and may have already known about the regional human trafficking services that have a multidisciplinary response happening currently in Connecticut by the Regionalized Human Trafficking Recovery Task Force. This task force has been doing a great job combating trafficking in the state, but they're only regionalized. Creating a human trafficking prevention coordinator position within OPM and establishing a human trafficking prevention and response task force will allow for a more comprehensive and multidisciplinary response to combat both sex and labor trafficking for children and adults. I support having a human trafficking prevention coordinator position within OPM so that there can be a statewide consistency in planning efforts, partnerships, development, and implementation of a training program, and the creation of a statewide database and directory. This bill not only allows for the expansion of human trafficking services across the state, but ensures other state agencies that are in charge of child welfare in the state should be involved and educated. Expanding who is required to be trained is in the proper awareness, identification, and harm reduction practices will benefit all. Finally, I support the establishment of the Human Trafficking Prevention and Response Task Force due to the success of the RHTRT in the Hartford area. This bill allows for consistency, partnerships, training, the creation of a directory and a database, increased education, increased awareness, harm reduction protocols, and overall support for a population that needs it. Thank you for the opportunity to provide testimony and support for this bill. Thank you for your time and consideration.
Well done, perfectly timed as well. Just double checking, did you submit written testimony?
I did.
Oh, you did, okay. That's maybe, oh, I'm looking at the wrong bill. That's my problem. Operator error. Great, I will go ahead and consult that. I think that some of the suggestions that you said verbally were great. Is there any questions? No, thank you so much.
Thank you.
Have a good afternoon,
You
Taylor.
too.
We are going to, we have another accommodation we have to make, number 34 and 35. Oh, perfect. Okay, thank you. Next, we got number 22, Rachel Connolly. Is she remote? I don't see her. Okay, Rachel, we'll come back to you. We'll come back to you. Number 23, Andrew Clark. Thank you, sir.
Good afternoon, Chairs Dathan, Gadkar Wilcox, Ranking Member Carney, Rep. Gucker, and distinguished members of the Government Oversight Committee. My name is Andrew Clark. I serve as Director of the Institute for Municipal and Regional Policy at the University of Connecticut, and I thank you for the opportunity to testify regarding Sections 9 and 10 of Raise Bill 5477 today. For 25 years, the Institute has worked with criminal justice stakeholders to advance evidence-based, consensus-driven reform in Connecticut here. Originally focused on legislative analysis, our work has expanded to include implementation support and independent evaluation, creating a feedback loop between policy, practice, and measurable outcomes. In recent years, we have worked closely with the Connecticut Department of Correction through a partnership with the University of California, San Francisco, and the Norwegian Correctional Service to support research, training, and implementation of modern correctional practices, emphasizing safety, professionalism, and rehabilitation. We also have a long-standing partnership with the Office of Policy and Management's Criminal Justice Policy and Planning Division in areas including cost-benefit analysis, reentry, sentencing, and policy. IMRP strongly supports both Sections 9 and 10 of HB 5477, which we view as intentionally interconnected. The rest of my testimony I submitted, I won't read from it, but I just want to say that this is part of, in my estimation, a long arc of justice reform here in Connecticut that began in the early 2000s in response to prison overcrowding, some would say mass incarceration. And that was at a time when Connecticut had its last correctional staffing analysis, and Representative Lamarck Muir was part of that with the Legislative Program Review and Investigations Committee. And that's in 2003 is when PREA passed under George W. Bush. And we actually had 500 inmates out of state in Virginia. So we were pushing 20,000 incarcerated individuals. We are now under Governor Malloy and then recently under Governor Lamont have lowered that prison population to 10,000. It's back up to 11,000 now. But in my estimation, this work that we're doing in conjunction with University of California, San Francisco and Norwegian Correction and here with the department is really the next step in ensuring that we have a modern system here in Connecticut. So thank you.
Thank you. Thank you for your testimony. Just wanted to check, with some of these studies that have been done, and you talked about the IMRP and University of California, San Francisco, and the Norwegian. Just wanted to know if there's any sort of data available regarding recidivism rates.
Yes. So Connecticut has been actually the first recidivism study was done in, I believe, 2001 by Program Review. And then in 2006 or 7, when the undersecretary position was created within the Office of Policy and Management, that was given responsibility over to them. When we were at Central Connecticut State University, we were part of the Statistical Analysis Center that did that work for OPM. But roughly the statistics in Connecticut are, depending on how you actually measure it, is it reincarceration, is it reconviction, Is it resentencing? It's higher. It's anywhere between 50 and 70% of individuals. And in Norway, the recent statistics I've seen are 20% reincarceration rates. In terms of the actual work we're doing in the pilot programs, we're still developing the evaluation measures, but we have done focus groups. We have some preliminary information that officers have been collecting on disciplinary reports and the like on their work there, and it all looks promising, but we're looking forward to more fully integrating an evaluation measure.
Thank you. There was another point that we talked about with the strategic hiring and the plan to be established with the Office of OPM and the folks who are part of the DOC sort of oversight, the sort of staffing report.
Yep, the staffing analysis.
Yeah, so I was just trying to get an understanding how much something like that might cost if we were to do some work with your organization or with some of the other organizations that you've highlighted.
So what I can say is that the Institute is grant and contract funded and gets some funds from the legislature as well. I know the governor's budget included money for staffing analysis within there. I believe it was $700,000 for 2 agencies. I would say that it's nowhere near that, which we would need. We'd have to bring on some folks to do that and make sure that we have the right experts in the room in terms of that type of analysis. We have experience doing that. We often look in-house as well, and many times are able to get in-kind support and some really strong students to assist too. But we work across universities within Connecticut and nationally and now internationally. So I would imagine, I can't put a number on it right now, but you would get a good return on your investment for that.
That's exactly what I love to hear. Great, let me ask my good co-chair, Des.
Thank you. Thank you so much for being here and for your testimony. You might be able to help me understand, given your work and your background, the question about resources and staffing. When the population that's incarcerated has been cut in half, essentially, and the staffing has remained the same, I can't wrap my head around the resource issue as a kind of justification for whether it was for the audit around medications not being timely delivered or other kind of practices that are being scrutinized. Can you help me understand, in terms of resources, how can we go from half the population and maintain the same amount of staff members but produce a resource problem still?
Well, that's something that I would imagine the staffing assessment would get at, but just in terms of my understanding of the situation, and I'd be remiss if I didn't mention Barbara Fair was testifying here as well in the early 2000s when, as I mentioned and you referenced, we had roughly 20,000 individuals that were incarcerated, and the staffing was roughly the same. I think we have about 6,000 correctional employees. Then we may have had a little bit more. And again, we were employing folks in another state to actually house our incarcerated individuals. So one thing I'll say that came out in terms of the focus groups, and I will say that for the many years that I've been working with the Department of Correction, I had not experienced the level of openness that we've had under Commissioner Quiros to do this work, and the various facilities that we're working in, Garner, New York, and now at the Academy. And that level of openness, and I referenced the focus groups that we did, allowed us to get a sense of what is the culture here. And it was essentially to a person a culture that acknowledged that it was doing a disservice to the people that not only resided there but that worked there. And they have an average life expectancy of 59 years old. And we've co-created a situation here in the U.S. where it's a very volatile and, in a lot of ways, not very logical and humane system. And what does that mean in terms of resources and how they're allocated? It means a lot of people are rowing in different directions. And I don't think you'll ever be able to say it's this amount will be that amount given the current circumstances, which is why I think we believe that the pilot program, along with the assessment, will help to get a better sense of that. You know, you spend, the state spends, just a rough analysis, probably at least $2 billion in corrections. And one thing that we found in the Norwegian system is their mentality is, if you're going to spend those resources and you're entrusting us with the individuals, sometimes with the most difficult cases that you have in the state of Connecticut with traumatic backgrounds and whatnot, if you're not trusting us to take the risk, and we're not taking that risk to ensure those individuals come out better, then we're pushing that risk off into society. And I think what we're finding here is we've identified officers and leadership within the DOC that is taking that mantra seriously. But in the Norwegian and in the Scandinavian correctional system, they have far fewer prisoners, but they're more heavily resourced because they realize the resources that are needed. And not just within corrections, but the various supporting agencies and entities like a Yukon that can help them and serve their mission. And so in a place like Norway, you would have the education system actually run by the municipalities, the library run by the municipalities, so that wouldn't be shown in their budget. But you know, we've pushed corrections off into the periphery of society, and you can hear it just in terms of testimony and like, it's like, what is corrections doing? What is corrections doing? But corrections is us. And if we collectively as a society don't take that ownership and put it entirely on the 5,000 or 6,000 individuals that are serving that population, I feel like I'd be here in 20 years having the same testimony. So I think that's a really good question, and I think that's one that if this bill moves forward, that we'd be happy with tasked with providing some answers to you.
No, I appreciate your response, and yeah, that there are cultural norms that get established and then become institutional norms, and that's perhaps something we should be looking at. But I'm still trying to understand the staffing. So essentially, we now have double the staff that you would for a population that was, double the size when you had 20,000 before. Is it that the needs have increased, that's why the resources still feel like they're limited? Have there been more sort of requirements that have been put on the staff, or is it that staffing, again, maybe it's part of a culture where we're not sort of applying or utilizing the resources we have in a way that's actually effective for a number of things that we're attempting to do?
So, I don't want to get ahead of the research or the study, and I don't want to speculate. What I would say is that again, I'd go back to this issue about what is the task of the individuals within the department, and are they clearly defined, and are they working together in partnership for a common goal? And how is it that those are defined? One of the things that's differentiated here in the U.S., Connecticut is no different than in the best practice models that we looked at, is how individuals are trained to actually be in the position that they're serving, because a lot of the questions you're asking is, once they get there, what are they doing? But right now, a correction officer goes through 14 weeks. It was up to 16, it was at 12 in the beginning of the 2000s, 14 weeks to become a correctional officer. It takes 2 years to become a correctional officer in Norway. That level of competency and pride in that work, based on the tasks that they're given, how they're outlined, the ethics, and all of the various roles that each plays, it's taken extremely seriously, and it is reflected on how well those facilities operate and how they operate across the country. That's, we have, what, 3.5 million. They have roughly 5 million. And we have, anywhere around, I guess, 12 facilities now. And they have probably over 25 or 30. So they have a uniformity across a broad range of facilities that, frankly, we don't see here. And I think that has a lot to do with how people enter into that profession and the training that they're afforded both before they get in and then on the job.
Mm-hmm. And some of this analysis may be able to come up in the work that's being proposed here. Just one last question. Given Barbara Fair's testimony, and Representative Lamarck Mura's testimony that we have half the population and we have more beds available than actual individuals, why do we still have overcrowding? Why do we have a situation where we have, multiple people in a small cell when, again, the population of the number of individuals incarcerated has in fact decreased?
Well, if I could wave a wand and go back to the original ARPA funds, what I would have done is completely use them to transform our correctional facilities. I mean, they're not only antiquated, they were built at a time when the primary purpose was to punish. And I don't think, regardless of which space you put someone in now, it's going to fulfill, what we could be, essentially. Why there's overcrowding? I mean, that's something I guess the Office of Policy and Management and the Governor's Office and the Corrections Commissioner would have to answer. There was a push to close down facilities, and certainly that means that you have fewer beds. The ones that remained open, why they did relative to other ones, I'm not entirely sure.
Thank you.
Thank you so much. Seeing no other questions, thank you so much, Mr. Clark.
Thank you. Appreciate it.
Next, we have Aaron. Oh, excuse me. Before we jump to Aaron, we have two people who are number 35 who have to teach a class in 10 minutes or something. So there's number 34, Kalina Siskanker. Oh, she's not. Okay. And Seth Freeman, I see you online.
Hello. Senator Gaddcar Wilcox, Representative Dathan, and members of the Government Oversight Committee. Thank you for providing me space to testify. My name is Seth Freeman. I am president of 4Cs SEIU Local 1973, which represents faculty and staff at our Connecticut State Community College, part-time faculty at University of Hartford, and teaching faculty at Charter Oak State College. I'm also a professor at CG State Capitol, and I'm here to testify in strong support of SB 423 because Connecticut urgently needs real oversight of the consolidation of our community colleges. For years, faculty, staff, and students were told that the consolidation would create efficiencies, improve student experience, and streamline services. Our higher education unions knew this would not be the case, and now our campuses, our workers, and our students are experiencing the opposite. Students are facing reduced access to in-person support and less of the on-campus based help they rely on to persist and complete. Students are being forced to take classes online or travel to campuses, to other campuses for the classes they need. Faculty and staff have seen decision-making pushed farther away from our campuses and have to navigate a new statewide bureaucracy that makes decision-making slower and less effective. This bill matters. SB 423 matters because to this day, the CSCU Board of Regents and CSCU managers continue to not tell the truth about the negative and harmful consequences of the consolidation. SB 423 required the Board of Regents to do what should have been done all along, show the public in measurable terms what consolidation has actually produced. Just importantly, the bill asks necessary questions. Has consolidation saved money? It's the experience of our faculty and staff that the consolidation of our colleges has not saved the state of Connecticut one dime. We have seen the number of excessively compensated managers in our system explode, with more managers than ever before. We believe that to the extent there have been any savings, the savings are due to the cuts to student-facing services at the campus level. We have never seen any accounting from the Board of Regents to demonstrate savings, and we find the $30 million figure shared by Chancellor Meduco to be completely incredulous. Finally, we would be remiss to talk about the benefits or lack thereof of the consolidation without reminding the legislature that this consolidation was never designed to fix nor still have not fixed the fact that 75% of the teaching faculty in our community colleges are part-time, paid on a semester-by-semester contract with no healthcare benefits. Connecticut has the odious distinction of having the 5th worst ratio of full-time to part-time faculty in two-year public colleges in the nation. Worse still, Connecticut institutes racialized austerity, whereby the larger the population of Black and Brown students in our public higher education system, the less access they have to full-time faculty. This remains one of the biggest inequities and frankly insults to our working class students, as our experiences and the research is clear that higher rates of full-time faculty correspond to higher rates of student retention and student graduation. Again, the consolidation did absolutely nothing in this regard, nothing to ensure more equitable student-facing services for our students. Connecticut students were promised that the consolidation would improve their experience, not make college harder. That promise has not been kept at all. It's past time. This legislature demands more accountability from the Board of Regents, and SB 423 is a necessary step in this direction. Please also see my written testimony, and I'm happy to answer any questions.
Thank you so much. I heard about this, these issues in my experience in the higher ed subcommittee of appropriations, as well as another oversight committee that we did on higher ed. I think it was the summer of '24. And some of the issues that folks were facing when it came to student outcomes as well. And I know as a person that's facing these students all the time, you kind of see it directly. I have heard anecdotally of students having to do chemistry labs on Zoom. I don't know how that works. And there are other sort of hindrances that are actually hurting students from being able to get a full-time or get a access to all the like learning options that are available because of class limitations. Also issues with even on the administrative side with financial aid, with transferring classes from one organization, one section to another, and some of those issues. Do you have any sort of comments that what you're hearing about what the student experience is like?
Absolutely. When I began teaching at Capital, over 20 years ago, every student that came to Capital could take a full-time, could study full-time and find all the classes they need here on campus. We might not have offered every degree program, but every student that came to the campus could study full-time. The change that has been made due to the merger is now that we're CT State, every student can take any degree, but they can't take it on their home campus. And that's a huge cultural change that we've made that no one ever talked about. No one said, well, it's great that you're a CT State student and you can come to a community college and take any program, but what they're not saying is, but you're going to be taking that online, or you're going to be driving to 3 or 4 different campuses. And that's not the experience that our students want today. So I just came from our tutoring center today and was talking to one of our, staff there. And they were saying this exact thing. Students are complaining that they can't find the classes they need. And they're being, many students are being forced to take classes online. The Board of Regents will say, they'll throw out a statistic, 40% of students are taking classes online. They're being forced to take classes online. Some of these students are choosing to do so objectively. Many are not. They're forced to take these classes online because classes have been cut, and it's just rarer and rarer to run into a student that can do a full-time schedule on their home campus. And so it's been a real culture change, and that was never talked about. And that's really, and it still isn't talked about, to be frank, from the Board of Regents. They will never answer the question, well, how many of the students that you're citing that are taking classes online are being forced to? That's the question that they refuse to answer that question. They don't even try to answer the question. They just naively want to act like all these students are taking classes online by choice.
All right, that's actually really a useful thing to be thinking about. unfortunately, they didn't sign up to testify, so we won't be able to ask them as part of this public hearing, so I'll have to do a follow-up. I think with that, is there any other questions? Nope, seeing none. Thank you, Mr. Freeman.
Thank you.
Great. Now, Erin Williamson. Thank you very much.
Good afternoon. My name is Erin Williamson, and I am the Chief Programs Officer at Love 146. We are the state's primary provider of specialized services for children and youth who experience trafficking. We provide services statewide, and since 2014, we've served over 1,000 youth in Connecticut. I just want to note that we've served youth in every county, so if you think this isn't happening in your neighborhood or in the counties you represent, it is, unfortunately. I did submit written testimony, so I'm going to keep my oral testimony to sections 8 and 10. We are a member of RHTRT's statewide steering committee. We've worked very closely with this steering committee over the last couple of years, and are in huge support of the temporary human trafficking prevention and response task force that this legislation would create. Really, the primary thing we want to talk about is that, it's not uncommon for our children to be trafficked in multiple jurisdictions, or for us to have children who come from different jurisdictions all trafficked by the same perpetrator. And so these cases require significant cross-jurisdictional coordination. And we do see that there is inconsistencies across jurisdictions, both in terms of response, prosecution, skill sets, awareness, and service availability. And so creating this task force is really critical. We have a small state. We should have standardized practices. And this task force, which will sunset, will help us figure out what system and structure we need to make sure we have a standardized, coordinated response across the state. So testifying in support of that. In terms of Section 10, I just also want to reiterate what some other people have said. In 2019, the DCF switched how they were handling cases of trafficking called into their care line. They did used to open up a case for every trafficking call into their care line, and they switched the practice where now, if it's not, the concern is not against a parent or entrusted caregiver, they get rerouted to the MDTs. I was very concerned about this switch back in 2019. I was very concerned kids were going to fall through the cracks, and had quite a number of conversations with them. I've been unbelievably impressed by the CCA and the MDTs and how they have teamed these cases and made sure these kids get services. I do, though, want to reiterate that CCA and the MDTs did not receive any additional funding. And the large majority of cases of trafficking of children do not involve parents or entrusted caregivers. And so really, they are teaming the large majority of trafficking cases, and they do not have any additional funding for this. In addition, the number of cases coming to these teams and coming to Love 146 has exponentially increased. The majority of Love 146 funding is federal funding. We get very little funding from the state. I know that last year there was a line item that afforded us some additional funding. Unfortunately, we lost some of our federal funding. And so really that just supplanted. We currently have 59 kids on our wait list for long-term services. That's 59 kids that have come forward that we suspect are survivors of trafficking that need services that we're not providing it.
Wow. Thank you for sharing that. First of all, how much federal funding did you lose?
So we lost a multi-year grant. It was about $350,000 a year, or 360. I'd have to get you that number. And so our line item was 500. And so it, was slightly more, which was great, but we had hoped that it would really have allowed us to exponentially increase the availability of our services. And unfortunately, it's allowed us to maintain and slightly increase, but not the way we had hoped.
Yeah, and then I did remember there was discussion in appropriations, and I don't have my budget book with me, but the line item for Love 146 seemed to go away in the governor's budget. Did it get moved somewhere else? I seem to remember having a discussion with Representative Walker on this specifically.
So I'm not sure exactly where our line item is. I'll have to check with that. One of the challenges that we have is the consistency of funding, right? The stabilization of funding, even line item to, year to year, that's, we're talking about really in-depth long-term services that these kids need. And so stabilized funding is just really critical for this population.
Absolutely. And I'm very disturbed to hear that there's 55 children on the wait list. Why are they not getting picked up by DCF?
So we're the service provider, and so some of these kids do have open DCF cases, some of them do not. They're not all system involved. DCF doesn't provide direct services, and so they partner with us to provide those services.
Okay, that makes sense. I guess, in the research I have seen, it seems like about 75% of trafficking cases go unreported. So the fact that you're seeing as many people as you are means the problem's exponentially greater than what we're even seeing. And I think some of the aims of this bill was to get people to be able to report this and make people aware of it, because I think, as somebody reported earlier, is some young people don't really even understand that they're being trafficked. And when we talked about the state definition of human trafficking, it can be a variety of things. It's not obviously sex trafficking, which is what most people go to with everything going on in our national media around that right now. But there's other, situations. It could be a nail salon, it could be a restaurant, it could be, and I know, I think in general law, there is a bill that is looking at additional training, and Connecticut has done some clampdowns on hourly rentals of hotels and things like that. But all of these are just little pieces, and it feels very fragmented to us. Which was the other reason my co-chair and I decided we really wanted to look at this issue closely. So, any questions from the committee? Seeing none. Thank you so much for your testimony today.
Thank you.
Great. Number 25, Rosanna Ferraro. I see her online, ready to go.
Good afternoon to the Government Oversight Committee. I am Rosanna Ferraro. I'm a resident of North Branford and the Policy Director at Universal Healthcare Foundation of Connecticut. We envision a world where justice prevails, health is respected as a human right, and equity is realized. I'm here to give general comments on HB 5474 regarding DOC medical care oversight. To be perfectly transparent, we have not weighed in on medical care in the Department of Corrections before today. We do need to rectify this as an organization. Universal means everybody. It's in my Zoom background every time I testify, every meeting I'm in. About 4 years ago, we shifted from leading on health coverage reform to supporting organizations that are organizing for health justice. We know that health is more than healthcare coverage, and our shift was a recognition of this, as well as a recognition that to achieve true health justice, we needed to see big changes in all of our social determinants of health. In our work, we prioritize Black and Brown folks, LGBTQIA people, immigrants, folks that have low incomes, and individuals with disabilities and chronic illness, because they are most impacted by injustice in health. Many, if not all, of our priority groups are disproportionately impacted by incarceration, and many, if not all, of the social determinants of health are of poor quality within our carceral system. As we have worked with partners and taken their lead on a number of key issues, it is obvious that health justice for all is not possible without access to quality care for all, including those in our carceral system. As far as oversight of DOC healthcare, I feel like the Office of the Correction Ombuds and Ms. Barbara Fair lifted up one concern that we echo, and a number of other concerns that we also echo. But essentially that the Ombuds office is really not the right place to oversee medical care. And it's nice to see you nodding along, Representative Dathan. And it's very simply that this is such a critical piece of our responsibility for the folks in our carceral system that we want to ensure that however it's overseen in a robust way. And also that it is overseen to become a place of quality care for folks in that are incarcerated. There's a number of other things that were mentioned, particularly by Ms. Barbara Fair, that, like I said, we echo. To be perfectly honest, this is an area where, as an organization, like I said, we don't have a ton of expertise. We have been following the lead of Stop Solitary and other folks that are advocating for people in our carceral system and and justice impacted in other ways. So we just want also to be here today in full support of the work of all of those advocates that have tirelessly pushed something that we have not yet. And so we just want to be here in solidarity with everyone to ensure that everybody really does have access to quality care, no matter where they are. So thank you so much for your time. I appreciate it.
Excellent. Thank you so much. Did you submit written testimony?
I have not yet, but I absolutely will. There was a couple of things I wanted to be sure that I was not incorrect about, and the hearing is often very helpful to clarify. So I will be sure to submit written though.
That would be great. There's some great information online as well. Great. Any questions from the committee? Seeing none. Thank you very much.
Thank you so much. Now I can run over to Human Services for me.
Exactly. Tell them hello for me. Next, we have Drew Michael McWeeny, who's also, everyone seems to be up in Human Services or here today. Thank you so much.
I remembered to turn on the microphone too. So.
Thank you.
That's great. My name is Drew Michael McQueenie. I'm an assistant professor of early childhood and the program chairperson of the Early Childhood Education Department at CT State Norwalk. And I'm here to support two bills. First one is SB 424, an act concerning oversight of plans pursuant to Section 504 of the Rehabilitation Act. It requires the CSD to publicly track and publish data on students receiving Section 504 plans. Currently, Connecticut collects extensive data on students with IEPs, yet comparable statewide transparency doesn't exist for the 504. So this lack of visibility makes it very difficult to identify trends, disparities, potential misuse. In many districts, our teachers have noticed a sharp increase in the use of 504 plans, yet policymakers have little data to determine whether those plans are being used appropriately. So by requiring this annual reporting and trend tracking, this bill is going to provide the empirical foundation that's needed to make informed policy decisions. The bill also wisely directs the Department of Social Services to identify services provided in schools that may qualify for Medicaid reimbursement. Many states already leverage Medicaid to support school-based services, including but not limited to behavioral supports, counseling, certain therapies. Connecticut has historically underutilized these, so by identifying the eligible services, the state can potentially draw down federal funds to support students without increasing the burden on local property taxpayers. And I know that a lot would argue against me and say that additional reporting requirements could increase administrative work for school districts, but the bill explicitly limits reporting to essential information such as demographics, types of differentiations, evaluation periods. So it directs the state to adopt existing special ed data systems rather than creating some new ones. So schools already gather much of this data as part of routine documentation for the 504s. And then on the other bill, SB 423, an act concerning higher education, I believe this bill has to outline proper oversight of how the education of our students is taking place. This bill is a great idea when the data requested and the data given represent what the community colleges should be doing for students. Many believe that what has been asked does not properly reflect what is occurring on the ground, although this bill represents a necessary and responsible step towards ensuring transparency, accountability, and effective governance. So just some quick points, lines 15 to 28. None of it reflects community college students doing away with developmental education courses. All those courses will be affected by this, and course material will have to be less stringent in order for students to pass, and they're going to pass with little to no learning. Line 29, students who take classes across campuses have little to no support at all. Lines 45 to 46, all of them can't be efficiently redistributed. So how does it help any of our students if decisions regarding them cannot be made locally by those who actually know them and understand the issues? Lines 49 to 50, there must be a basis for how this is done. Lines 58 to 60, it could have and should have happened without consolidation, and New York figured it out many years ago. So that I don't think has anything to do with the consolidation. And finally, lines 64 to 66, the whole system has been starving the individual campuses since the consolidation occurred. So how can we do this accurately? Line 75 to 91 is a brilliant idea, although I would like to know how can we analyze this? What would a bunch of numbers tell us? And finally, lines 105 to 108, how would the content be used and interpreted? So I think this bill is a real necessary step towards ensuring that the whole system is held accountable. And I also support the other bill on the Rehabilitation Act. So thank you very much for your time, and thank you, Representative, for your work over in Norwalk. I'm happy to answer any questions that you may have. Appreciate it.
Great, thank you so much. One of your colleagues, a constituent, came to me, and this was one of the impetuses around this bill. And my good co-chair, her husband is part of the CT state system. So it's an interest of all of ours. And as I highlighted, we've been hearing from folks, and I've spoken to constituents who are at Norwalk. I know what I'm hearing on the doors in Norwalk from CT State Norwalk students, but in your experience, you talk to a lot more than I do. How many students come to you, and has there been any feedback from people at CT State Norwalk regarding the concerns about the consolidation?
Yeah, that's such an awesome question. So as you know, I'm in charge of the early childhood education department. So a lot of at least since I started in this position as a college administrator on January 20th exactly. So I came from University of Hartford and CCSU as an adjunct faculty because I left the classroom as a public school teacher. And so even though I'm new to this role as a college administrator, I can tell you immediately that one of the biggest concerns that has been brought up by students at Norwalk is that they have to go to other campuses to take classes because Norwalk is not able to, for whatever reason, is not able to offer them. And when they try to go to other campuses to take the classes, they're not running them. So a lot of what I'm hearing, at least to start from the students, is that they would like to have the courses and stuff at Norwalk Community College rather than having to go elsewhere. And my friend Lois, hi Lois, if you're watching, who's our proud president of the Norwalk Senate, she had made it very clear that Norwalk has been the gold standard of all the community colleges, and that was one of the reasons why I wanted to apply to work in Norwalk. And a lot of our students from Housatonic and Bridgeport would come to Norwalk because of our reputation. So the fact that we're seeing disbursement with students going elsewhere is a problem. But to answer your question, going back to what you asked, it's the taking of the courses is one of many that students that I'm hearing are really echoing as their major concern.
Yeah, I think somebody asked, the person that was testifying remotely earlier said, maybe the more appropriate question is how many students are being forced to take classes online? And if you could comment on that, I'd love to hear your answer.
Yeah, so I only know from a couple students that they've had to take some general education courses online. I heard some English, some chemistry. I am glad that in early childhood education, none of our courses except for one is online, and I'm going to be planning on moving that one in person. So at least in my department, we're having all of our courses. Because in teacher education, our students need to go into the daycares, into the public school preschools, and stuff to actually get the hands-on experience aside from, engaging in the hands-on, learning experiences and the content that I'm going to be teaching them as the expert in the field. So I'm happy that, a lot of departments are having all the courses in person, but yes, I do know many students that are taking a lot of other classes online. I can't speak for the other departments into how effective that is, but I know that, again, the students are echoing that they would prefer to have, again, in-person classes at their campus.
Thank you for that. I think one of the things that Lois has highlighted to me in the past is about the administrative functions and how that's handling. The interim chancellor did submit some written testimony, and I just spotted it online, and I'll have to dig into it later. He's saying here that there is the consolidation has already resulted in a reduction of duplicative administrative structures. For example, CT State has 1 chief financial officer rather than 12, and the number of campus leaders have been reduced from 12 to 7. And it's actually, he's saying it's streamlining operations and coordination across campuses. I guess, so then my question is also maybe some of the senior positions are gone, but what I'm hearing anecdotally is the ability for students to get the courses they want to take and locally. I've also heard a number of complaints regarding the ability for like the financial aid to also be talking to the enrollment and ability for students who maybe have a question that's come up with in regards to financial aid getting dropped from a class before they're even walked over to the other office to try to resolve it within minutes. Have you heard anything like that anecdotally, or how is that working at CT State Norwalk?
Yeah, so if I can just give my quick opinion, I think the chancellor is as phony as a $3 bill. For him to even make the argument to say, well, we streamlined our services, it's much more efficient to have a HR person at every campus because it takes that much quicker to get things done, whereas you have one centralized person, it's going to take longer and longer and longer and longer, and it's annoying. And specifically, there were 2 issues that Lois, I wanted to just emphasize from Lois's testimony that she submitted. One, she's been trying to get like many organization charts that have any connection to, so the organization charts in terms of who to talk to go to things, and like there's none of that. The idea that the administration is pushing out about, quote, shared sacrifices, human resources really doesn't appear to exist. I know that in Norwalk we had one of our primary HR people resign. I don't know why, but so a lot of the issues that I'm hearing, one of the issues is coming from the human resources, and again, just the claim that everything is streamlined. It's taking longer and longer for everything. So that's why a lot of people feel frustrated with the consolidation, is because they believe that it's just taking way too much time. I mean, the idea in their mind was to save money. It's costing a lot more because it's more time. So yes, I'd say to your point, I'd echo that is a shared view among at least the Norwalk campus that I'm hearing.
Yeah, as I said, I've heard it at doors and my visits to CT State Norwalk. The other question I have is, how is all of this affecting teacher retention? If people are frustrated about not being able to get things resolved, having classes dropped without much notice or not enough enrollment, that could be causing, serious retention issues, in my opinion, as a business leader.
Yeah, I can echo that. And in fact, I would speak to early childhood since that's my department. So right now, we haven't lost any students due to any sort of dropout. So I'm lucky on that end, but I'm pretty sure it's happening to many other departments where enrollment is going down because of that. So I don't have the answers to how to solve that, and especially since I'm relatively new in this position, although I do know that since the consolidation happened, it's done more damage to students than what the administration is telling us and expecting us to just eat like a Taco Bell meal. So.
All right. Thank you so much. And I saw you had detailed written testimony on the two bills, so that was really helpful. And I'm sorry that Lois couldn't make it here today. I know she had written me an email saying that she was a bit disappointed in the bill. She knows there's going to be some oversight, and she's just a bit frustrated and with her role as the head of the Senate. So.
Yeah, and Lois's concern too echoes a lot of people's concerns in that it has to outline proper oversight. We do believe, though, that this is a good first step towards getting that accountability, because the argument is, no matter who you ask, is that the administration is the problem. And it's the low people on the totem pole, unfortunately, that are beholden to what administration's directives are, and sometimes we even don't know how to navigate that. So that's where I think the frustration is, unilaterally, is in administration.
Yeah, and I'm going to echo what I said earlier. Some of these things that we're talking today are big, meaty issues and will not be resolved in one legislative session, unfortunately. If we're going to do things right, we need to be thinking more strategically and longer term. So hopefully this will be one of those aspects. So thank you so much for coming all the way from Norwalk today. It is very much appreciated.
Thank you for our conversations. I'm always happy to talk to you.
Excellent, thank you. Number 29, Megan Griffin. Is she remote? Oh, there she
I am
is.
here.
There you go.
Hello, Representative Dathan. Before I begin, may I make a request to split time with Deborah Joyner, number 36 on the list? She's using my Zoom link because she had some technology issues, so I'm wondering if Greg might be able to help promote her in here. I think she's under my
I
name.
don't know if we can do that. Can you do that? She has to accept the invite first.
Okay.
You said number 36, Deborah Joyner?
Yes, she's using my Zoom link, so she's.
Yeah. Is it working? Deborah, if you're hearing us, you need to accept the invitation. I think what we might do while this is getting resolved, if you don't mind, Megan, because I'd like to hear both of you together. I'm going to move on to Cindy Pritzo. I see her in the audience ready to go, and hopefully we can resolve this technology issue.
Great. I apologize for the confusion.
No problem. Good afternoon, Cindy. You have to turn it on. There's a button there.
There we go. I just didn't know the note. Good afternoon. We just about cleared out the room today. All right. Representative Dathan, I'm happy to be here today. And my name is Cindy Prizio. I represent a civil rights organization, One Standard of Justice, that has its work cut out for us because the population we service are those who have been convicted rightfully and wrongfully of a crime of a sexual nature. So I'm submitting written testimony, but the person who wrote my testimony, that this bill was super packed, a lot in it. So I'm just going to hop around and tell you what our concerns and what our happy place is. Whoever suggested, and it may have been...
Just to confirm, which bill number you were referring
Oh,
to?
I'm sorry, 5574.
Great, thank you.
Let me just check that. 5477. I'm so sorry, the wellness bill, PRIA. All right, so whoever is suggesting that we increase a mandatory minimum from 9 months to 2 years for a sex 2, we have to really insist strongly that that does not happen, and that is taken out. We're moving to giving more and more discretion to judges. In fact, there was a work group established 8 or 9 years ago, and the movement has been getting more and more traction. So when you have a charge like sex 2, a judge can give up to 10 years, quite frankly. So it was a bit offensive to bring us up to a higher mandatory minimum. The second thing that concerns us is that when there is a sexual abuse survivor, a person who has survived sexual abuse in a prison, that we have to insist that we get third-party servicing for trauma. I don't believe that whatever service is getting provided now by any victims advocacy organization in the state, and especially for my population, there's a conflict of interest. And I'm happy to discuss that with you more now or more privately. The other thing is that, you know, I know Alex, my friend Alex, and I talked to her about this, was praised for coming forward and talking about her lived experience. And that's what we do. Not everyone, if we could normalize more of these conversations, we could really help heal both sides of the coin, and we could put our resources in prevention. Federally, they're spending billions of dollars on incarceration and a mere 10 million on prevention of child sexual abuse. So normalizing the conversation, leaning into the tough conversations are necessary. We cannot hide from this. The other thing is, nothing about us is for us without us. And I read the bill a couple of times, and the surveillance cameras, I understand why they may be important, but the people, especially the women at York, I think that we cannot be making these unilateral decisions for them, that somebody needs to go and get them in a circle and say, how do you feel about this? Because some of their privacy, or more of it, and they probably get very little privacy in an institution. So I just feel that rather than us dictate or corrections dictate to people, there's just a nicer way to do it. And then the section we love is section 9 with the IMRP. I got a chance
Please summarize.
Yes, I got a chance to study the Norway prison system. And when we talk to wellness, I don't think anything can make us better than if we get a more humane model prison. And the way we do that, we shouldn't have 11,000 people incarcerated in Connecticut. New Jersey has 13,000. So the way we do that is we are giving such heavy demands on people for parole and probation. They're not, my community isn't sexually reoffending. They can't live through those technical, the sanctions. And so they're recycling in and out of prisons. They're not no threat to public safety. So I just feel that we can adopt. And I had been on the phone with 2 prisons. Andrew Clark knows the second one better than I, but one was in Pennsylvania. And she was implementing the Norway system. And then COVID struck. And basically their attitude was, if correction staff, if you don't buy into this, then please, there's the door. We have to take into consideration everyone, and the whole system is broken.
Well, thank you. I appreciate your comments, and I take it, I take some of the things and I've written them down. Did you happen to submit testimony? And it could be me just not seeing it. Did you submit any written testimony?
No. The person who wrote for me did not go into the depth I felt this was needed. There's a lot in this bill.
Okay. Is there testimony online somewhere?
I will be putting it in.
Okay. Yeah, that would be helpful. And then if you can add some of these things, it is, half of our committee is in like 3 other hearings that are going on in the building right now. So it's hard for everybody to be here, but having the information online is super helpful for us to go back and look at later.
And Representative Dathan, I've been in this building over 10 years now. am not, the last time I was invited to a table was when Brandon McGee was a representative, and it was housing.
Yeah.
There's two sides of the same coin, and we're the people with the lived experience, and we know the harm that's being done to families because of these oppressive policies. So I just want to say that publicly,
Yeah.
because we must be part of the conversation
I hear you. And
rather than denied.
Yeah, I'm so happy that you put in testimony today. It really does mean a lot to hear from you so that you are part of the conversation.
Thank you.
And I will echo Brandon McGee, amazing person, and we do miss him as a rep, but he's doing good things. So I'm happy.
Well, during COVID, Rep McGee called me at my home, and he goes, "Can you help me with this person first language?" And so if Rep McGee could have asked for it in 2021, we can do it. We can do it.
Well, you can submit that with your testimony.
I
then.
will.
Thank you so much, Cindy. Next, we have Joy. Oh, I'm sorry. I have, there we go. Megan, I see you.
Yes, and I am joined by Deborah Joyner, the chairwoman of New Englanders
Wonderful.
Against Sexual Exploitation. So wonderful. Thank you very much for your patience there. All right. Chairwoman Gadker Wilcox, Chairwoman Dathan, Vice Chair Gooker, Vice Chair McRory, Ranking Member Sampson, Ranking Member Carney, and honorable members of the Connecticut Joint Committee on Government Oversight. My name is Megan Griffin, and I am a public policy manager for the National Center on Sexual Exploitation, a nonpartisan organization mobilizing through litigation, research, corporate advocacy, and public policy to eradicate all forms of sexual exploitation and abuse. I also grew up in Norwalk, Connecticut, in Chairwoman Dathan's district, and my parents are longtime residents of Norwalk. NCOSE works on bipartisan state legislation across the country to support survivors and combat sex trafficking. Through this work, we have collaborated with human trafficking coordinators in states nationwide and have observed where the positions have been effective and where they have fallen short. We sincerely support the intent of this legislation and the need for an anti-trafficking coordinator to coordinate the gaps in Connecticut's anti-trafficking response. But as we discussed the presence of adult survivors of sex trafficking in this committee earlier today, we believe that this legislation falls short and that it does not adequately address adult continuums of care. For this reason, we oppose HB 5476 as it is currently written and would like to recommend some changes to the bill. As I said, the bill largely neglects continuums of care for adult survivors of sex trafficking by limiting the provision of services through the Department of Children and Families to minor children. This approach fails to establish any comparable statewide continuum of services for adult survivors of sex trafficking, and victims of child sex trafficking are not automatically on their feet the day they turn 18. They often require ongoing care and support in order to reorder and rebuild their lives. Further, this child-focused approach is also reflected in the structure of the Human Trafficking Prevention and Response Task Force. The proposed governance structure is dominated by agencies serving children and child-focused advocacy organizations, with only one seat explicitly representing organizations working with adult victims. An effective task force would adequately represent the full network of statewide providers serving both adult and youth victims of sex and labor trafficking. Further, several states have created statewide anti-trafficking coordinators and councils designed to address all forms of trafficking that we've had the pleasure of working with, including survivors of adult trafficking and survivors of labor trafficking. For example, Delaware established an anti-trafficking coordinator within its Department of Health and Human Services. Texas and Ohio house their coordinators within the Attorney General's offices, and Arizona's governor has created an anti-trafficking coordinating council within the governor's office. I'll just summarize. These models place anti-trafficking leadership in agencies with broad authority and bring together partners to coordinate prevention, victim services, and enforcement for both adult and child survivors. By contrast, this legislation focuses primarily on children and child serving systems, which risks leaving gaps in addressing adult victims and victims of labor trafficking. We appreciate Connecticut's attention to this issue and the recognition that stronger coordination is needed to combat trafficking, but ask that you pay attention to adult survivors as well in this legislation. Thank you for your attention to this issue.
Thank you. Deborah, did you have any additions and comments?
Yes, I did have a submission to read.
Since you are together, we're sort of out of time. Is there a possibility you can summarize? And you're hopefully, I see the testimony for Joy here, or sorry, yeah, Megan. Apologies.
Yeah.
Lost track here. Yeah, Megan. And I'm just looking for yours. But if you could summarize it, that would be wonderful.
Essentially, I am in opposition to the bill also for similar reasons. The focus, while it is just incredible to be having the position of you being so forward facing with taking care of our youth, the focus only on youth does exclude adult survivors and those who are being trafficked as adults. And it kind of contributes to that revolving door, because as soon as those children age out, the day they're 18, traffickers know about that aging out process, and they're right there waiting to, they've groomed them a lot of times ahead of time, and they're ready to pounce on them. And, the services that are needed, it takes years to recover, not just months. So not having that adequate voice at the table to advocate for adults, so that in effect you advocate for children and you get that whole wraparound, that gives me pause on going forward with supporting the bill. I support the bill totally, except where it excludes the coverage of adult exploitation, because the bill is worded as an anti-trafficking bill. But if it doesn't include those trying to come out and those who are still in, who are not children, I feel like there's gaps there, and it excludes the survivor voice, which brings a rich opportunity to identify the gaps in the laws and services and how to access those services. For instance, Partners to End Human Trafficking, who is headquartered right here in Connecticut, does not have a voice at the planning table presently, as well as the organization Building One Community. So to me, that is very important, to include survivor voices who have the lived experience to enrich the process.
Thank you. It was interesting when I looked online this morning at the testimony. I was kind of surprised to see two people opposing to the bill, especially with organizations that like you've done. But you've done a good job explaining why. And it sounds like, in my opinion, and forgive me if I'm oversimplifying it, but it sounds like to me you're saying this bill doesn't go far enough in terms of making sure that we're protecting adults and ensuring that we continue with services long after the trauma. Is that?
Yes, it's,
yeah.
Oh, pardon me, I didn't mean to cut over you,
No,
especially when you take into consideration interfamilial trafficking and generational trafficking. So if there's not enough continuity and guidance and protection ends as soon as they become an adult. Oh, the day they turn 18, everything didn't change about the life that they were experiencing. And without that support going forward, you then just kind of get a cyclical cycle
Yeah.
of.
Yeah. Well, I just finished a book that talks about a young woman who was trafficked, and it went on and through her early 20s as well. So it doesn't just stop. And I think, you know, we have to be thinking about this. And as I've said before, I think this is Connecticut is not just the land of steady habits, but I think it's the land of incremental change. And I think this is an opportunity for us to create a foundation of how we can deal with this issue so that we can go away from being an F grade as the shared Hope International credit card, report card, that we'd be able to improve every single year until we can really minimize this issue. So is there any questions from the committee? Seeing none, thank you so much for your testimony, and hopefully we can continue working on this issue to make it a great bill that everyone can support. Next, we have Joy Ocha. Okay. Joy, if you're online, it looks like it said you were going to be in person, but I think you might be remote. You need to accept the invitation. We're going to go to Peter Myers.
Good afternoon, everyone on the committee. Good afternoon, chairs, ranking members, members of the committee. My name is Peter Myers. I'm the Senior Public Policy Director at the Connecticut Business and Industry Association, where we are very thankful to represent thousands of member companies in Connecticut, 90% of those companies being small businesses across the state. And I'm here today to testify in strong support of House Bill 5754, which would help to modernize environmental permitting in multiple different ways across our state, looking at our neighbors across the region and following their lead. First and foremost, I want to highlight our strong support for a section of the bill that would look at third-party environmental permitting, which Pennsylvania has recently passed in their SPEED program, which would allow DEP to license environmental professionals or engineers, however it may have you, to issue certain permits. Connecticut has a rich history of that with our longstanding and successful LEP program, where DEP issues licenses to environmental parties to sign off on spills, and we believe that is a good framework to continue possibly looking at expanding to help clear backlogs and help take some stress off of the strained workforce at DEP. We also want to raise our strong support for a provision of this bill which would allow for expedited environmental permitting. So there are some permits that happen where individuals think snow melt, where we might get very large snowstorms and businesses need to melt the snow as fast as possible to continue their operations, and they might need a permit for that. Certain times those permits might take 3 weeks to a month, if not more, and that's with constantly calling and having a dedicated individual designed to do that. If there were to be an expedited fee potentially available at DEEP that a business would be happy to pay to be able to get their business back operational while maintaining that that permit has been adequately reviewed and not jeopardizing anything with the environment, that's something we would be happy to support. And I also want to raise a quick level of support for the AI permitting. AI is prevalent in every industry across our state and across our country, and ways where we can look at using AI to help take some of the workload off of individuals at DEEP and help them really get involved in their job even more so and take some of the stress off of them is ways we want to do that. So we're happy to support this legislation, happy to take any questions. And thank you again for raising it.
Thank you so much. There was a few people that have come forward opposing it, and some from the environmental community, and I don't know if you had a chance to look at their testimony, but there was some concerns about those automating of permitting and using AI with some of the issues, and so that was one of their concerns. Again, this part of the bill is not something that we're going to put in. It was something that we could be looking at to see how we can do that going forward. You know, it's interesting. You know, I also think that there is, especially with some of the more, like you said, snow melts and sort of things like that, I think there could be an opportunity without putting our environment in risk. And I think, it would be helpful if DEEP had an opportunity to comment on those sort of things. I know they're submitting testimony. They couldn't make it today. But, it'll be interesting to kind of carry on this conversation because, this is maybe one area that does take businesses a long time to get things done. And if, things are sort of standard or renewals and it's pretty straightforward, information maybe hasn't changed from one period to the next, maybe there's an opportunity. Did you have a chance to think about the expedited renewal fees on how that might look if a company paid more to get things done a bit faster? Do you think that would be something that your members might be interested in?
Yeah, first and foremost, thank you for that. I think our premise for this is we want to make sure we're remaining competitive with our neighboring states. We look at Pennsylvania where they've passed this major third-party permitting reform on a bipartisan basis to help clear backlogs of permits, similar to backlogs we had in Connecticut. Now, I want to preface, our permitting structure is different from theirs, and it's only for certain permits. And we're not asking for this to be every permit. I think that would be difficult to administer as a whole. But there might be certain permits that DEEP could look at and say this might be appropriate. For the fee structure, it's certainly something the business community would be happy to pay an expedited fee to be able to move a project along faster. And I want to highlight that the faster a project moves along, the faster those jobs get hired, the faster construction starts on that project, the faster we build energy infrastructure across our state, the faster we develop housing across our state. We hear time and time again, our state's in a major housing crisis, and that's true. It affects our workers and it affects our economy as a whole. So the way that we could help to build the housing faster, redevelop sites, especially brownfield sites. We were very happy to see the Transfer Act finally put away and implement the new release-based regulations, something I was very proud of to work on for the last few years. And now that we have those properties that can get back into the development of the community, permitting is going to be a major part of that. So look at potentially a bottleneck there, and we're happy to have a conversation about if this proposal could work, or maybe there's a conversation to have if it's an expedited fee. Is it a combination? But we're more than happy to start the conversation about this. And I also think it's very important for messaging around our country. So we look at Pennsylvania, they're not necessarily a neighboring state, but they're close by. So when you're a business owner or an investor looking to invest in where you're going to put your money, where you're going to create those jobs, you could as easily put your money in Harrisburg as you could in Hartford. So you want to make sure that money's coming here and redevelopment in our state.
Great, that's very helpful. Any questions from the committee? Seeing none. Oh, I'm so sorry. Representative Gucker.
How you doing? Sorry for kind of a little confusion there. No problem. What popped in my head, I used to be in the construction business, was the expedited fees. With these expedited fees to speed up the process, would that be DEEP's inspectors having to review this, or would this be that third-party group we were talking about?
I think for that proposal, it would probably make the most sense for it to stay within DEEP, but I think it's certainly something as we develop a framework, because I know there's a similar legislation before the Commerce Committee to develop a third-party framework. Potentially, that could be something for the third party. I wouldn't want to overtax our state employees and make them do additional work there where it's not feasible. But if it's feasible and there was an allocation in the budget to help do that, I think it's certainly something that would be appropriate.
Would you think that, what my fear is that if we have a fee structure set up to where there's more revenue going to come in for expediting a project because the developer's willing to pay more, would that sideline other projects, and then thus those other projects that don't have the extra capital to be able to invest to get the expedited review process, would their projects languish as a result of this expedited fee search?
And I appreciate that question. I think that's part of this is we have to make sure specific permits are available for this. So look at the snow melt permit, for example there. We've heard stories about it being applied in early February. We're not going to have the permit approved until end of March. Well, the snow's gone. So you've had that whole time period there where it's not feasible. So that's something where it could be a revenue generator for DEEP to help offset some of their additional costs, help businesses get back and operating. And if it's a construction job specifically, those are jobs that are back working and helping to contribute to our economy. So I think it's had to be specific permits. I don't think this would work for every permit. I don't think the business community would want that for every permit. But I think for a small, medium-sized business who doesn't have the ability to hire a lobbyist who can call legislators or call the governor's office or DEEP to complain about it, I think it's certainly something that a small business would be more than happy to pay the expedited fee to get it operational as fast as possible.
All right, well, thank you for your testimony.
Yeah, thank you very much. I look forward to continuing the conversation.
Thank you so much. Number 33, Jessica Marshall. I don't see her online. Is she in the room? No. Okay. Next I see Colina Siskenker.
Thank you. Members of the Government Oversight Committee, I'm Colina Sisenker. I'm a professor of philosophy at CT State Gateway. Before that, I taught as an adjunct at Three Rivers Community College, so I've been in the community college system since about 2010. I've been a chair of the Faculty Advisory Committee to the Board of Regents for a little over 5 years, and that puts me as an ex officio member of the board and its Academic and Student Affairs Committee. And I was also on the Academic and Student Affairs Committee of the Students First Consolidation Committee. So I have a sort of front row seat to this process that you hope to oversee with SB 423. I want to say that the reason that I strongly support a bill that requires detailed accounting of the results of the consolidation is the exact same reason that I think we have reason to be cautious about what is measured and how with this bill. Governance bodies and unions across the system strongly opposed the consolidation in the way that it was justified at the time, before it was implemented. And now we are living with its consequences. SB 423 proposes to measure whether the consolidation delivers what it promised, but what it promised was never what was best for students and the state. So for example, item 1A measures the extent to which the new college meets certain completion and momentum goals promoted by a number of national think tanks, but that cause real concern for members, for faculty in the disciplines for which we're asking to make sure that people are in college level math and English in their first year. There is real concern that pushing towards this goal would transform what is on paper an open enrollment institution into one that is functionally not that. And that would be just an unfortunate and unjust gap in opportunity for our state. We know that in other states where these sorts of reforms have been implemented, they've had to be reversed. In particular, folks from California came to present to us at FAC to tell us about how it lasted just a little over a year, and then they had to undo it. And yet we've been addressing this for quite some time in our system, and we're moving towards that. The effort to use this as a measure of success, as long as there isn't more nuance and justification to allow for modifications of those initial goals, I worry is going to incentivize a faster push towards something that might be ill-advised. Regarding 1B and 1C, and I have these remarks in writing that will have more detail, but our students are more likely to work more than one job, to have dependents, to serve as caretakers in some capacity with their extended families, to commute, etc. The idea of getting students through faster is appropriate for some students, but certainly not for all. And I think it's very likely that we're not going to see a significant increase in the number of students that move in that direction. And that is actually a testament to the wisdom of our staff and their investment in the students' own success. The initial financial model for this consolidation required that we hire advisors on one-time money in the hopes that they would advise students into enough courses that the tuition money would pay for their salaries, right? That was the model. And it was just not a wise way to go. So we want to make sure that, again, in tracking these things, that there is some nuance, and that if we don't meet those metrics, that we can explain why the new direction is better. Again, taking courses at multiple campuses, the question is how many students are willingly or intentionally
Please summarize.
attending more than one campus. Absolutely. And I just want to list a few other things. Seamless transfer was a goal of the CSCU system implemented in 2011. The CT state cannot do it itself. Shared services has been a bit of a disaster, etc. So I do want to say that as long as there is more, there is some nuance and explanation and justification, and I would love for us to provide some input as to how we can better measure whether or not this community college serves our state and our students. Thank you.
Thank you so much. And I appreciate your testimony. I don't know if you had a chance to look at the Chancellor Maduka's testimony. If you had any comments on that.
Well, I glanced at it and I will say that it was, I mean, I think it's sort of consistent almost with what I'm saying, that it on many fronts we have recognized that we need to move in different directions or at a different pace, etc. And it is great to have that kind of flexibility to modify the direction of what this institution would look like. And hopefully over time there will be more significant input, because that was the problem at the beginning. There was not enough meaningful input from the professionals who actually like are one-on-one with our students day after day. So as we improve those systems and that governance, hopefully we will improve the direction that this is going and have, better outcomes, better measures.
Got it. Thank you so much. Somebody else mentioned earlier today that in many of the campuses, students are being sort of forced to take classes online because there's not the options. It sounds like you're having that same experience where you are.
Absolutely. And I actually am about to go into a class at 5:30 with a student who is, I believe he lives in Vernon, is taking a class at Asnuntuck, another at Gateway, another at, it might be Naugatuck Valley. I'm going to encourage him to submit his written testimony if he feels like he can. He's a very capable student. It just did not have options at the time that he was registering. And that happens more and more. Yeah.
That would be great, because that is something I heard at doors when I was door knocking last summer. So appreciate that. Appreciate your comments, and thank you for what you do for the young people of our state and getting people an opportunity to learn new things. So thank you so much.
Thank you so much.
Any comments from? Nope, seeing none. Great, thank you.
Thank you.
Next, we have number 37, Melody, Eileen Melody. Okay, she's not there. Number 38, Ed Hawthorne.
I appreciate the post-it in this committee. Good. Well, evening at this point, Government Oversight Committee. Good evening, Senator Gadkar Wilcox, Representative Datham, Representative Gucker, Representative Carty. My name is Ed Hawthorne. I'm proud to serve as the president of the Connecticut AFL-CIO, a federation of unions representing approximately 250,000 working people here in the state of Connecticut. I'm here on 3 different bills here today. I'll do my best not to get buzzed by our clerks over there. First, to start out with, just because Kalina actually did said it best, she lives it every single day, but we did have concerns when the consolidation happened with our community colleges and state college systems. Nearly all of those concerns have come to pass. Faculty have seen firsthand how consolidation has disrupted advising, course scheduling, program availability, and supports that students rely on to succeed. That is why strong ongoing legislative oversight is not optional, it's essential. This bill moves in the right direction by strengthening reporting requirements, but reporting only matters if it includes the right data. To understand the true impact of consolidation, the General Assembly needs clear information on student retention, graduation, transfer rates, course availability, enrollment patterns, and equity across campuses. We invite you to work directly with our dedicated professionals at SCIU, the 4 Cs. Next, HB 5477, not concerning the well-being of employees of the Department of Corrections and persons who are incarcerated in correctional institutions. Correctional officers perform one of the most difficult and dangerous jobs in the state. I always tell people I've been to prison twice, and everyone always looks at me just like that. It was on a tour. And, it's very hard to be in that building. When the door closes behind you, you realize you are not armed, you don't have anything on you, and you are outnumbered in there. That's why we believe that this bill improves the reporting and investigation of sexual abuse and assault inside correctional facilities. It creates clear reporting mechanisms, including a dedicated hotline, requires additional training, and strengthens accountability for reporting and intervention. Our correctional officers are overworked. They're being mandated for shifts. They're understaffed. This bill would help provide some clarity for an otherwise very difficult job. And lastly, HB 5475, an act concerning oversight of the permitting processes of the Department of Energy and Environmental Protection. We do oppose the privatization. Outsourcing introduces conflicts of interest. Third-party consultants are ultimately accountable to the clients who pay them, not the public. And if privately reviewed permitting goes wrong, it is unclear who would be held responsible. At the time when federal environmental policy is shifting rapidly, the answer is not to privatize public oversight. It is to strengthen the agency charged with protecting Connecticut's environment, and we urge the committee to reject this bill. Thank you very much for your time, and I'd be happy to answer any questions that you may have.
Thank you, Mr. Hawthorne. It's really helpful. I saw your written testimony and appreciate that. And I think your comment about prison and what the COs have to face every day, it's very dangerous and very stressful. I can only imagine, which is one of the reasons why we wanted to put in some supports, additional training for them, support system to help them confidentially report any sort of mental health challenges or things. I think, it's really concerning to me to read about not just the mental health conditions, but also, the number of CO suicides and how many of these are preventable. And the job doesn't just affect the CO, and it affects the whole family. And we need to remember that. And that was one of the reasons behind some of these sort of suggestions that we'd like to look at. So I appreciate that. Any questions from the committee?
Thank you, Madam Chair. Good to see you, my friend.
Good to see you.
So did you hear my question of the previous testimony as far as the expedited fees towards getting projects through the environment through DEEP quicker? And my concerns were, would it slow down other projects as far as their workload?
Don't have the answer to that, but I know that the backlog is coming down with what we have now. So, we're not trying to hold up projects. These projects are important, but we're really concerned with people being accountable to the public and not to clients. And really, that's what privatization will end up doing. They'll have a different boss than the people sitting here in this building.
I had those concerns as well. I was just trying to be a little more reserved about it. But you're right. As somebody, one of the things we probably have in common is the construction field. So we've seen how sometimes that may become a roadblock rather than a help.
Absolutely.
All right. Thank you.
Thank you.
Any other questions of the committee? Thank you, sir.
Thank you
all. Let's see. Item number 39. Number 39, Evelise Carrera.
Hello. I'm going to click over now to my notes where I have my testimony. I'd like to begin by thanking the committee for allowing me to speak today, and my notes app is there we go. Okay, here we go. I came here to support several bills, beginning with 424. 2 years ago, my son gave legislative testimony to protect his 504 plan, and he's currently a high school senior and an honor student and accepted into 28 colleges because his 504 plan allows him a quiet testing area for his ADHD. I'd also like to point out that the reason Connecticut might have higher numbers for 504 plans is due to access to medical care not available in Southern or Midwest states. For Bill SB 5476, the Berlin Turnpike is nationally known for child sex trafficking. Whatever we can do to end that nightmare is welcome. Thank you for introducing this bill. For SB 5477, as a prison reform advocate with BLM 860 and the administrative assistant at Stop Solitary CT, the number one complaint that I've seen is lack of healthcare followed by lack of programming and lockdowns. People want to do better and get better. Please help the nurses who are overworked and have their own mental health impacted, and help the residents of prisons, 94% of which will be released back into society. OPM needs to authorize hiring medical staff and COs in greater numbers. This upfront investment will save the state millions in lawsuits. And I just want to echo everything that Barbara said. Next, my support for SB 5477 comes as a youthful offender and resident or former resident of Long Lane in York, CI as a child. First, I wanted to echo what Alex Brown said. Next, as a child, I was told by a CO to bend over until you can see me and spread them and wanted to die. I didn't know I wasn't supposed to be strip searched before non-contact visits, and yet this happened to me multiple times. While it didn't happen to me, multiple girls in the YO tier were coerced to have sexual contact with correctional officers and then given bubble gum. The staff member then told the girls that if they opened their mouths, they'd be charged with prostitution. So I would like to add education of PREA upon admission to the facilities at York, MYI, and other facilities. And I'd like to echo what Alex said as an amendment to ban segregation of victims of that report. The last thing a victim of sexual assault needs is to be alone with her thoughts with no support from family or access to friends. Finally, please close Osborne CI. And I say that not only is the wife of someone who was released from Osborne 13 days prior, but is an advocate who is ready to answer questions about water quality, safety hazards, cell size, and why blocks A and Q were closed and inaccessible to both staff and residents of Osborne. Thank you very much for allowing me to speak today.
And Elise, thank you for your testimony, especially your activism. I was kind of looking forward to seeing you in person. Last time I saw you here with your newborn, it was very refreshing to see you carrying forward with your advocacy with the kids. But also, I really want to commend you on your bravery for talking about your experience, because I think far too often we don't hear about those experiences and we don't really see the human component. We just see a bill. And I think the importance of yourself and others coming forward, though you could tell in your voice that it's a very difficult situation, especially I'm sure each time you talk about it, you're reliving that horrible time, but recognizing the importance of doing so to really make sure that we here in the state do all we can to make things better. With that, are there any questions of the committee? Well, thank you again for your testimony.
Thank you. You guys have a nice day.
Next up, number 40, Ramon Garcia. I don't see Ramon. Well, Mr. Fernstein, what would you think? You would like to be the next gentleman up?
Thank you. I would say it's a long day, but I'm used to doing the education committee where hearings generally go to 2 in the morning. So this is early. But I'm glad to sort of conclude today's witness list. I'm here to talk about 424. Clearly, we need to backfill for the loss of the Federal Office for Civil Rights to pursue disability complaints for students in Connecticut schools. The federal office has existed for years, but it's been largely hollowed out by the current administration, and even to the extent that there is some staff remaining, their enforcement priorities are such so that disability claims have fallen off the charts. It was about 35% of complaints 2 years ago. Of complaints resolved 2 years ago, it's down to 1% now. 424 attempts to do that by taking the Office of the Ombudsperson, the educational ombudsperson created by Chairwoman Gadkar Wilcox, and enhancing its authority and giving it jurisdiction over these issues. We're delighted to see that happen, but it would be a cruel joke indeed to tell people that their rights are going to be protected by this office, which at this point does not exist, and which is, at least according to last year's OFA estimate, going to have one professional and one clerical. What we do know is that there are approximately 250 OCR complaints from Connecticut a year, that if you take the current ratio of what the Department of Education does with its complaints, you need one professional staff member for about every 40 complaints. Therefore, you would need an office that includes all those people, plus there are enormous other functions that are in the ombudsperson office, which would also need would need staffing. Further, we've got to be clear on what the ombudsperson does. Normal ombudsmen, their job is to resolve issues, and usually in a non-confrontational way. OCR and these complaints are, hopefully could be non-confrontational, but ultimately they have to be confrontational, and ultimately the office has to have the power to issue corrective action. And that's an entirely different sort of scope of the ombudsperson office. We have, without getting too far into the weeds here, let me just say that we at SEEK are willing to devote endless hours to trying to perfect this legislation. It's very important to get it right. And in its current form, there are lots of concerns about it, but let's work together and get something that's right. And of course, I'm also, like everybody else, testifying upstairs at Human Services, which is considering assigning all these disability complaints to CHRO. And so you guys ought to figure out where they're going. There are three possibilities, and I've got, there are concerns with each one of those. A bolstered ombudsperson office would really be very helpful as the place to go, but only if it's funded and only if it's staffed correctly. So thank you, and I'm glad to discuss this further now or at some future time.
Thank you so much, Andy. And I'm sorry I missed the beginning of your testimony, but I'm glad you underscored the importance of the ombudsman. And I also agree, and as you know, because we've been talking about this before, that could be essential for a number of kind of educational functions, but particularly to help also build that relationship, because when there is a disruption, because parents or families don't feel like they're getting the services they're entitled to, or there's a problem with whether it's discrimination or, again, just oversight of the needs of their child, that breaks a relationship. So it's important to have someone in the middle who's an intermediary who can have oversight on this process, and also ultimately that helps strengthen those relationships. And I appreciate you mentioning the work of the CHRO. Actually, we did get testimony from Executive Director Tanya Hughes, who also supports the idea of and working in conjunction with the CHRO supports the idea of the Ombuds office. One of the questions I have for you, given you're right, it will require an actual investment in resources. If you had to prioritize sort of the functions of this office, how would that list be organized? What would you say are the most important functions of this office or somebody in that role?
Well, look, there are actually three places. The third place where this could be is obviously the Department of Education. And the Department of Education does, under federal law, have the responsibility of taking and investigating complaints about violations of the IDEA. And there is substantial overlap, but not complete overlap. It's not, civil rights disability law is somewhat different. My first commitment, my first goal this year is to create a state office that does what the Office for Civil Rights used to do on the federal level. And that would be my first goal there. The other functions of the let me step back a little bit on the bill. There are a number of reports required in the bill and some more data to be collected. And I got to say, we're beyond reports. We need action, not reports. We'd have the data. We know, well, we don't have great data on 504, but we have some data. We need, you know, if there's a problem, let's not admire the problem. Let's fix it. And so the reporting function, I'm not very keen on. And also, there's the task force on there, the working group, and you know, a little surprised to see that parent groups were not included there. And you know, we think that SEEK and CCA and legal aid probably ought to all be on there. But the other functions, we could have a much longer conversation about how you bring peace in the special ed world. All I can tell you is that nationwide, over the last 5 years, the number of written state complaints has doubled. The number of due processes has gone up about 50-60%. It is becoming far more confrontational process. I don't know whether that's uniquely special ed or whether it's society in general, but I would hope there would be a way to move towards a less adversarial world, but I'm not sure I see it.
So, yeah, if I understand you correctly, it's the investigative role that is really the kind of critical one.
Investigative and ordering corrective action where
And
necessary.
corrective action, yeah, great. Thank you so much, and thank you for your testimony.
A couple people this morning, earlier on, testified to an idea that they said if a child has diagnosed with ADD or ADHD, they would automatically be put in a 504 plan. And they didn't feel that there was enough testing to see if they actually belonged there. And it was demanding of a lot of resources of the schools. Have you seen or heard of anything of that? Or have you any findings or ideas on that?
First, attention deficit disorder is very widespread. If it interferes with the ability to access an education, you're at least entitled to the protections of Section 504. If, as a result of that, you need a modified curriculum or specialized instruction, then you're entitled to an IEP under the Individuals with Disabilities Education Act. I really see the problem the other way, which is a lot of kids with really serious needs are not getting the protection and the services they need. I also, and this is just from practicing for however many years I've been practicing, think that we're like calling a lot of things ADD, which are in fact something else. Part of that is, as everybody in the field will say, these are the kids who can't focus on English for 30 seconds, but can focus on a video game for 6 hours. So it's not an attention deficit, it's an interest deficit. And what are we doing about the curriculums of schools to actually engage kids, and frankly, to engage kids in things that are going to be useful for them in the future? So, I mean, I think that I think the whole area of attention deficit is something that really needs a lot of work. And the other thing I'd say about attention deficit is that we do a lot of accommodating to deal with the attention deficit, but do we do anything to actually give kids the skills to overcome it? That's would be really what I would be looking for. How do you deal with that in a way that makes a kid focus and organize? And attention deficit is very closely related to executive functioning deficits, and which is a similar sorts of situations. How do we teach them the skills to function effectively in society? That's what schools are all about.
Well, thank you. I'm sure as we go through this process, we'll be reaching out for expertise from yourself and others.
I'd be delighted.
As somebody who has dyslexia and grew up in a time that we really didn't have these programs, and I know students such as myself probably could have benefited from them. This is a very, special subject for me. Thank you, Madam Chair.
Thank you, Representative Gucker. Do we have any other comments or questions? No, thank you,
Well,
Andy.
very good to see you guys, and thank you very much.
Thank you so
Back
much.
upstairs.
Thank you so much. Okay, I think that, thank you so much, Representative Gucker and Representative Carney here till the end. So I think that concludes our public hearing for the Government Oversight Committee today. Thank you, everyone. Have a great night.